Hi everyone, very good morning. Thank you all for joining us to fourth Global Youth Meet on Health organized by Hriday and this pre-gym workshop on meaningful engagement of youth to build that better organized by WHO Country Office for India and Hriday. My name is Dr. Astha Chok and I'll be facilitating this session today. While the participants join in, I request everyone to please change their name to their name and the organization. You can do so by going on more on the right hand side and changing your name. You can rename yourself. Then you can also introduce yourself in the chat box. I have posted a message also in the chat box, so please feel free to introduce yourself in the chat box. And if you have any questions, please you can post it in the chat box as well. We will be happy to answer them. Yeah, don't forget to tag us on social media at Twitter at Hriday-Shan and use hashtags #2021 and #Youth for Health. To provide the welcome address for sharing the objectives of this workshop, I would like to invite Ms. Radhika Srivastava, who is the Director Health Promotion Hriday, and also co-chair of Organizing Committee of 4th Global Youth Meet 2021. Over to you, Ms. Radhika.
Good morning, everyone. Thank you so much, Astha. A very warm welcome on behalf of Hriday and of WHO India to all the participants of this pre-Global Youth Meet on Health workshop on meaningful engagement of youth to build back better. We are having this workshop in unprecedented times. All around our country, there is this devastating second wave of the COVID pandemic that has hit all of us and hit us even harder than what it was last year. Amidst all the negativity and challenges that we face, we find that the Global Youth Meet on Health and this particular pre-conference workshop is like a light of hope. The intent really was to bring young people across the country together to discuss how has the pandemic impacted them, whether it is in their daily lives, their families, how has it impacted their advocacy campaigns. There were plans that were lined up for 2020 and even 2021. What have been the lessons learned? How have challenges been converted into opportunities? And that is really what is the essence of this meeting. It is a curtain raiser to the main event, which is the 4th Global Youth Meet on Health, which officially starts at 1:30 p.m. today. All of you would have received links. If you have not, please feel free to connect with our team. But essentially, along with our colleagues at the WHO India office, we have tried to create and plan these next 2 hours to provide an opportunity to all the participants to express their views on the ongoing situation and how alternate approaches during COVID times can be adopted to promote healthy lifestyles, especially with a focus on prioritizing mental well-being. So my request to everybody is this is a safe space. Please feel free to talk freely. We have designed an interactive agenda. There will be scope for group work. And so I would request everybody to interact freely and please keep posting on the chat. I would invite, since there is a paucity of time, I would request everybody to write their names and their organizations and the city or the state that they come from. So essentially, in terms of the objectives, we want to provide an overview about the adolescent and youth-related health issues in our country, as well as underscore the need for a robust youth-led action with respect to non-communicable diseases, universal health coverage, and SDGs. I'm going to stop here and thank you so much again for joining, and I hope that you have an enriching workshop as well as the next 2 days at the Global Youth Meet on health. Astha, over to you.
Thank you, Radhika, for providing us very brief introduction about GYM and giving us an overview about what we can expect from GYM 2021 this year. Now, to provide the inaugural address, I would like to invite Dr. Fikru Tulu, Team Lead NCD, WHO Country Office for India. Thank you, sir, for joining us. Over to you.
Thank you. Good morning, everyone. On behalf of WHO India, I would like to congratulate RIDE and my own organization, WHO, for organizing the fourth GYM and this pre-GYM, which is focusing on the meaningful youth engagements to build back better. I would also like to welcome the youth participants to this pre-GYM workshop. Dear participants, as you all know, we live under the heavy clouds of the COVID-19 pandemic, especially during the second wave. We currently function under lockdown in Delhi and some cities. COVID-19 has impacted on lives and livelihoods of millions in India and around the world. I would like to remind everyone about the powerful tools we have at hand for breaking the transmission of this virus. I'm sure you are all aware of the 3 Ws. Wear a mask, wash your hands, and watch your distance. We might also add a few more tools, 1 or 2 Ws. I would say, wait for your turn for vaccination. And apparently from May 1st, everyone 18 years and above will be eligible for COVID vaccination in India. 1 more W would be work from home. Work remotely or virtually. And of course, this does not apply to many migrant laborers and others, but many young people have this opportunity. Indeed, we have quite effective and powerful tools against COVID-19, but the tools could be powerful and effective only as far as they are applied. There is room for advocacy and leadership from young people to promote awareness and action on the 3+ Ws. Dear participants, COVID-19 is not the only global challenge facing us today. Non-communicable diseases and their risk factors present a formidable challenge to our health and well-being too. Even in the era of COVID-19, NCDs and their risk factors remain the leading cause of illness and death worldwide. And we are mainly talking about 5 common non-communicable diseases: cardiovascular diseases, diabetes, cancers, chronic respiratory diseases, and mental illnesses and substance abuse disorders. And the 5 common risk factors to this are tobacco and alcohol use, poor diet high in fat, salt, and sugar, physical inactivity, and air pollution. These are important risk factors. And now, these days, we talk about a 5x5 approach, 5 NCDs and 5 risk factors. Now, for example, tobacco use alone accounts to more than 1 million deaths annually in India. This is more than 10 lakh deaths just due to 1 risk factor, which is tobacco use. And this happens through cardiovascular morbidities, tobacco leading to cancer, diabetes, chronic respiratory diseases, and etc. We know how to prevent NCDs as well as infectious pandemics like the COVID-19. However, it's not enough to know. We need to disseminate awareness, coordinate our action, advocate, lead, and act. Like pandemics, NCDs are not just a health problem. They are rather a threat to social and economic well-being of individuals, societies, nations, and the world at large. In short, NCDs are a challenge to sustainable development. NCD risk factors, alcohol and tobacco use, poor diet, physical inactivity, and air pollution, etc. Most of them are the outcome of economic and social activities that take place at individual, societal, and sectoral levels. So individual behaviors, like in the case of tobacco and alcohol use, shaped by social, cultural, environmental influences, contribute to the occurrence of risk factors. This is also determined by policies, political and economic strategies of a country or a region. Different sectors have different roles to play, some negatively, others positively. So sectors across agriculture, education, health, finance, trade, transport, industry, etc., will all have varying contributions and roles. For instance, the agriculture sector produces both healthy foods, fruits and vegetables, as well as tobacco. Trade policy promotes tobacco and alcohol, unhealthy foods, etc. Industry, specifically the alcohol industry, tobacco industry, processed foods industry, will influence access to both healthy and unhealthy products and choices. So one sector alone, like the health sector alone, cannot deal with all the risk factors and the underlying determinants of NCDs. The health sector obviously is at the receiving end of the burden of diseases due to these risk factors and NCDs, as the sector is responsible for healthcare provision along the continuum from health promotion, disease prevention, early detection, treatment, and referral, and so on. Other sectors of government also suffer economic impact of NCDs to varying extent due to the cost of illness to their employees, the loss of lives, the loss of productivity, and etc. There is a need for all sectors of economy and society to work in a coordinated manner towards a common goal of better health and well-being for all. And this is at the center of the SDGs, as in SDGs 3. I would quickly mention one important milestone in the evolution of the NCD agenda, the non-communicable disease agenda globally. You may be aware of the 2011 UN General Assembly, which came out with a political declaration. So in 2011, the UN governments and heads of state met at the UN and discussed the challenge presented by NCDs and their risk factors. And they agreed that NCDs are not just a health problem. They are not just a public health problem, but they are a challenge for national economies and for sustainable development around the world. So the 2011 UN political declaration called for a whole of government, whole of society, and whole of UN approaches to the global NCD response. And they said business as usual is not working anymore. So that's where meaningful engagement of use comes to picture, actually. So meaningful engagement is a key to the whole of society approach to the global NCD response. Youth, women, people living with NCDs, and all other sectors of society will have important contributions to make. So in conclusion, WHO promotes a coordinated multi-sectoral response to prevention and control of NCDs and their risk factors through a whole of government, whole of society, and whole of UN approaches. We also recognize the growing significance and influence of young people in building back better through advocacy, decision-making, and leadership in matters of health and development across their peers, communities, and beyond. Young people have a particular advantage due to their literacy and affinity to technology and social media in particular, to influence behaviors and actions of their fellow youth and their societies. So meaningful engagement of youth is the right approach to tap and harness the potential of young people for positive change. Finally, let me just share one information that WHO is also conducting another global event on similar topics this weekend, and it's called the Global Youth Summit 2021. And it's taking place during 23 to 25th April. And you can find more details and the link to this summit at the WHO website. I wish you a productive pre-gym and the entire team. Thank you very much.
Thank you, Dr. Fikru. And as you have rightly pointed out, that NCDs have a broader impact on not just health, but beyond it. And therefore, during this era of COVID-19, it's very important to address NCDs with a holistic and integrated approach. Now, to provide the overview of adolescent and youth health-related issues in India, I would like to hand over the mic to Dr. Pradeep Joshi, National Professional Officer, Health Promotion and Social Determinants of Health, WHO Country Office for India. Over to you, Dr. Joshi.
Thank you, Asa. And it's really a very great opportunity for me to connect with you all, especially the youth people, which have the potential to change. Friends, adolescents and youth, which we primarily mention from age group 20 to 24 years, is a stage which is considered as most healthy stage. But despite that, as you have heard in the previous session, this age group is at the significant risk for most of the health condition, and that are avoidable also. So today I'm going to just briefly touch on some of such issues. First, let us discuss about what is the pattern of mortality or deaths among the adolescents. So injury, which we called road traffic accidents, drowning, violence, self-harm, are the leading cause of mortality or deaths among adolescents. And especially if we talk about India, 44% of the total deaths, which is about 123,000 of deaths, is mainly because of these conditions. And in that, friends, you will be surprised to know that 16% of those total deaths are due to the suicide, and another 12% is due to the road traffic injuries or transportation injuries, which are quite avoidable. The other cause of deaths which occur in the age group are related to the early pregnancies and childbirth, which I will touch later on, and is also grave concern, especially in the lower socioeconomic status condition and some of our states in India. Friends, beyond mortality, as I have told, their youths and adolescents are exposed to multiple risk factors, which leads to the diseases in the later stage of their life. And once these habits are being formed, they are carried in the later stage of the life also. You will be surprised to know that this kind of 1 in every 2 adolescent or youth is exposed to one of these risk factor, which Dr. Fikru has previously mentioned. And this leads to the very early onset of major diseases, which you have heard in your family members also, like diabetes, cardiovascular diseases, cancers, and chronic respiratory diseases. And we witness this almost 10 years earlier than the Western counterpart because of those risk factors. So let me start with the first one, the tobacco, which is which will be highlighted by subsequent speakers, but I will just try to highlight some important aspects of that. If we say about the age group, 15 to 24 year age group constitutes of around 250 million people, and tobacco use, which is harmful in any way, it's harmful. Still the prevalence is very high among the youth and adolescents. The recent survey, which we call as Global Adult Youth Survey, have given some positive news. In the earlier GATT survey, the prevalence was 18%, but now it has reduced to the 12%. But this 12%, if we talk about in the numbers, it constitute about 30 million of the adults and the youths which are still using the tobacco products. And that can be easily preventable, which will be highlighted by my subsequent speaker. The second risk factor, which I'm just touching, is alcohol use. It's again a major risk factor which causes health. It has neurocognitive effects which lead to the emotional, social, and the academic learning disturbances. And friends, again, you will be surprised to know that the age of initiation of alcohol, which was around 28 years, 20 years back, has been reduced now to only 13 years. It's as low as 13 years. And the prevalence of alcohol use, and you all know that the legal age of drinking is all of the states is above 18 years. Still, the prevalence of alcohol use among 10 to 17 years is 2%, and in numbers it is 5 million of adolescents are using alcohol. And in that, the heavy episodic drinking, which is like drinking 6 standard drinks or more in one go, is as high as 0.6%, and it is equal in male and female in that sense. So alcohol, which causes lot of other conditions including cancer and road traffic injuries, is also one of the concern. Let me touch on the third aspect, which is physical inactivity. Physical inactivity, you are all aware, if a person, WHO recommends around 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity aerobic exercise throughout a week for a healthy adolescents. And you will be surprised to know that 1 in 3 adolescent doesn't meet the WHO global recommended this physical activity targets. And that is of grave concern, because physical activity is have very good benefits, and it has been proven it protects you from the range of diseases and also have the psychosocial benefits. Let us come and touch on the fourth aspect, which is on the nutrition. Undernutrition is still a problem in our country. 40% of the adolescents, and especially girls, are still suffering from anemia, and around 18% of boys suffers from the anemia. And as usual, the girls suffers more because they have multiple nutrition deprivation and little autonomy. The other concern which is rising is the obesity and overweight among the adolescents, and it is increasing since last 2 decades. The prevalence of obesity in the recent survey as obesity and overweight has been found around 5%, which in tune of 12 million of adolescents are suffering from these diseases, which leads to the diabetes. And you will be, again, the facts, because I'm talking about the facts, the pre-diabetic. Diabetes is something which we used to consider that it starts after 40 or 45 years of age group. But you will be surprised to know that the pre-diabetic, the raised blood glucose level among adolescents, 1 in 10 adolescent is having the pre-diabetic, which means that in the next few years, they are going to become frank diabetic. That is the problem we are. And this is because of the rising prevalence of overweight and obesity and physical inactivity. And let us talk about the junk foods, or the consumption of the foods which are high in fat, salt, and sugars. Around 17% of the adolescents, based on the survey, they have told that they use this high, which is we can call samosa, junk foods like pizza, burger, everything. They consume 3 times in a week, which is quite high, and that is the reason the obesity and the overweight prevalence is increasing. One of the important aspects, the fifth one, is about the mental health disorders. And the common mental health disorders, which we call as depression, anxiety, schizophrenia, is as high as 7.3%. This is based on the National Mental Health Survey, which is being done. And I'm talking about 13 to 17 years of age group, which contributes to around 9.8 million of those people which require some kind of help of this common mental disorders. And friends, India has one of the highest suicide mortality rate, which is around 11.2 per lakh population of the suicides. And 15% of the adolescents are suffering from 10 to 19 years are suffering from some kind of depression. And more than 40% of the adolescents, this is just like every second adolescent is suffered from some kind of bullying in that aspect. That was briefly I have touched on. It will be more in detail will be touched in subsequent sessions. The sixth, which I should also mention, about 1 in 5 girls are married before 18 years of age group, and around 7 to 9% of these married girls are either having pregnancy or are already mother, and that put them at the risk of higher risk of deaths. So that was basically, I'm not touching about the HIV, which you HIV and other thing, which is also important component of the adolescents, and around 41% of the women and 25% of the adolescent male doesn't know aware about the HIV AIDS also. So friends, this were considering the time limit, I'm just focusing on what were the major adolescent or youth related health problems which are there. And in the subsequent work groups, we will going to discuss how to tackle this kind of problems which are emerging and which are increasing over the period of time. That's all from my side. Thank you again for patiently listening to me. Thank you.
Thank you, Dr. Joshi. So सिर्फ इसको हिंदी में एक बार कन्वर्ट करने के लिए, जैसा कि डॉक्टर जोशी ने बोला कि एनसीटीज जो हैं और जो हेल्थ इफेक्ट एस्पेक्ट्स होती हैं बच्चों में, वो हेल्थ इंजरीज बहुत ज्यादा आजकल, मतलब रोड एंड ट्रैफिक इंजरीज बहुत ज्यादा होती हैं। अल्कोहल कंजम्पशन एक रीजन है जिसकी वजह से एनसीटीज बढ़ रही हैं। तंबाकू का इस्तेमाल बहुत बढ़ रहा है जिसकी वजह से एनसीडीज पे पूरा इफेक्ट होता है। फिजिकल इनएक्टिविटी, हम जो जंक फूड खाते हैं, जो अनहेल्दी फूड खाते हैं, दैट कैन लीड टू एनसीडीज। उसके बाद में ओवरवेट एंड ओबेसिटी, जो कि एक बहुत बड़ा रिस्क फैक्टर है फॉर कॉजिंग डायबिटीज। और जैसा कि डॉक्टर जोशी ने बोला, taking food high in sugar and salt is also can lead to NCDs. तो मतलब कि हम नमक और चीनी ज्यादा खाते हैं, उसकी वजह से भी हमें NCDs हो सकती हैं। इसके अलावा मेंटल हेल्थ जो है वो यंग बच्चों में आजकल बहुत बढ़ रहा है। डिप्रेशन एंड अदर मेंटल हेल्थ इश्यूज आर राइजिंग बहुत ज्यादा यंग बच्चों में। Now for the next session, I would like to invite Ms. Prachi Khaturia, Project Manager Hriday, to present on robust youth-led action during COVID-19 and a curtain raiser to the 4th Global Youth Meet on Health 2021. Over to you, Prachi.
Thank you, Astha. Thank you very much. सभी का बहुत बहुत वेलकम है। I will try कि हम जो presentation है इसको जल्दी से finish करें ताकि हम of course next speaker पे जा सकें। And I'm very thankful that Dr. Fikru as well as Dr. Pradeep, they have set the stage for what the need for the youth health needs जो अभी emerge कर रही हैं, क्या ज़रूरतें हैं young लोगों की, उस पे हमने touch upon किया। और आगे आने वाले लगभग 1 घंटे 30 मिनट में हम लोग आप लोगों से भी सुनेंगे what your needs are, आपकी क्या ज़रूरतें हैं। तो इसलिए हम we look forward that आप लोग सब chat box का इस्तेमाल करेंगे, और हमें कोई भी आपका कोई point होगा तो हम ज़रूर discussion में include करेंगे। मैं अभी इस presentation के through I will try कि मैं आपको explain कर सकूं what is so why are we here today, in the sense the Global Youth Meet is starting today and has started today with this workshop. So over the next 2 days क्या क्या होने वाला है आप लोग पार्टिसिपेट करेंगे और अभी तक की जर्नी कैसी रही है। सो जैसे कि हमारे स्पीकर्स ने अभी भी हाईलाइट किया कि कोविड-19 पैंडेमिक से वी आर स्ट्रगलिंग, एवरीवन इज ट्राइंग टू कीप देमसेल्व्स सेफ, their family safe, and therefore it's very important कि हम जब ensure कर रहे हैं कि हमारी family safe है, we parallelly also try that we work towards a better health. Although this pandemic has provided a setback to the health of everyone in the country globally, but still हमारा attempt रहे कि हम लोग healthy lifestyle, healthy practices को adopt कर सके. So Global Youth Meet, as Radhika was mentioning at the beginning, it is a meeting where young people from all over the globe, they will be coming together and they will be brainstorming on how can they take forward their own health agenda over the next 2 days. कल शाम को जब हमारी क्लोजिंग होगी उस समय आप लोग सब सुनेंगे कि over these 2 days हमने क्या important takeaway messages derive किए हैं out of the Global Youth Meet. तो मैं आपको एक जर्नी पे लेके जाऊंगी मेरे साथ, जिसमें मैं एक्सप्लेन करने की कोशिश करूंगी कि पिछले लगभग हम लोग 8 से 9 महीने से क्या कर रहे हैं, इन 2 दिन में हम क्या करेंगे और आगे आने वाले कुछ महीनों में हम किस तरीके से एक्टिविटीज करेंगे. So just to give you a background and brief history about the Global Youth Meet, first Global Youth Meet on health was held in 2006 और 2021 में जो हम आज Global Youth Meet का proudly part है, this is the 4th Global Youth Meet, and the previous 3 Global Youth Meets, 2006, 9 and 2015, they were held in person in India, and the 4th one today and tomorrow is in a virtual mode for reasons that we all definitely know. So during these 2 days आपको बहुत opportunity मिलेगी to interact with experts, to interact with your own peers from across the globe, as well as youth health experts, to understand how can you as a young person also contribute, and it will be a great learning process for us. हम सब लोगों के लिए भी एक learning journey है जहां हम भी आप लोगों से बहुत कुछ सीखेंगे. जस्ट टू एक्सप्लेन कि हम किस तरीके से ये एक्टिविटीज करते आए हैं, हमने पिछले लगभग 7 से 8 महीने में, ओवर द लास्ट 7 to 8 months, we have been trying to engage with young people online, and of course that has been a big shift for all of us. Even for example studies, even for example school classes, college classes, everything is now in a virtual mode, and therefore we also shifted to adopting activities in a virtual mode. तो activities जैसे कि एक campaign हमने run किया, tobacco free future generation, ताकि सारे young बच्चे एक platform को use करके they can voice their own messages that even we are staying at home, we have restricted accessibility to services that keep us healthy, walking outside, playing outside, but even if when we are home, हमें वो strength मिले कि हम risky behaviors, as Pradeep was mentioning, we can say no to these risky behaviors, be it tobacco use, be it alcohol use, and also in terms of linking it to the overall health. So for example, from here on, when we get back to the normal life, as we call it, and we are hopeful that will happen soon, but we still take this as a lesson that we just not stay healthy at home, but when we are outside, we stay responsible, we try and adopt healthy practices, so it becomes a lifestyle for us. And COVID-19 should not derail that process. So that was the attempt over the last 8 to 9 months to engage young people through webinars, through social media campaigns, through poster making entries, and we are very proud that most of you who are present here, you would have participated in these campaigns and activities. So this was all to keep everyone engaged, so that when we come at gym, which is today and tomorrow, हम लोग बात कर पाए कि हम जुड़े हुए हैं, हम तब से एक साथ काम कर रहे हैं एक कॉमन कॉज की तरफ, और आज के बाद हम इसको और स्ट्रेंथन करेंगे और एक दूसरे के साथ और स्ट्रेंथन होके काम करेंगे. आज और कल के बीच में आप जो एक्सपेक्ट करेंगे, वो है पार्टनर्स, हमारे जो 26 पार्टनर्स हैं, हमें इनॉग्रल और प्लेनरीज हैं जिसमें आप टेक्निकल सेशंस के पार्ट होंगे, वर्कशॉप्स होंगी। आज अभी जो हम वर्कशॉप में हैं, इस तरीके से हम लोग टुडे एंड टुमारो लेटर इन द डे कुछ और वर्कशॉप्स में आप लोगों को एंगेज करेंगे। देयर आर more than 100 resource persons, esteemed resource persons who you will get an opportunity to interact with, as well as at the end of day 2, which is tomorrow, we will be able to develop a gym declaration, which is developed by young people and which focuses on young people and their needs, and also regional action plans. So across WHO regions, across 6 WHO regions, these priorities are highlighted, and these are taken back from GYM 2021, that we are going to work on these priorities as well. And then May onwards, we work on the implementation of these activities. And today, as Radhika was mentioning, this is just a curtain raiser workshop. After GYM in May, with WHO India support and guidance, there will be a leadership and communication workshop that will be organized that aims at building advocacy and leadership skills of young people. And therefore, then it will be followed with some digital activities. So it's a long journey, but we will stay together. These are just highlights of what you will see on social media. And of course, in the chat box, I have posted a social media toolkit, a communications toolkit. The hashtags that we're using are hashtag GYM 2021 and hashtag Youth for Health. And you can tag us on Twitter, on Facebook. In that toolkit itself, you will have some draft messages that you can use over these 2 days to generate momentum and to connect more and more young people. These are our esteemed partners. And these are the glimpses of the pre-GYM activities that we have been doing with young people, generating some videos, generating posts, generating posters, poster making competitions, some glimpses of the posters that we have received, the webinar series that we hosted. And thank you very much. You can follow us on Facebook, on Twitter, on Instagram, and we are available to chat with you whenever needed. I'll stop here. Astha, over to you.
Thank you, Prachi. Thank you for giving everything in a gist about Global Youth Meet 2021. Now, I would like to provide, the overview on the best practice Indian case studies on youth-led initiatives. I would like to invite Ms. Anagha Sharma, a youth-led health advocate from St. Mary's School, Dwarka, New Delhi. Over to you, Anagha, and I would request everyone to please post their questions in the chat box.
A very good morning to one and all present here. I, Anagha Sharma, will walk you through an exciting journey of St. Mary's School, Dwarka, which began in 2015 to spread awareness about NCDs. We, the students of St. Mary's, Dwarka, are trained and exposed in our formative years to holistic well-being. We perform an array of activities for all age groups. Since we believe in sharing our experiences with others, we connect with students all over the world and exchange information about NCDs in our respective countries. It's my privilege to take you through some activities that are conducted by our school. Students took part in a video conference to discuss and understand the occurrence of NCDs. Students have also participated in health promoting activities with Hriday. People were also explained about non-communicable diseases with the help of street plays. Here are some blogs and comments by our partner schools. Students and teachers also gathered for Youth Walks the Talk campaign for achieving good health, where everybody walked together to fight the rampant increase of NCDs. Our school, St. Mary's, is also a recipient of the Campaign Fuel Award for all the activities organized during the second Global Week for Action. This is the most recent Walk the Talk in January of 2020. We also observed Healthy India, Fit India movement, where art of cooking competition was conducted. Junior students also participated in Sports Day. Special fun-filled activities were enjoyed by students as well as teachers alike. School also organized yoga sessions for parents to promote health and fitness, self-defense for students, and various activities like skipping, calisthenics, and NCC initiatives were also organized during the same week. Our school also held an international United Nations, Model United Nations with Healthy India Alliance on NCDs. The school has led special emphasis on mental well-being of the students during online classes. Well-being of everyone is taken up as a priority of our school. It's imperative for constructive involvement of all stakeholders. Various activities like dance, music, yoga, and salad making were organized during the online classes for all students. All this we've achieved with the blessings of the Almighty, and we pray for his continuous guidance and support. Hoping for a nurtured tomorrow. Thank you.
Thank you, Anika. That was very detailed presentation about some of the activities, very good activities that you have been involved in. Now I would like to give over the mic to Dr. Astha Bagga, State Project Manager, Generation Savior Association, Punjab. Over to you, Astha.
So I would discuss the youth engagement by Generation Savior Association that has taken place over time. So at Generation Savior Association, we have always believed that youth has paramount amount of energy, and it is necessary that this energy is converted into positive forces. We believe that the voices, actions, and initiatives that are taken by the youth, they are turned into meaningful, universal, and equitable engagement that is good not only for the national forces, but also for the global good. What we do is we follow the three-step approach. From the very beginning, we try to include youth in our programs. Then we give youth constructive roles, that is their meaningful engagement. And the third is we support and train the youth. तो हम तीन तरह से कोशिश करते हैं कि हम जो बच्चे और स्पेशली यूथ के साथ जब हम काम कर रहे हैं कि उनको इंक्लूड कर सकें, जो भी हम इनिशिएटिव्स ले रहे हैं उसमें उनको मीनिंगफुल रोल्स दे सकें, और उसके बाद उनको जो भी सपोर्ट और ट्रेनिंग चाहिए वो हम साथ में उस चीज के देते हैं. तो थ्रू दीज थ्री-स्टेप अप्रोच we have done certain activities. Firstly, the sensitization activities. It has been proved scientifically that there is a deep relationship between COVID and tobacco. So our primary focus being tobacco control, we have done activities that helps you to know that being a tobacco user, they can be easily inflicted by COVID. Besides this, as Dr. Pradeep also discussed, obesity is one of the serious health issues in India. It is very ironical that India is a home of number of second largest obese children. Besides we primarily focused on the sugary drinks. So we also told the students that besides causing obesity, sugary drinks also cause type 2 diabetes and heart diseases. Also, we try to involve students in policy initiatives. जितने भी सरकारी initiatives लिए जाते हैं सरकार के द्वारा, चाहे वो सेंट्रल गवर्नमेंट हो, चाहे वो स्टेट गवर्नमेंट हो, तो उन्हें भी हम इन्वॉल्व करते हैं कि अगर वो इनिशिएटिव बच्चों के रिलेटेड हैं, तो बच्चों की राय उस चीज में ली जाए, उन विद्यार्थियों की या उन स्टूडेंट्स की राय उस चीज में ली जाए. So we ask students to write letter to Prime Minister for restricting the amount of trans fat in vanaspati oils and in food to 2%. Besides this, we also conduct regular youth rallies and student rallies. Since drug abuse is a major problem in Punjab, where 70% of the Punjabi youth are prey to drugs, and also the tobacco industry is interfering through conducting certain competitions. I take the liberty of saying Spell Bee on Conrod Challenge. They are conducted for youth, wherein youth interact with people from tobacco industry, and that is against the FCT 5.3. तो हम कोशिश करते हैं कि बच्चों को उन चीजों के बारे में बताया जाए कि कैसे tobacco industry आपको ल्योर कर रही है, और साथ में ही हम यूथ रैलीज निकालते हैं इसके रिलेटेड कि बच्चों को बताया जा सके कि क्या क्या किस तरह से वो ड्रग्स के चंगुल से बच सकते हैं. Every year we conduct a batch of 100 students from Punjab University from Department of Social Work and do their orientation, telling them about the role that NGOs play and how they can be an active member through voluntary services to NGOs. Since अभी कोविड के द्वारा हम ये चीज नहीं कर सकते, we conducted a webinar and told students the positive role they can play during the COVID times. Besides this, we also try to inculcate the youth groups through celebrating international days like the World Heart Day we celebrated, and we conducted a cycle rally wherein youth of Tri-City participated. It has been seen that during COVID, the sexual and the violence against students, young children has increased. It can be sexual violence, physical violence, or emotional violence. There have been scientific evidences that prove that such kind of violence against children has increased. अब बच्चों को इस चीज के बारे में जागरूक करने के लिए और कि इसके अगेंस्ट वो क्या कदम उठा सकते हैं अगर उनके प्रति किसी भी तरह का इमोशनल, फिजिकल, सेक्सुअल वायलेंस हो रहा है, we conducted a series of webinar wherein 1200 students from across India participated और उन्हें बताया गया कि वो किस तरह के कदम ले सकते हैं इन चीजों से बचने के लिए. We have always believed that youth is the hope for future, and I would request every student who is viewing this webinar through this medium to take part in controlling not only tobacco or NCDs, but every social evil. Youth is a force that can change the way the world is. And I would request everybody to be part of this change. Thank you.
Thank you, Dr. Astha. I think आपने बहुत सही बोला कि youth are the change drivers. They can actually be helpful in changing the atmosphere and मतलब गंदी आदतों को छोड़ के जो better future की तरफ I think youth can help us a lot. Now maybe we can take 2 or 3 maybe 2 questions in this open discussion. So I would like to hand over the mic to Prachi and Dr. Joshi.
Thank you, Astha. I did see that there were very relevant comments from the participants, and also Dr. Patanjali Dev Nair did stress on the importance of focusing on injuries and road crashes, but I'm still looking out for any specific question. There's one question, Pradeep, I'll just read it out. From Snehal, I would like to know if there is any existing or planned government schemes for awareness on prevention of diabetes.
Thank you, Prachi. So there is, you have heard about this Ayushman Bharat program, most of you. So it has one component which Ayushman Bharat actually has 2 components. One is Pradhan Mantri Jan Arogya Yojana, where the financial protection is being provided, वो मिलता है. दूसरा होता है हेल्थ एंड वेलनेस सेंटर, जो कि सारे 30,000 की पॉपुलेशन पे खोले जा रहे हैं. उसके अंदर वहाँ पर डायबिटीज स्क्रीनिंग का प्रावधान है, जो कि 30 साल से ऊपर के जितने भी वयस्क लोग हैं उनके लिए किया जाता है. And basically the health promotion part is also there. So it is ये दोनों urban और rural दोनों settings के अंदर functional है. So it is very closer to the community, जहाँ पर diabetes के बारे में awareness generation और screening और ये सब provide किया जाता है. दूसरा एक और प्रोग्राम है जो गवर्नमेंट ऑफ इंडिया का है, थोड़ा सा इसका जो नेम है काफी लंबा है, हम उसको बोलते हैं नेशनल प्रोग्राम फॉर प्रिवेंशन एंड कंट्रोल ऑफ कैंसर, डायबिटीज, कार्डियोवास्कुलर डिजीजेस एंड स्ट्रोक. तो ये भी हर डिस्ट्रिक्ट के अंदर है और वहाँ पर ये अपनी सुविधाएं प्रोवाइड करवाता है, जिसमें हेल्थ प्रमोशन है, अपॉर्चुनिटी स्क्रीनिंग है, जिसमें अगर आप किसी हेल्थ फैसिलिटी पे गए हैं 30 साल से ऊपर हैं तो वहाँ पर ये चीज़ें मुहैया करवाता है। दवाएं भी फ्री ऑफ कॉस्ट यहाँ सेंटर्स पे मिलती हैं। और इसके अलावा एक बहुत अच्छा प्रोग्राम स्टार्ट हुआ है, मैं अभी इसके चैट बॉक्स के अंदर उसका नंबर डालूंगा। इसको हम बोलते हैं एम डायबिटीज प्रोग्राम। ये गवर्नमेंट ऑफ इंडिया का है और ये फ्री ऑफ कॉस्ट है। इसमें आप मिस्ड कॉल करके एक रजिस्ट्रेशन करते हैं एंड ओवर 3 months ऑफ यू गेट द फ्री SMS अबाउट डायबिटीज। तो ये भी आप ज्वाइन कर सकते हैं, ये गवर्नमेंट ऑफ इंडिया का फ्री है।
थैंक्स प्रदीप। एक क्वेश्चन और है आस्था, जस्ट हम ये वाला क्वेश्चन और लेते हैं, इनफैक्ट 2 हैं एंड प्रॉब्ली देन वील हैंड इट ओवर टू यू। एक क्वेश्चन है, is schizophrenia common in India? And I think this has come from one of our participant. And एक और question है, why do what do I say when I see someone much older than me smoke on the street? I think so दूसरा क्वेश्चन कहता है कि हम अगर किसी अपने से बड़े को स्मोक करते हुए देखें आसपास तो हम उन्हें क्या बोले। I think ये बहुत ही ये सवाल है जो सबके दिमाग में चलता है जब हम किसी को तंबाकू इस्तेमाल करते हुए देखते हैं। प्रदीप, do you want to give any comments?
See, for tobacco, we have, I think Vineet is there and she can provide more insight into that one. And I will just, about the schizophrenia, which has been, it's not so prevalent in the India, but the depression is the more common mental disorder which is there. So that is more. और टोबैको के लिए जब तक विनीत बोलते हैं, अब तक एक पोस्टर अगर आपको ध्यान होगा प्राची, आप वो पोस्टर आप चैट बॉक्स के अंदर शेयर कर सकते हैं। दैट इज क्वाइट, वो लोगों को टोबैको से जितने भी हार्म्स हैं बॉडी के अंदर, कौन कौन से केमिकल्स होते हैं और किस तरीके से बॉडी को हार्म करता है, अगर उनको दिखा के कि अगर आप जो ये स्मोक कर रहे हैं या आप जो तंबाकू खा रहे हैं उससे क्या क्या हार्म्स हैं, आई थिंक दैट विल बी लाइक अ रियली एन एडवोकेसी। और दूसरा, नेशनल टोबैको क्विट लाइन नंबर भी है। अगर पर्सन हेल्प लेना चाहता है कि हम तंबाकू कैसे छोड़ें, अगर कोई एडोलेसेंट है या कोई यूथ है जो कि ये जानना चाहता है कि हम कैसे छोड़ें, तो सरकार की वो भी व्यवस्था है कि हम कैसे उसको करवा सकते हैं। विनीत है यहाँ पर, तो आई थिंक टोबैको वाला क्वेश्चन विनीत इज द राइट पर्सन टू आंसर दैट।
Thank you Pradeep, and good morning everyone. बहुत अच्छा सवाल किया है आपने, and I think अतुल ने किया है ये सवाल। You know, we are all, each one of us, no matter what our age is, we are all here to help each other and promote healthy lifestyles among each other. I'll give you an example of what I do when I see, and you've asked the question of when you see someone older than you smoking. I often see people much younger than me smoking, and you know, I always use an approach, a very personal approach, where you can very nicely smile at them and tell them कि uncle आप ये जो कर रहे हो, I'm sure you have children, grandchildren. Don't you want to spend, like, watch them grow up? And very, very nicely and respectfully, you can tell them that I'm sure you're aware that this is harmful for you, but you know, can I suggest you, you know, quit line का number आप उनसे share कर सकते हैं, या ऐसे ही you can just with a lot of love and respect tell them कि uncle, if you really want to watch your grandchildren grow up, maybe it's time you thought of quitting. Thank you.
Thank you, ma'am, and thank you, Pradeep. I think it's very right that it's not just about Pradeep. Are you trying?
Sorry,
Yeah.
नहीं, Dr. Atre schizophrenia because she looks after the mental health. तो उनके वो और ओवरव्यू देंगी कि क्या कंडीशन है यूथ के अंदर. डॉक्टर आत्रे.
Ma'am, you are on mute.
Yeah, so thank you, Pradeep. I think, any mental disorder, we cannot say what is common in youth and whatnot, because half of the, for all mental disorders, their origin, half of them, the origin is before the child is 14 years old. And by the time they are in the youth, most of the mental illnesses have taken, the onset is there. We fail to, because in the society there is a feeling that mental disorders are not a medical condition, and we need not seek professional care, so it is usually neglected, and also the severe stigma associated with it also prevents people to not to take it forward. So if you see, finally what is the schizophrenia, when it's 3 per 1,000 population, which is, and if we see the huge population of India in the adulthood, then 3 per 1,000 is a huge number. And the origin of any mental disorder is usually from the youth or the early ages. So I think be it depression, be it schizophrenia, be it any other, one should be aware of what are the signs and symptoms, and if not for yourself, friend, family, it will be good to sort of indicate to them that mental health is not a stigma, it's nothing to do. I mean, we should not stigmatize, rather we should encourage them to take help.
Thank you so much, Atri. And this also answers a question that we have from Abhiraj, which says कि COVID-19 के time पे we have witnessed that everyone has been struggling for positive mental health, and families and individuals, and there has been a lot of stress around each one of us. So counseling services for anyone who wants to reach out to these, it's important that everyone gets access to it. And he also is asking if there are any systems, a specific helpline that जो चाहे वो reach out कर सके इस helpline को.
So I think it's a very, very pertinent question, and there is one helpline from the Government of India which is based at NIMHANS, and this helpline has 14 languages. It caters 14 languages, so one can reach out to that, and the information there is confidential, so one should not, the privacy issues are well maintained. Also, there are the states. I'm talking about the government side. The states also have their own helplines, so if you are there in the state, you can avail these helplines. And of course, the thing is that the buddy system, not always professional help is available, especially in the remote areas, or because of, I mean, you may be the internet connectivity or the call connectivity may not be good where you are. So as advocates, as the leaders, you should develop a buddy system amongst yourselves, so as to handhold people who are going through stress, telling them that we are all in the same boat and things will come to a very positive conclusion. We really need to hold on to it, keep our resilience on, not to sort of fade away or not to feel depressed. So during COVID, this is a very important thing, because at the workplace, you have the frontline workers, they have to go out to work. But then if they don't have that buddy system, then how could they survive? So I think as advocates, this is a very important thing which our youth can propagate at home, in the community.
Thank you so much, Atri. And I know, Astha, you are doing the strict timekeeping. I'm just acknowledging one message from Diego, which is कि young लोगों की real power to bring about change in our country. How big is that, and what is that we foresee that young people can do to lead this action? And just acknowledging, Diego, this will be addressed during the course of this workshop as well as during the breakout session. So I'm just going to quickly hand over to Astha, and let's hear more from the speakers. Thank you.
Thank you, Prachi. Thank you so much, everyone, for the wonderful discussion. For the next session, which is going to be more interactive, where we all will get a chance to, share our experiences and discuss about from our own lives. I would like to hand over on this session is on setting priority and action plan. So I would like to hand over the mic to Dr. Atri Ganguly, who is the National Professional Officer, Mental Health and Substance Abuse, WHO Country Office for India. So Dr. Atri, if you can just give an overview about this session, and then we can divide this participants into breakout rooms.
Thank you, Astha. It's going great, and I think we've learned a lot. And the lovely pace setting talks by Dr. Fikru, Dr. Pradeep Joshi. So we have come to understand what NCDs are and how the youth are related to it. So taking this forward, we will be dividing ourselves into groups, and there will be group discussions. It's a 30-minute session. We'll be getting into breakaway groups. Automatically, you'll find yourself going into these groups, and the groups have been pre-decided. And we'll have different. If Astha, if you could just name who are the different facilitators for the different groups, and then you can take forward without
Thank you, Dr. Atri. Just to mention that we have given 40 minutes for the discussion because we wanted to have a good discussion with the participants. So the breakout rooms will be for 40 minutes, and group 1 will be facilitated by Dr. Pradeep Joshi and Dr. Ms. Tina Rawal. Group 2 will be facilitated by Ms. Purva and myself. Group 3 will be facilitated by Dr. Atre Ganguly and Dr. Twinkle. So we, from our team, will be facilitating the session. We'll be there to, help you lead the discussion. So we can start. Anything else, Dr. Atre, that we would like to?
I think it's great going. Let us just divide ourselves, and we'll gather back, and then we can discuss.
Yeah. So we will gather back at, I think, 11:10. So Aarti, please, if you can allocate all the allocated participants into the groups.
Sure.
Thank you, Aarti.
Hello, everybody. Are we in the breakaway groups?
Atri, I think there has been some allocation related issue that Aarti is sorting out. So we are
Achha.
yet in the main session, but she's sending all of us in the break.
Okay, thank you. Thank you.
Hello.
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 I think, yeah, Sayanji, just give us a moment. We are just sending you all to your allocated rooms. Just give us a moment, please.
Are we in the group now? Dr. Prachi, are we in the group?
I don't think, Aarti, can you please confirm if we are allocating everyone?
Breakout 1 is done.
Yeah.
Okay. So breakout 2 is going on.
Okay.
And
okay.
there are people, I request everyone to please rename yourself like Amiti and all. If you can just rename yourself. History honors and all.
Okay. Okay. So someone with the name Amity, can you please rename yourself to your actual name? And then others, Matt, can we have your name, please? This is just for the purpose that we are tallying with the list, so it will be easy for us to send you in the groups, NTCP and NTCP STCC. Rest, everyone have their names up. I'm just repeating. NTCP, STCC, NTCP, MAT, and Amity.
Hi, Prachi. Hello.
Yes, yeah.
You can just help me with the number of participants left here.
Mhm.
So, whom they want, which room they want to join.
Okay. So what I can do is can we allot them? Aarti, I can tell you.
Yes, exactly.
Yeah. So we have Akanksha here.
Yes.
So can we send her to room 1?
Room 1. Okay, assigned to room 1, done.
Then Amal. Room 2. I think let's just do room 1, room 2, and room 3.
Amal, AMAL, I can't see that.
That's okay. Let's go next. Anagha Sharma.
No, I think you are going. Let me just tell you the names. You just let me know, okay? Because I have only 20 left.
Okay.
Anaga. Whom? Anaga Sharma.
Right.
Which room?
Room number 2. Let's just try and do this. Room number 2.
Apeksha, BPS, Noida, India.
Room number 2.
Dr. Bharti.
Hi, Prachi. This is Purva. Are we in the breakout session?
No,
Purva.
we are yet in the main session. We have, there were some email IDs registered. The ones who are left here, there's some system error with the email ID. So we are allotting the room manually now. Dr. Bharti in room number 3.
Dr. Bharti, room number 3. Okay, okay, done. Ekta Gill, she has joined just now.
Room number 3.
Gitanshu.
We have how many rooms?
3 rooms we have.
Gitanshu in room number 3.
Sorry. Gitanshu, room number 3. Okay. History honor, Jessica.
Room number 2 we can allot her to. Mehek to room number 1.
Just a second. Mehek to room number 1. Okay.
Nitika to room number 3.
Room number 3. NTCP, STCC.
I don't know their names and they haven't renamed themselves.
Purva S.
Purva in room number 3 then.
Radhika, to okay team. Shreya.
Shreya in room number 1, please.
Vineet Munish.
we can go in room number, let's just go to Vivek first. Room number 3.
Which Vivek? There's an Institute of Public Health and there's a Vivek Kumar.
Institute of Public Health in room number 3, Vivek Kumar in room number 2.
And Vivek Kumar in room number 2.
Right.
Vineet Munish.
We can go to room number 3 then. Vineet.
Okay, then NTCP Prema Matt.
Room number 3.
Room number 3. Can you slideshow में जाओ? Can you put slider? एक slider है, हाँ. Now we are left with India Attitude is me, Kanika, NTCP.
Kanika in room number 1, please.
Kanika in room number 1. There is one person I have just joined him, Jared.
I think what we can do for all of us, because we are all now, we can be placed in any of the rooms. Let's just do Purva to room number 1.
Yeah, I think I was sent to room number 3, but I'm group 2. So
okay.
Yeah.
Aarti, you have the list, right?
Apurva.
Purva Singh, yeah, I'm the facilitator for group 2.
Purva Singh, okay, just a second. Purva.
And S, yeah.
Purva S.
Yeah.
Room number 1, right?
2, she said 2.
2, ma'am.
Yeah, 2, done.
Thank you.
Now we are left with only 2 people, NTCP and Jared. Hello?
NTCP to room number 2.
So now Jared M.
There's Hannah also in the room.
Hannah?
Yeah, we still have quite some people left.
For me, it's coming unassigned are 4 only.
Okay, can you please quickly just tell me the names?
That's what I'm saying, Jared and Prachi, Radhika and India Attitude. That's all.
Okay, because I can see Soumya Tripathi, Vivek Kumar, they're still here in the main room.
Soumya Tripathi, okay. Which room you want to send them?
Number 1.
Just a second.
Vivek Kumar is also here.
Soumya Tripathi move to room number. Soumya Tripathi join. She hasn't joined actually. Request जा चुकी है.
ठीक है. Okay.
Yeah.
Then we have Gerard, right? And Apeksha.
Yes.
So Gerard in room number 2 then.
Room number 2, he is new person. Okay, now it's done.
Okay. For Apeksha, Anju Devi.
अंजू देवी नॉट ज्वाइंड, उनको जा चुका है मेरी तरफ से रिक्वेस्ट, वो ऑलरेडी असाइन थी, उन्होंने ज्वाइन नहीं किया, उनके आ रहे नॉट ज्वाइन.
Anju, you would have received a prompt on your screen which said join the room.
ललिता कश्यप का क्या था? ललिता कश्यप मैम का नॉट ज्वाइंड. हेलो.
Yeah. So we have allotted everyone a room. Is that the case, Aarti?
There's one more. She has just rejoined again, Jessica.
Yeah, I think Jessica was sent. Jessica, you have just rejoined. I think we allocated her to room number 2.
Okay, I'm shifting her. Hello?
And
Yeah, just
Lalita Kashyap.
हाँ, ललिता कश्यप का तो पहले से प्री असाइन था, ज्वाइन किया इन्होंने दोबारा.
ये ललिता.
कौन 3? Room number 3. Lalita is room number 3. Okay. So now I think we all 3 people are left.
You, me, and India Attitude.
Yeah, and there are people whom I have sent the request, but they have not joined it. Joined the room, I mean.
So everyone who's still there with us, we have sent you the request to go to your allocated breakout room. If you haven't received it or if you are unable to locate it, please just unmute yourself and we will help you. Okay, Aarti, I guess so how much time is left for the 40 minutes?
I would suggest give them some extra time.
So we close the rooms, say at around 11:30 then, 11:20 or 11:30.
11:20, I can broadcast a message to all.
Yeah. For
I
10
think if we close at, it's all, we actually just have about 40 minutes left for this workshop, right?
Yes, so I guess we can send at.
So what all do we have? I would suggest Prachi 11:45. It should close. The workshop should end, not later than that.
Yeah.
Yes, can you try now?
Food pack is expected to take around 10-12 minutes and then there is closing. So 20 minutes we need for that. 11:15, let's send a broadcast and bring them back at 11:20.
11:15, okay.
Yeah, that 5 minutes are left and 11:20 we close the rooms so that by 11:45 maximum we are able to.
What I would suggest is if you can just send a message right now that you have so many minutes for your group work. भेज दें अभी ये?
25. So there's 23 minutes. So can I just say 25 minutes?
20 बोल दो.
11:15 pe na? We're gonna send them.
Yeah.
So you want to end it at
11:20.
11:20. So it's 10:50 if we consider 10, 20, 30 minutes.
What error you are facing?
So shall I send it 30 minutes?
Yeah, 28 now, so write 28. 28 minutes.
Disable participant screen schedule झालं होतं.
Aarti, Anush, there's one participant who was trying to go to the breakout room but hasn't been able to do that. So that person is joining back. So then we'll reallocate.
Anush full name is? I mean.
Sorry?
Anuj is joining back, na?
No, not Anuj. I'll just let you know the person's name.
मैं ना होस्ट हूँ, मैं नॉर्मल पार्टिसिपेंट का मुझे तो दिखा रहा है, मैं शेयर स्क्रीन कर सकती हूँ यहाँ से.
Aarti, please mute yourself.
Rooms में.
Aarti, please mute yourself.
सेटिंग देखनी पड़ेगी मुझे.
हाँ जी, हम थोड़ा सा प्लेटफॉर्म देख लें। ओके।
Are you talking to me, Prachi?
Thank you, Prachi. It had been a real useful, the groups were so much with ideas that I wished the group work would continue for some more time. But then everything has its own limitations. But it was wonderful listening to them from different parts of the country. Thank you so much. It was very great audience.
Great. It's always you feel the time is less for group discussions.
Yeah. Yeah. Yes. So I think without much delay, maybe the groups can start presenting and then we can have a quick discussion. And I would really request that any points which has been missed out by the presenter, the group participants are free to include it in the chat box. We'll be happy to get more points during the discussions. Thank you.
So maybe we can start with the presentation of group 1. So any volunteers from group 1?
I think they are just moving from their breakaway rooms to the main session. So Nitya is there, who has volunteered to present the discussions. So I hope Nitya has joined the main session.
Yes, ma'am. Ma'am, shall I start?
Yes, Nitya, please go ahead. Tina, do you want to share the screen?
Yes, it would be helpful. Just allow me to. Yeah.
Tina, you can share your screen.
Thanks. Nitya, is it visible?
Ma'am, what? I'm not able to see the screen. Yes, ma'am. Yes, ma'am. Yes, ma'am.
Nitya, you can start.
Yes. So, hello everybody. So we have discussed in the two major questions, two important questions, and the we have discussed about the opportunities and challenges that we, the young people, actually faced during the COVID-19, and we actually we talked about, we all are just, we are aware about the challenges that we have faced, like lack of social gathering, and there's a exposure to online platforms. People are facing mental health related issues, but then there's something a positive impact also to something positive impact, which I would like to say, something like yes. So it's giving more opportunities to the people who are yes, who are, India is becoming self-reliant. India is more focusing on digital platforms, like we and we and I am just interacting through through virtual meetings only. So this is through digital platforms. So that's amazing. And what I would like to say that people who are there are some kind of teachers, so maybe they are unemployment, but then they are uploading their videos through YouTube, through which they can earn also. So maybe it's a good impact for them. There's a family interaction, like the most of the teenagers who are don't wanted to talk to their parents, or maybe some kind of issues are there, but then spending a lot of time in home, it's giving the opportunities to children to interact with their parents. So there's a family interaction, which is almost a good point. There's a kind of formality between the people, uh, and people are participating in social events. That's amazing. And one thing that I would like to say, that the children are focusing on the self-study, reading. So that's all I would like to say. And the second question, ma'am, please show the second question. So the second question was that, what are some of the priority to promote health and well-being during COVID-19? So the things we discussed, about the meditation and yoga, And we all know the amazing impact of meditation is that people purify their mind. They keep charge of their mind. They are filled up with positive thoughts, and there's no negative vibration that is coming to their minds, to their head, and which also helps them to and which also helps them to reduce stress. They don't need medicine to reduce stress. And so this is what I would like to say. After that, yoga, and of course hygiene practice should be done, like mask. There should be a social distance, and yes, as the second wave is more impacting to children, to young children, so it's good that we do social distance, and of course that it's best not to go outside the home. After that, and there's some kind of myths, fake news, like in social media. There's a continuously the political parties are saying that the COVID shield vaccine are not good, are not sufficient, and it's not working properly. But this is all the myths. This is all of the myths, and through social media we can, if we are united, then we can destroy all these fake newses, the humors, which is of course an amazing thing. So this is all I would like to say. Thank you.
Thank you so much, Group 1. I think it was a very good discussion. Just for the paucity of time, I would like Group 2 to go next, and maybe we can do small open discussion at the end of the presentation. So for Group 2, Nitleen will be presenting. Nitleen, if I can request you to please summarize this in 3 minutes.
Yes. As we all know that every coin has two sides. So even the pandemic has opportunities and challenges. So the one very big opportunity and challenge that we've seen is how virtually we are connecting with people. And there's a great outreach. Like today, we all are sitting in different places at different, parts of the country. So I think that's a great pro of the pandemic and the virtual platforms. Secondly, if we see, there is obviously a personal barrier. We cannot form a great rapport with people. There's a restricted personal contact. So I think that is one very, very, very crucial cons that can come out of this entire situation right now. Then obviously if we read articles recently, there is a great rise in isolation among people, and there are mental health issues which have come up. So I think we can really use that as an opportunity to work on those issues and create awareness. And naturally, because of this scenario, because of a pandemic at hand, we have started self-introspecting and understanding different values of money, family, and other basic things. And also it is very important, and it is great that we have become more health conscious, and we are very particular about our choices, and now we are very well prepared to face the worst, especially the youth that we have gathered today. We've understood how it works, and we can, if there are more pandemics to come, hopefully not, but we are prepared now. We know how things are supposed to be. Then there is a major challenge that we've seen is how education has turned online. Now, for education to actually happen properly, we need that support from professors. There is a need for proper rapport. So I think there is some gap because of the pandemic. But again, if we see the pro here, we are virtually connecting with them, and they are a big support to us. Then, of course, there is a complete we've reached a state of fatigue and burnout. So especially due to long screen times and stress pressure to perform, I think we've reached that brink of our capacity. So that is a major challenge that we've seen. And even coming to anxiety, because we don't know when the pandemic is going to end. So there is a state of anxiety because of the unpredictability and uncertainty. So that is one challenge. Now coming to the priorities to promote health and well-being during COVID-19. So I think one major focus should be on our mental health. We see that domestic violence cases and suicide rates are increasing nowadays because of the pandemic. So I think it is very important to spread awareness about the fact that going for counseling and seeking psychological help is very normal, and it is as normal as going for your physical and medical checkups. And even yoga and meditation have helped in dealing with combating a lot of mental health issues like depression and anxiety, as well as stress. And how we can use support system, our family support system, our peer support system, to not just deal with our mental health issues, but even feel safer during a situation as grave as the COVID-19. And we should also take care of all the proper guidelines, and we should also focus on how our sanitization is taking place. And something very interesting which was pointed out during our breakout discussion was how there is vitamin deficiency among a lot of students and children nowadays, because nobody is getting to go out. So I think some form of activity, maybe just going on the terrace and going for a walk, is very important. So in order to get the exposure of sunlight, and then strengthening the health infrastructure, access to medications, hospitals, both in rural and urban areas, is also very essential. And naturally goes without saying that we need to be very particular about our food intake, and it should be very nutritious. And also, as we see on social media, that we are in need of plasma banks and blood banks, and we all need a consolidated, solid resource platform where we can get authentic information. And I think social media is a very powerful tool, and we should really make judicious use of it. So that's about it. Thank you so much.
Thank you, Nitleen. It was very well covered, whatever we discussed, and thank you for representing on behalf of our group. Now I would like Group 3, volunteer for Group 3 to present.
We have Dr. Twinkle to present.
Okay. Twinkle, if you can just keep it very brief, maybe in 3 minutes.
So first question was, that what are the opportunities and challenges that we have faced as young person during COVID-19 pandemic? So most of the challenges were around mental health issues. Then there is a lack of physical activity due to COVID. There is a lack of physical activity in people. And then a point was mentioned that there is a drug addiction, increasing drug addiction among adolescent girls. And then in these days, parents are more focusing on studies and career rather than encouraging children to work on their physical inactivity. And then in today's world, we are focusing more on there is more focus on treatment rather than preventive measures, and it is very important for NCDs that we work on the preventive measures. And also increased use of social media is also a challenge that we can say for NCDs. And in case of COVID, it is also a positive. There is also a lot of positive things about social media, but at the same time, it has some effect on NCDs also. And then what should be our priorities to promote health and well-being? So nutrition is an important aspect that should be considered. And then mental health issues, as they are increasing due to in COVID, and increase of promotion of physical activity at home also. And then de-addiction and awareness about drugs in adolescents should be also done. So,
thank you, Twinkle.
Thank you.
So I'll hand over the mic to Dr. Atre now, and maybe we can have few questions, just maybe 1 or 2 questions. Twinkle, if you can stop sharing your screen.
Yes, ma'am.
So I feel that they are wonderful presentations, and they have sort of brought to light a plethora of thoughts and plethora of issues, which many a times we do not discuss over, in the routine life. So any questions or any comment which you would like to include?
I think Taran raised his hand during one of the presentation. Taran, do you want to add anything?
Yes, ma'am. Just a point about many children and many families are currently economically disadvantaged, since most people have to go physically to their work site and work. But most of these people, like such as laborers and people who work at shops and restaurants, also they're losing a lot of money because they're not able to work very well. And even if they're open, not many people are going there. So a lot of families are therefore economically disadvantaged, and the children in those family are also disadvantaged. So many people might be facing a problem like less food and other various problems because of shortage of money.
Yeah, here I would like to add, COVID has got, it has sort of glared the inequity element, because at one hand, people have access to internet, and their children are, getting internet classes and life is moving on as much as possible in the normal way. There are a large number of people who, those who go into these schools, these schools, especially the government schools, they provide the midday meal, which is to assure a good, sumptuous, healthy meal, which has now been stopped. And also there's a lot of layoff, like those daily wagers may not be getting their daily wages on time. So many dropouts, especially for the girls, because there is a gender dimension to it. Whenever it comes to take a decision between a boy and a girl, it's always the girl. And also there is a nutrition issue with these girls, because something like anemia is so common in these girls, and we don't care to, because people don't talk about menstrual hygiene, and menorrhagia is one of the major causes of anemia in adolescent girls, which we fail to acknowledge. So yes, a lot of diversities, a lot of equity issues. And I think on one hand, although we are trying to see how we can reach out to the the haves, how to reach out to those who needs more support, and how to reach them through alternate ways. So I think at the end of it, we should have some recommendations on this as we wrap up the event.
Dr. Atre, Mehak, you have raised your hand. So briefly, if you can share your comment, and then we will go to the closing ceremony.
Good morning, ma'am. Ma'am, I have made a poster on mental health awareness. Can I share it?
Yes, Mehak.
Okay, ma'am. Ma'am, is it visible?
Yes.
Yes, ma'am. So I have made this poster on like pandemic, like what we are facing nowadays. Like I have written a quote like, it's okay not to be okay. There is no shame in getting help, which is like generally people stigmatize mental health. Like if we say like we are depressed, they generally claim it is like we are mad, but it is not the issue. So and in pandemic, like it was like that it wasn't like that we don't want to talk to our friends, want to talk to our family, but it was like our general tendency that we don't want to talk to our friends because of like pressure from like in job, pressure from school, academic pressure and everything else. And there I have written, if I is replaced with we, then even illness can become wellness, which is showing an optimistic and a positive attitude. So I have designed this poster. And also, ma'am, I would like to add on one point, which is like about to empathize with the doctors. That is like generally there are myths going on and the fake rumors which are going on social media, WhatsApp, YouTube, and everywhere. So we should be empathetic to the doctors also and to our community people also. Like where like one place I have heard a rumor regarding a doctor that he's selling the organs of like people who are coming for plasma and everything. So we should be empathetic to the doctors also, and bust the myths which are going around like in the and should be aware of our surroundings. The nowadays in the second wave of this pandemic, we have see that for a 2-unit plasma, like people are asking for 2 lakh rupees. That is just not the amount, and we should be helpful to the community. That's what I want to tell. So that's all. Thank you, ma'am.
Thank you, Mehak. I think it's a very great poster that you have made, and the mental health is as I think most of the groups have discussed this, that mental health during COVID-19 has been a major issue for most of the young people. And it is important for us to realize that it's okay not to be okay, and to share that, we need support, and to, take behavioral counseling. It's very normal, and mental health is not a taboo in the society. Now, just for the closing ceremony, I would like to hand over the mic to my colleague, Ms. Radhika Srivastav, and then followed by Ms. Vineet Gill Munish, National Professional Officer Partnership, WHO Country Office for India. Over to you, Radhika ma'am and Vineet ma'am.
Astha, thank you so much. Thank you to all of you for these excellent discussions in your working groups. Thank you to all the facilitators as well. I think at the, this is the end of this workshop, but it's definitely not the end of this journey. This is in fact the starting of this journey really. And what we, whatever you have said, we want to channelize your thoughts, your inputs, your recommendations into an organized effort and campaigns to really put these ideas and thoughts into action. And this workshop was the first step. And the second part of this is, of course, the Global Youth Meet on Health, which all of you would have links to join. We are covering several issues around universal health coverage and meaningful engagement of young people for UHC and the Sustainable Development Goals. A lot of discussions happening on the global context, but with a lot of good India examples weaved in. So please do participate for the next 2 days. And then following up on that, we will, with technical support from WHO India, organize this effort into a more robust and well-planned capacity building workshops. So some leadership and training workshops that are coming in the next few months, and also some definitive action planning as to how do we need to take these discussions forward. So I'm going to stop here. I'm aware of the time, and I'm happy to hand over to Ms. Vineet Gill Munish. Vineet, over to you.
Thank you, Radhika. Thank you, Asta. And a big thanks to all of you, and especially my colleague Atrei, who's coordinated such an amazing session. When I was listening to you all today, I was reminded of a quote by the 32nd president of US, Franklin Roosevelt, who said that we cannot build a future for our youth, but we can build our youth for the future. The last 2 years have shown us that, we don't know what the future is really, right? Every day is a new day, and every day comes as a beautiful opportunity and an amazing challenge every single day. And it's also taught us to live one day at a time, right? So I'm very, very inspired by the presentations made by all of you, and how you have dipped into all your learnings from the last year plus. And somebody needs to mute.
Vineet, you're on mute.
If you can unmute her.
Yeah, Vineet, please unmute yourself.
Have I been on mute all along, or I just got muted?
You said you requested somebody to to mute,
Yes,
and then I think you went on.
So then I got muted too.
Okay.
Okay. So what I was saying is that you all have put together this presentation with your learnings and your intuitive powers. But as Radhika shared, that once your capacity is built, once you learn the right health promotion, leadership skills to build a better, India, a better future, I think you will be in a position to really contribute to the Sustainable Development Goals, especially SDG 3, under which health falls. I'm especially moved by all your suggestions on mental health, as well as other health promotion, and especially the poster which was just shared by Mehak. I really feel that our future is in good hands with all of you, and wish you all the best. And thank you, a big thank you to Hriday and the entire team for pulling together this excellent session in collaboration with the WHO Country Office for India. And we stand committed to supporting all of you in building a healthier India. Thank you so much.
Thank you, Vineet, ma'am. I think Muskan, you raised your hand, and after that, if we can ask, if I can request everyone to turn their cameras on for a few seconds for a group picture, and Aarti, if you can help us taking the group photograph. So Muskan, do you want to briefly share your comment or the question that you had?
Yes, the presentations were wonderful. I just wanted to add that we should also talk about students with children with disabilities and the perspective of persons with disabilities, and how they're a more vulnerable class during the pandemic, and they've had issues with access to medication, and the fact that a lot of the COVID-19 protocols are not like amenable to them, like wearing masks for people with cerebral palsy, or in terms of getting the vaccinations. It's been very difficult. So I thought that's another perspective that we can add in terms of talking about COVID-19 pandemic and its effect on global youth health.
Yes, Muskan, definitely. I think that's a very valid point. That it should be prioritized. I would request everyone to please turn their cameras on now for a group photographs, and I would request Aarti if you can facilitate the group pictures.
Sure.
I think we have 3 frames.
Yeah.
3 frames. So we'll take at least 3 pictures.
Can everyone please turn on your cameras? Yeah, it's done.
Thank you so much, Aarti, and thank you so much, everyone. We look forward to seeing you all at 4th Global Youth Meet 2021. And please don't forget to use hashtags GYM2021 and Youth for Health, and tag us on social media on Twitter at Hriday-org. And we look forward to seeing you all. It was a great discussion. Thank you so much.
Thank you.
speaker.
Good morning, good afternoon, good evening, everyone. It's a pleasure to welcome you all here. And as we start the formal proceedings of the 4th Global Youth Meet on Health today, we just wanted to take a moment, and on behalf of the organizers, we wanted to welcome you. We hope some of you are here with us watching this live stream until 1 to 1:30, and we just wanted to give you a brief about how will this day progress. So as you saw on the image on the screen right now, for the next 15 minutes, we request all of you to explore the platform you would have logged in. Please update your own profile so that other delegates can see your profile and connect with you. So we have designed the platform to help you with the opportunity to network, to interact, to connect with peers as well as experts from all over the globe. So please utilize this opportunity and the next 15 minutes to explore and understand the platform. You have all of our email IDs. My name is Prachi Kathuria. Sorry, you would have received my email ID over emails. So in case you face any difficulty, any challenge, just let me know. And we will be happy to help you. So we will start with the workshops for which you would have already registered, and you would have received those codes that will let you in the workshop rooms sharp at 1:30 p.m. IST, which is exactly 15 minutes from now. And for 2 hours, you will be in the workshops with our esteemed partners who are leading these workshops, and interact with them and get to know the issue a little better during these workshops. And then the workshops officially close at 3:30 p.m. IST, exactly 2 hours after it starts. So you will be then requested to come back for the first plenary, which is at 4:15 p.m. IST, which will be followed by an inaugural ceremony. And then we do have a dedicated opportunity for you to set up your meetings, use the lounge feature to set up meeting tables, which will be done later today. This feature will be active later today, but throughout the day, you're free to explore the page and set up meetings with delegates if you may wish to, as well as actively use the event feed tab, which will allow you the opportunity to post whatever you are thinking. And you will see there are some posts, and we are happy to share that we have our gym alumni network members who have been posting beautiful pictures of previous gyms. So similarly, you can also use that tab and start a conversation or respond to an already existing conversation. Please don't forget to use social media throughout these 2 days, and our social media handles are available all the time. They are mentioned even in the backdrop that I have. They are mentioned on Twitter, on Facebook. We are under the name Hriday_org. And we look forward to connecting with all of you. So we will, now you will, I will sign off, and there will be a tile that displays the times so that you can you can monitor when to move to another section. Just to give you one line on how will you join the workshop. So in the workshops tab, around 1:30 p.m. IST, the join now buttons will be activated. So once the workshops have been started by the partners, you will be able to join with the unique code you would have received on your emails while you were registering. And also here in the chat box, we will right now post the links, post the codes, of these workshops. So in case you haven't been able to register beforehand, and right now you would want to join the workshops directly, then please use the corresponding codes, and then you will be able to enter those workshops. We do hope this is helpful, and we are monitoring the chat box. So in case there are any questions for the next oddly say 13 minutes, then we will take it up and we will answer in the chat box itself. Thank you very much once again. Thank you for joining, and stay tuned. We are all on the platform, so we are there. It's just that we just cannot see each other yet, but we are all connected via different tabs. Thank you very much. Hello, everyone. In another 1 minute's time, we will open up the workshop rooms. So you will be able to see a join button across the workshop that you wish to attend. And once you click on that button, you will be prompted to enter a code, which I have posted in the chat box. And you can enter the code and enter the workshop. And while the workshops are going on, there will be no plenary sessions that will be running. So we request all of you to join the workshops that are of interest to you. Thank you, and we will see you back in 2 hours.
Hi, everyone. Good morning, good afternoon, good evening, depending on which part of the world you are in today. And I would like to welcome you to this amazing session. And I will be your moderator for today. My name is Maziko Matemvu. Obviously, as you may know or may not know, this plenary session is being led by the Partnership for Maternal, Newborn, and Child Health. And the title of this session is Meaningfully Engaging Young People to Make Adolescent Wellbeing a Priority During COVID-19 and Beyond. So this is the 4th Global Youth Meet on Health, which is obviously being done virtually for the first time, but we have an amazing panel and we're going to make things so exciting. I think it's very exciting that we have young people. We've got different representatives from different ministries and government officials, etc. But before we get into that, who are our panelists? So we have Miss Priti Pant, who's the Joint Secretary at the Ministry of Health and Family Welfare. We have Dr. Rajesh Mehta, who is the Regional Advisor for Newborn, Child and Adolescent Health for WHO, the South Asia Regional Office. We've got Dr. Sarah, who's the Senior Advisor of Health for adolescents at the UNICEF headquarters. We've got Ms. Radhika, who's the Director Health Promotion at HRIDE. We've got Mr. Desmond, who's the National Vice President of the Cameroon Youth Network. We've got Mr. Amit, who's the Vice Chair of the Board of Directors for the Youth Coalition of Sexual and Reproductive Health and Rights. We've got Dr. Omnia, who's the Liaison Officer for the Public Health Issues at International Federation of Medical Students Association, Youth Lead, UNICEF. Wow, a lot of things going on over there. And then we finally have Mr. Josiah, who is the co-founder of the PLYAT Council. So as you can see, we pretty much have an interesting panel, young people mixed up, as I mentioned earlier, with different representatives. I would like to kindly ask you to please feel free, please feel comfortable. I mean, I really want us to be comfortable. This is a youth space, and you know, youth spaces are supposed to be safe spaces. So please use the chat box to interact with the panelists. If you have any questions that you want to pose to the panelists, any comments, please use the chat box. It is yours, it is mine, it is ours. Let us make use of that. And if we are not speaking, if you're not speaking, which you're not going to speak, you're only going to be typing, please make sure that your microphone is muted. So I would like to just give us a little context before we start getting into the plenary discussion. So for a lot of you know, and some of you might not know, but the Global Youth Meet is a convening of youth from across organizations and focuses on some of the most pressing challenges that are faced by adolescents and youth across the world. And it is an opportunity for young people across the world to come together, which is what we are doing now, to share and deliberate on challenges that affect their well-being and health so that these issues can be addressed. As you know, with the pandemic, young people and adolescents are always disproportionately affected, disproportionately represented. So it is imperative that we create this safe space where we deliberate on issues to fit into larger policies and larger frameworks so that every adolescent girl and boy is heard. So why are we doing this, and why is this important? So this is important because the notes from the conclusions that will come up from this session will be used to culminate with the release of the Youth Declaration and adoption of concrete and time-bound youth-led regional action plans that will be implemented after the Global Youth Meet. So this is not one of those things where we just come together and discuss and not do anything about it. No. That's not happening over here. We're going to have concrete action plans, and we're going to have follow-ups. And especially at the next Global Youth Meet, we will be measuring the progress from all the action plans that will be done and that will be consolidated today. So even more important for you to engage, for you to be part of this process and be part of something that is bigger than yourself. Do this for your community, do this for every girl and boy out there so that they are heard and they are seen. So what are the specific objectives of this session? So us over here at PMNCH, at WHO, at everywhere at HRIDE, everybody who's been involved in this session, in making this amazing virtual meeting, we just don't talk about things for the sake of talking about them, if you know what I mean. We always want to ensure that we have concrete goals and objectives. So I just want to quickly tell you what the objectives of this session are. So number one is to provide a platform for adolescents and youth to discuss with technical experts and government officials the importance of making adolescents' well-being a priority and actions required from across the domains of the adolescent well-being and framework in the context of COVID-19. We're not having anybody speak on behalf of young people. No, we are having the young people here talking to the experts, talking to the government officials that do make these policies and frameworks that affect adolescent well-being and health to have their voice heard. Number two, we are providing a platform for young people to share their views and innovative ideas And this is important because young people are vibrant, they're proactive, they've got different ideas that the older generation might not exactly think about. So this is very important, you will agree with me. And also to raise awareness and discuss and mobilize support for the 3 asks for the call to action of the adolescent well-being, which includes engaging and empowering adolescents, going beyond the health sector and launching a powerful multi-sectoral response, and also strengthening political commitment and funding through a global summit on adolescence, which is going to happen in 2023. I know that was a lot, but it's actually not a lot. It's actually going to be fun. And I'm so excited to hear from our different panelists, their views, the important perceptions. So I think it is very important that I stress and reiterate that it is important that we meaningfully engage young people as we are building a stronger and better response for COVID-19. And why should we focus on young people? We need to focus on their well-being. So I'm just going to quickly talk about the adolescent well-being framework. And if we could kindly have a projection, which you're probably seeing now. So according to the conceptual framework, adolescent well-being is adolescents thrive. The definition is adolescents thrive and are able to achieve their full potential. There are 5 domains, so which is good health and optimum nutrition, connectedness, positive values and contribution to society, safety and a supportive environment, learning competence, education skills and employability, agency and resilience. Now, the global statement of meaningful youth engagement is something that I quickly just want to share with all of you right now. This global youth statement on meaningful engagement was endorsed by over 200 organizations since its inception in 2018, and it acknowledges the engagement with young people. It acknowledges that the engagement with young people is critical, and it is important that they have a say in policies and frameworks that affect them. I have done so much talking, and my throat is getting a little dry. So I think you agree with me that we need to get started. And I would like to open with questions to the 2 young people that are here from networks in Africa and Asia. So that is Desmond and Amit. So you are both part of youth networks in vastly different regions. The theme for the next 2 days is centered on meaningful youth engagement. I would like to start this conversation by asking you, what has your experience been? Do you think that we are walking the talk of engaging young people and listening to them? What do you think? Let's hear it.
Amit, do I go first? Okay.
Yeah, sure, you can go ahead.
Yeah. Good morning, Maziko from Cameroon, and good morning, good afternoon, good evening to all the panelists. And thank you very much for the great introduction and background on this very important conference. I mean, the question of meaningful youth engagement has been asked and asked, and we have to keep on answering this particular question because it is important in the discourses on global health. As far as meaningful youth engagement is concerned, on a personal level, I think I have had experiences of meaningfully engaging by not only bringing on board government stakeholders, decision makers, for us to sit together and in an integral fashion to craft out what we think is good for young people, their health and well-being. But I have also been involved in avenues that have been created by decision makers, government stakeholders, global health partnerships, not only to come and sit in conferences or to come and talk in a platform like this, but to also be part and parcel of the designing of the monitoring and evaluation, and also of the financial aspect. That is on a personal note. It has not been all a bed of roses. There has been challenges, obviously, for those who may not understand what meaningful youth engagement is. And so we keep on, and for many other young people who've not had this opportunity and who are not meaningfully engaged, because there is still a lot of tokenism out there, tokenism, which I can actually talk more about in the course of our discussion. I would rather say to all stakeholders that meaningful youth engagement is not supposed to be window dressing. It is aimed to yield positive benefits for the health and well-being of adolescents and young people. And as such, if decision makers do not engage young people can engage decision makers through innovative ideas. Thank you very much.
Thank you so much, Desmond, and thank you so much for this panel discussion as well. And well, my answer will also be both yes and no. I must say it has improved significantly over the period of time compared to like when I started my journey as a youth activist. With sustainable development goal in place, like we say, youth are at heart of everything that we do, everything that we advocate for. But at the time when I remember now, I feel that we were completely ignored, like from any level of planning or like decision making. And also we were not heard of, like when we suggested something like we were ignored, our voice was not heard at the time. We were not listened to at that time. But I think this part has changed a bit gradually over the period of time. But there also like exist some of the challenges. I think Desmond rightly stated about tokenism. We young people face a lot of tokenism at times. We are invited to but still like I feel be it like state, be it organization, be it other stakeholders, they still need to internalize the value of meaningful youth engagement. They still need to respect and acknowledge the work we do, and also not just listen, like they also need to invest on us. Thank you.
Wow, thank you very much, Amit and Desmond. I think it's very interesting to see young people from two different regions, but with very similar experiences and very valuable insights as well. I liked how you spoke about tokenism, Desmond, which is something that we constantly see in the spaces. And Amit, you were taking us through how you had started your journey from totally not being heard at all, but then still, I can still see that we still have a lot of progress that has to be made. Now, we've heard from these two young people. I would like to pose this question to Preeti Pant, who's the Joint Secretary for the Ministry of Health and Family Welfare. So we just heard from these two young people who represent regions which have a large number of adolescents. Why do we need to invest in adolescent well-being during and after COVID-19 recovery? And what is your government doing to respond to the needs of adolescents and young people during this crisis? And what do you think needs to be done post-COVID-19? And also just a disclaimer, we have young people from your region, so you have to tell us the truth based off what you are doing. It has to be the truth. So let us hear from you.
Good afternoon and good morning and good evening to all these young enthusiastic participants, beginning from our MC who's anchoring the show. So it's very nice to hear your remarks and to see the enthusiastic participation from all the adolescents that are here. So let me begin by answering your question. As we are all aware that this COVID-19 pandemic is one of the biggest humanitarian crises that has hit this century, and it has impacted all the nations, peoples, communities. So I mean everybody is impacted, and irrespective of the age, gender, geographies, and the social economic status. And particularly the adolescent and the young people, I would say, have borne the brunt of these inequalities, because young and the youth have a different aspiration, different way of life, and this has all been brought to a halt or a change with this pandemic. There is, as you all are aware, there is restricted mobility. The schools are closed, there is lack of social gatherings, and there is physical distancing. These all are the opposites of the behaviors of the adolescents. So it leads to another new kind of insecurity, stress, anxiety, and a disruption in whatever is in the way we are living our lives. So this is leading to, of course, having impacts, not only some short-term and long-term sequences also. So health is very important, and we want to, intervene and bring in so that we address the cycle of poor health, and we must respond to specific health needs that have surfaced amongst the adolescent during the pandemic. And the health and well-being is essential and is a very important component for us, who are involved in this exercise. And so as regards, we have tried to ensure that the availability of, services, health services, particularly to the adolescents, despite all the challenges and all the restrictions that we are facing. We have, in a whole of government approach, we have established, contact with all these states and union territories which are participating in, and they are to ensure that there is minimum disruption as regards the services that are there. And of course, we are issuing guidance notes to all our states and UTs to take steps for continuation of services, and which include supply of this menstrual hygiene products, and of course iron folic acid continuation. Besides, under the adolescents health program, we have the counselors, and these counselors are placed in the health facilities, and where the boys and girls get calls as regards what is the IFA consumption, and if there are any specific queries or concerns regarding pandemic, so that those are also being answered. So Digital India at this point of time has proven to be a boon for all of us, and we are providing support through by utilizing this medium. And besides that, there are peer groups which are part of the community itself, and they are placed in the community itself, and they are trying to allay the fears and anxiety that are being faced, and by the adolescents due to the sudden change in the whole perspective and the environment where they are living. And especially it's more for the youngsters, because youngsters are more dynamic, and as compared to us oldies, we are more into the groove types. So it's very important to address the issues in the change of environment that has taken place due to this pandemic. And and also I would also say that there is an app that is known as Sathya, which means a friend. So they are being encouraged to use this app, and for certain information and education. And there is an ambitious program of school health as wellness program, wherein we are training teachers in the school, so that they become our chain, and they become our medium to transmit health messages, not only to the students but also through the students, through their families. These health as wellness ambassadors, they will conduct age appropriate and culturally sensitive activity based sessions on the health as wellness themes that have been identified, and it will surely promote and address the health issues of our adolescent. So, this is a brief snapshot that I would like to share with you all. Thank you.
All right. Thank you very much for sharing that. And it really does sound like it was honest. You know, people like to lie a lot, but I'm very glad to hear that the government is also, you know, using digital media, and also acknowledging mental health, which is something that is usually sidelined. Adolescents are usually told to get over it. Now, speaking of adolescents' well-being and health, I would like to pose this question to Rajesh, who is the regional advisor for the newborn child and adolescent health, WHO. We are talking about meaningfully engaging young people to ensure that adolescent well-being is a priority during COVID, during the COVID-19 recovery. And everyone might have heard me at the beginning talk about the adolescent well-being framework and the 5 domains. Could you kindly shed light on why we need a holistic and multi-dimensional and multi-sector approach to improve adolescent well-being and health?
Thank you, Maziko, and good afternoon, good morning, good evening from where you are. So this actually, the pandemic is a great reminder. It has been a strange year, the whole of last year. We continue to have this uncertainty. And by last year itself, we had seen 1.5 billion students had suffered because of the school closures across the world. You know, that may have led to even permanent school dropouts. It is you know, expected that quite a lot of number of students, especially girls, will remain permanently out of schools. Some of them will get married. So school closure has been quite a strain on the young people themselves. It will ultimately also interfere with the future employability. The prolonged closure was also associated with adverse impact on health and well-being, as Ms. Preeti was also mentioning, and the safety of the students who sat home was further exposed because of their vulnerability of this age group. So anxiety was most commonly reported by the young people when we surveyed because of the disease itself, but also because of the social isolation and loss of learning because of school closures. And digital learning itself has you know, offered a lot of physical strain on ergonomics, on screen time, decreased physical activity, and you know, dietary patterns changing. So clearly, we may have believed that schools are largely responsibility of Education Ministry, but clearly the health impact has shown us the Health Ministry and Education Ministry must work together. Because they are so closely linked. So pandemic just reminded us, this is not that it should happen now, it should have been happening already, and the sectors must come together. In addition, Maziko, it should be remembered, we were not doing very well about the water sanitation provisions in the schools even before the pandemic. In my region, 60% schools were falling short of water and sanitation provision. And the pandemic reminded us that for infection prevention and control of the COVID infection, we must have enough sanitation and water and soap available. So my sense is that using this reminder of pandemic, that many sectors are responsible for health and well-being of adolescents and young people, we should actually come together. Not during pandemic alone, but even beyond. So we must learn from this relative, you know, strength of working together with education, with health, with the nutrition sector, with water and sanitation, with social protection. All these sectors have to come together. And as Ms. Pant pointed out, that Government of India did venture a whole government response. We must be working with the communities also along with the government. And especially with adolescents and young people for building back better. Building now, but even better after the pandemic. And the background I am carrying today is a reminder from the World Health Day that we must build a fairer and healthier world from now and for everyone and everywhere. So especially for adolescents and young people. So let us collaborate with adolescent and young people for building better and fairer and progress towards the common goal of promoting adolescent well-being. So therefore, we know multidimensional approach and multi-sectoral approach is clearly important for our common goal of promoting adolescent well-being. Over.
Wow, thank you very much, Dr. Rajesh. I absolutely love the background, by the way, and it was very insightful hearing from you. And I think now we're really starting to get the picture and get the idea of why we really need all these 5 domains and why we need a multi-sectoral approach when dealing with adolescent well-being and health. And Dr. Rajesh, I am a very emotional person. I just wanted to say I almost dropped a tear, but this is not the time nor the place. So let's just move on over to Sarah. So Dr. Rajesh obviously has been talking to us about why we need a holistic approach to the and multi-dimensional approach to improve adolescent well-being. I really just wanted to hear from you. What do you think are the implications of this definition, adolescent well-being, and what implication does it have on our policy and programming on adolescents across the world? And do you think that it would be helpful for governments to focus better on adolescent well-being as countries recover from COVID-19?
Hi, Maziko. Thanks so much for inviting me today. What I like about this definition is that it goes beyond just surviving to include the concept of thrive. It's not enough to be free from disease. Adolescents need to be given the resources and opportunities to achieve their full potential, and they need to be a part of the solution. UNICEF is committed to engaging adolescents throughout program planning and implementation and evaluation. And through developing guidelines such as the Engaged and Heard for adolescent participation and civic engagement, we're helping our partners, including governments and the private sector, to do the same. And I'm really excited about the way that UNICEF is engaging young people to highlight the issues that concern them and help us to find solutions. An example is the High Five for Health educational series on non-communicable risk factors. And working with young people, we've developed learning modules for alcohol and drug use and environmental health that can help young people identify risks and strategies. And what I like about that type of collaboration is that through engaging youth to conceptualize, design, and implementing these learning tools, we can help ensure that our programming is relevant for young people. Another important message that's sent with this definition of adolescent well-being is, as the previous speaker said, the need for multi-sectoral programming to help adolescents to achieve their full potential. Adolescents need access to responsive health systems, schools, social protection, water and sanitation, justice, housing, safe environments, digital solutions, friends, and adults who just listen to them and mentor them. So multiple ministries and sectors do need to work together systematically to provide more cohesive policy making and programming to meet those needs. And at UNICEF, we really look forward to continuing to work across all of these sectors to help governments provide this holistic approach so that every adolescent can survive and thrive.
Wow, thank you, Sarah. That is absolutely beautiful and very powerful as well. And I really like how you're talking about the holistic approach. And there was a very powerful sentence that you presented the first time, saying that it is not enough for adolescents to be free from diseases. They need to be part of policies and decision-making bodies and pretty much issues that affect their well-being and health. We really need to stimulate that youth agency and really just empower adolescents to take charge. And that is exactly why we are here to have these meaningful discussions that will fit into more sustainable and impactful frameworks. I would like to pose this question to Omnia. So we are currently in the age of social media, and we have seen how people are using social media to impact change, to raise awareness, etc. I just wanted to hear from you. How do you think that young people can be engaged through other platforms to advocate for adolescent well-being, and where do you see these young people needing support?
Oh, can you hear me?
Yes, we can, Omnia.
Okay, perfect. So thank you so much for the question and for having me in this amazing discussion. I'm really heard a lot of insightful points made that I absolutely echo and agree with. In terms of the engagement of youth in digital health and social media, so I come from an organization that represents more than 1 million medical students from 140 countries around the world. And I get the unique opportunity to witness how these young students and our members are working at the front line of building the capacity and resilience of their communities, as well as raising awareness to creative digital tools and social media. And this was especially highlighted during COVID-19. And I'd like to give examples of how I think adolescents can engage based on what I've seen. So adolescents can engage using digital tools and social media in awareness building. And that's what we have done as ISMSA when we collaborated with UNFPA and a really cool platform called Prezi that does videos and presentations. Together with them, we did a series of videos for young people to recreate in their own languages, tackling different areas of adolescent well-being in COVID, including gender, mental health, and so on. These videos were recreated over 10,000 times in over 40 languages. And at the same time, we also collaborated with UNICEF and the UN Secretary Envoy on Youth on a 9-part series webinar that talked about coping with COVID and the mental health and well-being of young people. But on the other hand, I think it will be valuable for youth to organize their own hackathons, which is what we did with the Lancet Commission on Digital Health, where we asked our medical students to come up with creative tools to improve the adolescent health and well-being. It was a competition, and the winners received funding for their solution that they suggested. But I would like to also talk more about, on a local level, what adolescents can do, and they can do so much with collaborations. For example, our students in Rwanda, they collaborated with a gender empowerment NGO, and they created a lot of social media materials to raise awareness on how COVID impacted the access to SRHR services and maternal healthcare services. On the other hand, also in Venezuela, medical students collaborated with graphic designers and novelists to create stories for children and their mothers to answer all the COVID-19 related questions and how it affects children and adolescents' health and well-being during the pandemic. But most importantly, I feel that what youth need in terms of what they're already doing is that we need the support in terms of funding, in terms of mentorship, but also in terms of media coverage, as well as working together with us to access young people that also don't have access to internet and they are offline. Because what we have seen that there are many young people that don't have the capacity or they have the funding to always be online and to access these innovative tools that we are trying to provide for them. So that is also a support that would be very helpful with collaborating with different organizations like the one that we're in now, as well as other government support.
Thank you very much for that, Omnia, and that's amazing work that you're doing out there. It's very inspiring. It's really inspiring to just hear what all the young people here are doing, what all our experts and government officials are doing to really just improve adolescent well-being and health. But as Amit and Desmond had said earlier, there's still a lot of things that need to be done. And that is exactly why we are having these discussions and why we will be taking the outcomes from these discussions very seriously. I just also wanted to quickly say that I have taken note of the questions that are coming in through the chat box. So I will also encourage you can send the questions, not directly to me, you can send them to everyone if you're comfortable, so that, if anybody else that is joining. If they could also respond to you, that would be great. But if you have any questions, please let us use the chat box. Let us interact. And there's so much rich things that are coming out from this discussion. Now, we're talking about this amazing event. And I just wanted to talk to somebody who has been a part of closely organizing this event, and that is Radhika. What motivated you to keep meaningful engagement of young people a key part of the theme, and why do you think it is important for adolescent well-being and health? And also, do you have any examples of any multi-sector investments or programs that, according to you, have shown success in accelerating progress and aligns with different areas of adolescent well-being and health? Over to you.
Thank you so much, Maziko. So that's a very interesting question that has been put up to me, and I think the next lines that I'm going to say, we may have heard this a couple of times, but every time I hear it, I feel that that is essentially the essence of what we do, and that is nothing about us without us. As far as the Global Youth Meet is concerned, this has been a journey. I mean, I'm very, very proud to say that, this is the 4th Global Youth Meet on health. There was one in 2006, and then 2009 and 2015, which were, of course, all in person. And frankly, the 4th one was also supposed to be a meet in person. And then that's the time when, COVID hit us, and we were not sure what to do. And to be honest, when we were, before COVID, when we were thinking about the theme, while we were talking about universal health coverage and sustainable development goals, it was at a point when we decided that we shouldn't lose the opportunity of going digital, that we actually thought that this would be a good theme because everybody was talking about meaningful engagement. But I think what we tried to do over the 3 plenary sessions that we have, and the almost 17 workshops that we have, is that we told all our resource persons to really look at, in their discussions, talk about meaningful engagement. And what does that really mean? So there are frameworks, there is a definition, but what does that really mean when you talk about it from the brass tacks point of view? And what we also feel is that any young person can be meaningfully engaged, right? Many a times there is this misconception that any young people who are interacting or who are being called to high level meetings or who are being called to conferences, who are interacting with media, with policymakers, that is what meaningful engagement means. And we talk about terms like getting a seat on the decision making table, etc., while of course they're very, very important. But what we feel is that even if a young person is motivated enough to take some action in his or her local community, which does not get visibility, is also meaningful engagement. And I think from the perspective of the Global Youth Meet, we wanted to take, we didn't want to waste this opportunity where we know, enough has been said about how young people's lives have been turned upside down and the challenges that they are facing during COVID times. But we wanted to make sure that in spite of these challenges and restrictions, there is a tremendous opportunity to innovate and remain connected and remain active. And so I think that is the premise with which we decided to go virtual and organize this meet. That's essentially about the Global Youth Meet. Part B of your question, in terms of examples of multi-sectoral engagements, I would say that Ms. Pant talked about it briefly, but India's national adolescent health program, which has 5 major components, which she briefly spoke about, which of course include, it's very holistic. So it talks about sexual and reproductive health, it talks about nutrition, mental health, injuries, violence, and substance abuse, and non-communicable diseases. I think this is a huge opportunity for our part of the world. to tap into the potential of the young people to make a change at the community level. Another point that I want to talk about in terms of meaningful engagement is that I think meaningful engagement is also a two-way process, right? While I completely agree on, there should be no tokenism, absolutely not. There should be, absolutely serious engagement which leads to outcomes. But I think what is also important is for young people to go one step at a time. We all start somewhere in our ladder of advocacy and meaningful engagement. I think each one of us as youth advocates has that journey, right? And so it is also something that I feel, working in this space for several years now, that it's a step-by-step journey. And that is something that we need to be patient if we want to be meaningfully involved, I feel. Thank you.
Wow, wow, wow. Thank you. Thank you very much for that, Radhika. And just to say that you've done an amazing job with the event. And it's always, I always find it inspirational and admirable to really work around people who deeply understand the concept of meaningful youth engagement, not as something that they're forced to read, but something that they really believe. And that's something that I can sense from you. And amazing job and great work over there. So I would like to go over to, we've been talking to all these people. I want to go over to Preeti. So you have heard some of our technical experts and young people speak about meaningful youth engagement, as well as some ways in which they think young people can be engaged to make adolescent well-being a priority and a reality. What kind of advocacy and action is needed regionally and nationally to ensure that adolescent well-being is a priority action area, and especially in these constrained times? Over to you.
Yeah, just a minute.
Yeah.
Okay.
Sure, definitely.
So as you were saying that adolescent health is very important, and it is one of the, I would say that is one of the key determinants of countries' overall development. And therefore it is very essential to ensure that health needs of the adolescents are focused upon. They remain a priority area, and even in difficult times, we continue to focus on it. And as I have shared with you earlier, the actions that are being done by the government in this regard. So as we were just talking, that we would like to involve youth and the voices in the health programs, and their needs to be promoted both at regional and the national levels. And we also believe that the young people voices are very important, and they go into the aspects of the program designing also, because the young people have a great understanding of their own environments and their wants and their aspirations. So it is very imperative for the governments to involve their voices, to factor in their concerns. And once we do so, then naturally our policies become more inclusive, more robust, and they become more across the spectrum to address the needs. So, in this regard, I would also like to share that the ministry has supported 6 regional consultations in different regions of the country in 2019, and so as to develop an understanding of collective understanding of the present context of adolescent health across these regions, and check out what are the strengths, what are the weaknesses, and how could there be convergence between the various activities and different interventions that are being done. So the peer educator program under this RBSK program reaches out to the adolescents and equips them to take care of their health and well-being, and also equips them to help their friends about health-related information. So also these peer educators, they also help in organizing we have these adolescent health days which are held. So these peer educators also help in organizing these adolescent health days, and where again, the families and communities also get influenced by involvement of the youth in their families, and they work as, I would say, they would work as a catalyst and as a link between the service providers and between the youth and the families. And again, as we have been discussing, that the adolescent knows their needs and wants and what are the gaps. So it enables them to understand and to address the needs and gaps and advocate what are the requirements and how the program can be done in a better way. And there are around peer educators in the country which are supporting in this endeavor. And we believe that by engaging youth, we can have a meaningful and program design and implementation, and which is the utmost need of this hour, I would say. Yeah. So that would be from my side, Maziko. Thanks a lot.
All right, thank you very much. I really just love how you have all these packed answers, so much that is happening, so much that your government is doing. And I know there is so much more that you just can't share with us right now, but I think it's very encouraging to hear that through all your interventions, even your advice, the thing that keeps centering around all your responses is meaningful youth engagement. And I think that everybody who is watching now is really starting to get the sense of why this is very important and why we need a multi-sectoral approach to this. I just wanted to acknowledge a few questions that we could get into after the discussion, just to give our panelists time to think about this. And before I get to my next question, we have something from, I believe, Omnia. Okay, I think I missed that. But we have a question over here. Omnia, I think I'll get back to you quickly. So I think the person must have deleted the message. But over here, we have a comment from Paul Odongo. And he says, the discussion around meaningful engagement of youth and adolescents will always be essential through the ages. I agree. My question is, how do you keep all the stakeholders, all the key stakeholders interested to continue collaborating and supporting the youth-led programs? So I think that that's something that Radhika and could possibly take up. And I will just quickly go on to another question before we head back to the plenary session. I think it's very important that we are taking into account all these comments and questions that are coming in from the participants. Please do keep them coming. We're taking note of this. I'm just ensuring that the panelists have enough time to ponder and come up with responses. So Omnia, I talked about you earlier. So we have one from Julia, and she asked, how do you make sure that through social media you get many youth engagements? I think it was very, you talked about all these young people that you're engaged with. So we have those questions. And I think for Josiah and Desmond, we have one question over here from Walubita, who says, hello, great discussion. I'd like to find out whether there are any specific engagement strategies for youth in different regions, such as Sub-Saharan Africa and the MENA region, or are there any generalized strategies being used at the moment? And I know this question might come up later with Amit and Desmond. So perhaps you could also incorporate that in the discussion to come. So keep those questions, keep those comments coming in. I think it's very important. This just shows that we're really understanding and really trying to visualize the importance and the importance of adolescent well-being and framework. Now, speaking of Desmond and Amit, we're actually on to you currently. So we've been hearing from all these experts, all these governmental officials. It's time to hear back. It's time to hear from our young people. So both of you were part of the PMNCH-led ECOSOC Youth Forum panel. So ECOSOC, I'm just going to call it ECOSOC because, you know, it's slang and it's easier that way. So you are both part of the panel, and you engaged in insightful regional discussions reflecting on policies and programs, initiatives in place, investments, needs, etc. to promote adolescent well-being globally and in different contexts. Could you highlight top challenges and priority actions from the Africa and Asia Pacific regional group dialogues? And also just to say that I was able to join the sessions, and you did an amazing job. So over to you. What were the highlights, the top challenges and priority actions for the different regions? So perhaps maybe we can start with Desmond, since Amit, you had started last time. Over.
All right, thank you very much, Maziko. Yeah, you know, this issue of tokenism is something that is multifaceted. It exists in various forms, and one of it is that stakeholders may not understand the needs of young people because they have not been consulted. Young people themselves have not been consulted. You know, you can't understand the malady of someone without actually, you know, doing the diagnosis, where he certainly has to say, you know, I have a problem in this area of the body. So young people being consulted to say, you know, what they are going through is absolutely important to size up and understand critically what the challenges are. So in the Africa breakout session of the ECOSOC summit, which we held on adolescent health and well-being, African young people, including government stakeholders, unanimously talked about trauma and loneliness, which is affecting young people amidst COVID. It is dire. I've been talking to many young people, fellow youngsters, you know, counseling them amidst them facing trauma and loneliness. Shrinking job market. Many African countries are yet not as resilient as in the Northern Hemisphere. Education access and quality, particularly in virtual learning, is still a challenge in many parts of Africa, especially in the far-flung, underserved areas. Security for adolescent girls. You perhaps it is a big news about the Boko Haram insurgency in northern part of Nigeria. You know, other humanitarian and fragile settings, and girls are bearing the brunt. And also access to the very vital, holistic, comprehensive sexuality education. In terms of priority actions, in the Africa breakout session, we talked about the need for meaningful multi-stakeholder plan to tackle adolescent well-being amidst COVID, which is actually tackled in the call to action for adolescent well-being. The rights to protect education and eliminate child labor and child marriage, and to make education at schools safe, and also safety for adolescents, particularly girls. The need to promote holistic sexuality education, and very importantly, economic empowerment. Adolescents need money. They need money to buy food, good food to eat and be healthy, and also to learn. All of this things need a firm will, political will from governments. And so there was also the call for generally revisiting the Abuja Declaration, committing more money to strengthening health systems in the African continent. Thank you, Maziko.
Yeah,
thank you very much for that, Desmond. And over to you, Amit. Let us hear from you. What came out? What were the key issues that came out in your session from your region?
Yeah, thank you. Thank you so much, Maziko. We had like very good discussion during the panel discussion, and the top challenges identified was around like COVID-19 on adolescent health and well-being. And also, like rightly stated by Dr. Rajesh as well, one of the top challenges was mental health issues that the adolescent and young people faced. The another was gender-based violence. And third, inadequate information for adolescent and young people. Another was like access to health services. Access to education was like very limited due to like school closure that we have already discussed. I think these were the top challenges that we discussed during the panel discussion. And one of the priority, some of the priority action that we discussed during that panel discussion was meaningful youth engagement. Even the policymaker as well as adolescent and young people focused on that. And also, like we discussed about prioritization of adolescent during such humanitarian crisis, not just now, also moving beyond the COVID-19, and also like providing access to basic health services, education, and also like prioritizing mental health as well as sexual and reproductive health. We also discussed like also policymaker, young people and adolescents, we discussed that intersectoral collaboration and investment in young people is must, so that we address these challenges and keep this as a priority action for the Asia and Pacific region. Thank you.
Excellent, excellent, excellent. Great hearing from you, Desmond and Amit. As usual, I have noticed that there's a few issues that are overlapping. It's very clear that there's similar issues that adolescents all over the world. All right, it's very important. I mean, it's very interesting to note that adolescents all over the world have, you know, the same issues, face the same issues. And also, I know that Amit and Desmond were not the only ones. Josiah, you are also part of the event. Was there anything that came up from Asia, from your region, during the ECOSOC youth panel? Any key things that came out that perhaps Amit and Desmond haven't mentioned, or maybe something that's similar as well?
E te atua nau te kororea te mana whenua o tēnei rohe tēnā koe I hunga mate ki te hunga mate haere tō ora ki tātou tō ongora. I just wanted to quickly acknowledge Ngāi Tahu, the indigenous people for the land that I'm speaking to you from. Kia ora, good evening. It's almost midnight here in New Zealand. And to come to your question, I think the one of the key takeaways was that often we're looking at how to support young people's well-being, young people's mental health, and we're focusing on treatment. We're focusing on what a doctor can do, when really a lot of the whānau, a lot of the family and the community options are just as important. And we've got to offer those too, that someone could be seen by a cultural knowledge holder, that they could have access to a carving or weaving opportunity, if that was culturally enriching for them. And maybe it's something about strengthening family. That was one of the other areas. At the moment, we've got to rebalance what health is about, and health has got to be about clinical, cultural, and lived experience. And if we have those three pieces together, then we lead to the outcomes that adolescents and young people deserve.
Excellent. I think all circling back to the multi-dimensional element and context of the adolescent well-being and health. It's not just one thing. It's a whole, you know, it's a bunch of other things collectively revolving around each other. And also, Josiah, I feel like you should have, you know, taught me how to say hello as well, you know, so that I could throw that in and say hello to everybody else. But that was amazing. That was excellent. Great to hear from all of you. So now just on to our next panelist. So that's you, Josiah, conveniently. So over the next few days, we're talking about this global youth meet on health. And you know, we're not only having it for one day, it's actually event actually. So over the next few days, we are going to hear from different host officials, technical experts about investing in and engaging young people for sustainable development. As someone who is part of this cohort, what have been some of the challenges you have faced while being engaged, and how do you think we can further incentivize young people to be a part of the change? Very interested to hear this one.
Oh, well, Fafta, thank you for the question. So I grew up in New Zealand. My dad's from Samoa and my mum is a New Zealander who was born in Australia. And I tell you that because that is something we often don't think about in the context of how adolescents and young people have their voice heard, what their identity is and who they feel they are, whether they feel culturally empowered in a society to have their voice heard. And particularly when we look at young people who are growing up in places where their families might not whakapapa to, might not have that ancestral connection to because they've come from somewhere else and are now trying to fit into another space. That sense of belonging isn't there. And so that, for me, as growing up when I was an adolescent, was one of the biggest challenges. That I couldn't speak my Indigenous language. I had never been to my Indigenous land. And that felt so far away. And so for me to even be able to have the concept of raising what was important for my family and my community, I had to understand and be comfortable in my identity. So I guess it'll be different things for everyone. But before we even get to the start line for some people, there are some other things that have to go on first. And so broadly, I think there's two areas. One is that self-development and that family and community development that some people need. And it's important that we have the mentoring for so people can get to the start line. And part of that could be just self-belief and knowing that people believe in you. And then part of it is when you are participating, that the community there really show you that what you are doing means something. And the work that we do in raising Pacific young people, so diaspora in New Zealand, their voices, we've been blackmailed by decision makers. We've been called names by politicians. I was called a Luddite. I don't even really fully know what that means, but that's by one of the politicians we shared something with. We went to Uganda to a youth conference that we were speaking at, and politicians from around the world belittled us when we raised something that was important to the young people that we were in a group with. But the point we still stood our ground and said what needed to be said. We did it respectfully, and part of it is that we can show the way leadership should be and hold the space in a way that might be different. And part of that too is we say things like love is an action. And so showing through that listening is an action, and like we see it with the climate strikes, and as Indigenous peoples, we have always had hope in the face of challenges and adversity, and we've always found a way through. So it's looking, sometimes when we might have the despair creep in, it's finding moments of hope and other stories that have had and led to change. Again, things like the civil rights movement in America and what's happening still. We can look back at what leaders have made different by speaking up and find others around us to do that alongside.
Wow. That was really powerful, Josiah. And I think one of the things that I really loved about your remarks is just how what I like saying, humanized the adolescents. You're talking about these young people and adolescents, not as a statistic, not as some case, but as human beings, and I think that is very important that, beyond all these technical jargons and terms and all these, technical frameworks and whatever, we really need to start recognizing adolescents as human beings with human rights, really. So Josiah, back to you. So do you think we are doing enough, and will we be able to achieve our goals for adolescent well-being in 2030? What more do you think needs to be done?
I don't think we're currently doing everything we could do to get there. I think there is hope we can get there. But one really meaningful thing that one of our leaders talked to me about a couple of weeks ago was, in New Zealand, we have the privilege of being a country which is founded on a relationship between the Indigenous people and then the British Crown at that time. And that document is the Treaty of Waitangi, a very, very special document. And we've got this opportunity in New Zealand, and everywhere around the world has the opportunity to do what those things say, or live in a way which is inspired by them. So some people, you try and do the compliance part, and that only takes you so far. But if you do it and you're inspired by something, it leads to different outcomes. We're not trying to do the minimum anymore. The minimum standard doesn't work and doesn't lead to enough. And so what we've got to lift our game, and one of the ways is power sharing. We can say all that we like about the meaningfulness of young people's voice, but if we can't show that, and actually as setting ourselves up for better decision making, really, by having young people as co-decision makers, we know that's the best way to set up our future. And with the political terms that governments have and how short they are, we can't be thinking about these next 3, 5, whatever amount of years. We need to have 50, 100-year visions, and we do that by developing leadership now. And so, like, one of the special examples from my country is when I was 22, and it's a little bit older than adolescent. I was the first young person who was put onto a commission of inquiry in New Zealand's history, and we reviewed all of mental health. There were 6 of us who did that, and that spoke to something different. It was actually some real skin in the game. We could make the recommendations which the government have taken on and has changed mental health policy forever. I don't know how many other countries are willing to put that much of a risk to put a young person on a royal commission or an independent review, but then also having the right supports around them doing that. But when that's done well, that can change everything, because it's real. It's not trying to wait for 2030 or work out some sort of small steps. We need big steps, and those kinds of things are the big steps that will get us to where we need to be.
Thank you very much for that, Josiah. And I think that is very important. Unfortunately, we are running out of time, and I know we've been, the engagements, the insights have been really inspirational. I feel like I'm just starting to learn everything all over again, which is a good thing. And just to say that we've recently had Josiah, Amit, and Desmond speak. And they were part of the ECOSOC youth panel. And I just wanted to say that this youth panel, the conclusions from the youth panels and the recommendations are going to fit into a report that will be represented by young people at the high-level political forum on sustainable development in July. And also just to say that these outcomes are expected to feed into the joint statement of the United Nations member states at the time of the HLPF. The results from this event will also be used as to set an agenda at the summit, on the global summit on adolescence in 2023. And I would really just, we're coming to the end of our plenary session, unfortunately, and I'm really enjoying this so much. And really, I really mentioned I'm an emotional person, trying hard not to cry, trying hard not to tear up. So, okay, all right, just saying. But also, just to say, for this next segment, could we please keep this very short? I'm just going to ask for quick reflections, because we really don't have enough time to delve in deeper as we had wanted to. So I would really just want at least about a minute to 2 minutes, please. I know we have so much to say, but for this next segment, can we kindly keep it very, very short and brief and straight to the point, so that we can at least have a few minutes to just address some of the questions from the audience. I would like to pose this to the officials and the technical experts. So that's Preeti, Rajesh, Sarah, and Radak. The call to action for adolescent well-being calls for 3 main things, right? Which is engaging and empowering adolescents, going beyond the health sector, and launching of powerful multi-sector responses, and strengthening political commitment and funding through a global summit on adolescence. What can young people themselves do to drive action for this? And let's just say 60 seconds. What would you say? Just quick reflections. So perhaps you can start with Preeti, and then we'll go over to Rajesh, then Sarah, and then Radhika. Let us hear from you, Ova.
Okay, thanks a lot, Maziko, and enjoyed your discussion. And in short, I would just like to say that we believe that a young should not only be in control of their own health, but by adopting a healthy lifestyle, but also encourage their peers and others to do the same. And they must voice their opinions, their needs, and their aspirations, and share with those of us in the government. This will not only strengthen the programs, but also improve their ownerships by them and make the program holistic in the true sense. So over from my side.
Thank you very much for that. And then maybe we could go off to Radhika.
Hi. So I think if I were to put it in a nutshell, and I'm sure a lot of points have been said, but I think find your allies is something that a tip that I would like to give, and it could be anybody. It could be a policymaker. It could be anybody in your environment. Find who your ally is, and at the same time, credibility is very important. I think from that perspective, you need to be careful about the stakeholders that you interact with. Where do you get your funding from? Transparency and accountability are very, very important for young people to be taken seriously. Just stop there.
All right, great. On to the next. Sarah, please. Or is it Dr. Rajesh? Yes.
Yeah, sure. Thank you, Maziko. The processes are equally important as the outcomes. So Radhika did mention about this transparency, accountability, but capacity building is also a big unfinished agenda. How do we build capacity of the young people to lead? Also arrange support from multiple, partners. So government is one main leader, but at our end, we are setting up now regional youth networks on WHO Southeast Asia Regional Office behalf. So we are setting up a youth network across the countries in these 11 countries. And we are bringing together all the UN partners for doing this. And within my office, I have 10 technical units ready to support this work with young people and adolescents and follow a process of continuous capacity building so that the adolescents can actually hold us accountable with that knowledge and with that capacity. Over.
I love the accountability aspect. A lot of people just like developing all these strategies and frameworks and interventions, but no way to hold you accountable. So really, really love that. And let us hear from you, Sarah.
Two things. One, stay informed, and two, stay engaged. In terms of staying informed, I've been following the chat and I really appreciate the questions that are coming. I would really encourage you, I dropped in the link to the Voices of Youth website. We have 10 million users per month to that website. So I would really encourage you to go in and take a look at the materials that can inform you on, for example, prevention of NCDs, mental health issues, all kinds of issues that affect youth. And those materials are developed by youth. But together with experts who can put in the evidence base, but all the language, all the drawings, everything is developed by youth to make them relevant. The second way, I also dropped in a link to the U Report. We have 13.6 million users around the world now. Add your voice to there. We use those polls all the time to inform both governments and policymakers, but also our own work. And, there was somebody who asked, how can we say what we want in terms of vaccinations? We have polls on that, and we do share them with policymakers. So stay informed, stay engaged. Thanks.
All right, I love that. Stay informed, stay engaged. Young people, you have heard from our experts, from our representatives, from governments. And I really like what Dr. Rajesh said last time about accountability. So I would like to throw this to you, young people. Let us try to hold these people accountable. Do we agree or disagree with what they have just said? How do you think young people can be supported and engaged so they mobilize support for these asks? And what do you think are key opportunities we can take forward to accelerate progress on adolescent well-being and health? This question is for everybody that is watching right now. Please type out your responses, your answers, and I will be able to read them out quickly. But also to our amazing young people here, Josiah, Desmond, Amit, and Omnia. That was a very packed question, so I'm just going to quickly take it back. So do we agree or do we disagree? And also another thing is, how do you think young people can be supported and engaged so they mobilize support for these asks? And what do you think are key opportunities we can take forward to accelerate progress on adolescent well-being and health? So perhaps we can start with, I see a lot of men up in here. Let's start with some female energy. Omnia, let us start with you. What do you think? Let us hear from you.
Yes, so my answer is yes, I agree. My second answer would be that we are already engaged, and that is what I've seen with young people around me and like myself. But I feel the key message for me and for all the young advocates is to always be persistent. We always call on being part of the decision-making table, but it's time to reorient the decision-making table, because we are not just add-ons to what adults are, or governments or policymakers are doing. We are really a key stakeholder, because again, this is our health and this is our future, and we are already involved. But the key opportunities for us is to have our engagement and our persistence to be part of the process. We already do a lot of identifying in terms of the needs of our own communities, in terms of the key areas that we need improvement in, and we have our policy requests and recommendations. And I really love how Radhika touched upon credibility, which is very important. But what we also need is a platform for us to share our efforts in and our engagement. And for this platform to be persistent and to be consistent and meaningful, for us to always be engaged, not just be there to speak in a webinar or in a session, but to always be part of the process. And there are upcoming events like the UNHLPF, as well as the COP, climate change conference, in so many different areas. But what we need is for us to be part of the country delegations that are attending these meetings, to be part of the consultations and the negotiation processes, and to share what we are doing and what we are seeing on the ground from our communities, and to be able to voice that and for it to be integrated in the policy frameworks that are shaping our future. And I want to just highlight that next weekend there will be one of the biggest global youth conferences, which is the Global Youth Summit, organized by WHO and the 6 big youth organizations. So these are events that are youth-led, and we always want the support of governments in that, to take our call to actions and our declarations and really integrate it meaningfully across not just global treaties, but also taking it from global to local context.
Wow, thank you very much for that, Omnia. And one of the things that I picked up is definitely resistance, persistence. It's not going to be easy. We're talking about meaningful youth engagements. I'm on my desk right now, but it's really not that easy. We need to make sure that we're persistent. We need to break through these barriers, and we need to ensure that our voices are heard, and we cannot give up. We need to collectively act, and we need to make that noise and not give up. Be persistent and be part of country delegations. Don't just randomly just attend webinars. Be intentional, be meaningful with your voice. Feed into relevant strategies and policy frameworks, and do not give up until every girl and boy out there's adolescent well-being. Every girl and boy's well-being has been improved. Over to you, Desmond. I see you've already unmuted your mic.
Yeah, it couldn't be this dire that adolescents need this attention at this crucial moment in time with COVID-19. But I think meaningful youth engagement should not be lopsided. As far as young people should be engaged by decision makers. Young people can also engage decision makers, and they should be engaged actually. They have innovative ideas. There is this thing we talk about, youth professionalism, that needs to be leveraged across platforms. Young people who have the ideas, who have the innovative skill set should be welcomed. Their skills should be utilized. And how can that be done? They need finances, they need financing, they need funding, they need technical support. All of these things need to go down to those young people in order that they can make meaningful impacts in their communities. I mean, until you get down there into the grassroots to see what young people are capable of, you cannot just say, we have limited skills there. So this should be done both ways. Thank you very much.
Thank you very much for that, Desmond. And over to you, Amit, just to say we're running out of time. So let's just quickly get straight to the point, which is what everybody has been doing, by the way. This is not one of those hints. So definitely not. We're all doing a great job. So over to you, Amit.
Thank you so much. I definitely agree with all the speakers, and I think it's a very good platform that we have discussed this. I would like to focus on all the panelists also that acknowledge us, prioritize us, include us, and also support us, acknowledge our challenges that we have faced, and also acknowledge us and prioritize us as key stakeholders and also as expert in our own agenda, and also increase investment on young people and adolescents, and provide support by having through accessibility of education and health services, and also prioritize our needs. And how can we take these agendas forward? I think social media and technologies is one of the important aspects, and there is high penetration among adolescents and young people. And second thing is we have to take benefit from the demographic dividend. And I would like to urge all the policymakers, all the stakeholders that let's take benefit from the demographic dividend. And also the final would be the youth movement and initiative that we have. And also from the panel discussion today, we felt the consciousness for adolescent health and well-being and meaningful youth participation among all. So I think these are the very important factors that will help us to take adolescent and the agenda of adolescent health and well-being forward. Thank you so much.
It's like Masiko seems
frozen. I think it's her internet.
Yeah.
Bhavya or Narissa, you want to take over?
Yeah, sure. So Josiah can go next for his comments, and then we can just screen them in.
Yeah. Sorry to interrupt, but just that I'm a little concerned for time since we need to start the formal ceremony in the next few minutes. So maybe we can just wrap this up in a couple of minutes, please. I really apologize for that.
Thank you. And just to conclude, I think one thing that all organizations could do meaningfully is help us reset what we value in terms of the work, the jobs that are available, and what we're looking for in the jobs that are available. If youth advocacy or experience around helping enable people to have their voice heard had a greater weight or was valued more, that could be a useful tool to help increase advocacy because employers thought it was useful. I suppose the other quick thing is, where possible, and I know it's complex, but moving beyond the binary views of gender, and then the views around, and then enabling people who have different sex characteristics and different gender to have their voice heard in what we do as well.
That is great. Thank you so much, Josiah. We're just going to screen a movie on adolescent mental health, since we've been speaking about this we've been speaking about adolescent well-being and how we can meaningfully engage young people. Mental health seems to have come up multiple times during this discussion. So a very short clip for everyone, and then we can quickly wrap this really amazing session up.
The COVID-19 pandemic has changed the way we live, affecting our health and well-being.
A few simple things helped me stay positive and healthy. I make sure I do something which I enjoy every day. whether it's reading or listening to music.
I have also been practicing the guitar.
I draw and sketch sometimes. My drawings cheer up my family too. This helps me stay creative and do something for others.
I choose to cook my own healthy meals now.
I remain active
and go to sleep on time.
I study with my friends online until it is safe to return to school.
At the start of the pandemic, I thought of turning to alcohol or hurting myself, but I'm glad I didn't. Instead, I spoke to a friend for hours. My friend suggested I talk with a mental health professional. After talking to them, I feel much better and hopeful about my future again. Some things are slowly going back to the way they were before the pandemic.
But it's still important to follow physical distancing, hand washing, and other health advice.
I continue to do a few simple things every day, which helps me stay positive and healthy.
Thank you very much. As one of the organizers, I would request Radhika to very quickly wrap this up and then thank the speakers.
Hi, Maziko. Good to have you back.
Hi, everyone. Apologies for that,
That's
but
all
I
right.
just watched the mental health movie.
That's all right. So on behalf of the joint co-organizers of the Global Youth Meet Hriday and the World Health Organization Southeast Asia Regional Office, I thank all our panelists, and more importantly, I thank all the participants who've been listening to us very patiently. So thank you very much, and we look forward to staying connected. Just a heads up that in about 20 minutes time, on the same screen, we will start the formal inaugural ceremony of the Global Youth Meet on Health. We have an eminent panel of policymakers and technical experts and young people on that panel. So see you all in about 20 minutes time. Take care. Bye-bye.
Yeah, before everyone
yes.
leaves, I request everyone to please switch on your cameras so that we can click a group photograph.
Bhavya, Narisya, Prachi, that includes you as well.
Thank you, everyone.
Thank you, everybody.
Thank you. Bye-bye. Take care, everyone. Stay safe.
Bye-bye. This was an
Bye. Thank you.
Thank you.
Thank you.
Bye-bye.
A very good afternoon, good morning, good afternoon, good evening to all of you. On behalf of Hriday, WHO Regional Office for Southeast Asia, and the GYM partners, we would like to extend a warm welcome to all of you to the 4th Global Youth Meet on Health. Theme, Meaningful Youth Engagement for Leading Action on Universal Health Coverage and Sustainable Development Goals. Thank you for joining us for the inaugural ceremony. We are very proud to welcome participants from across the globe representing all 6 WHO regions from approximately 35 countries. And we have over 600 registrants who will be participating over the 2 days, 20th and 21st of April, 2021. In the current unprecedented times of the COVID-19 context, we are extremely grateful to all of you for joining the Youth for Health movement for adolescent health and well-being. To start the proceedings, I would like to invite Dr. K. Srinath Reddy, President Public Health Foundation of India, and President Global Youth Meet on Health 2021 to deliver the welcome address. Over to you, Dr. Reddy.
Excellencies, dignitaries, and dear delegates of the 4th Global Youth Meet on Health. We meet in extraordinary times. This was not what was envisaged when the 4th GYM was on the anvil. We had not anticipated the COVID-19 pandemic. And of course, that led to some postponements. However, this is perhaps the most opportune time to hold a Global Youth Meet on Health, not merely to voice the aspirations of a generation that is looking forward to a healthy future, but also to take stock of all things that might have gone wrong, which need to be avoided while configuring that future. And who better than the youth to take the stock and then carry the lessons as they craft a healthier society in a sustainable development paradigm. Indeed, we have recognized that there has been an immense sense of shared vulnerability as nations across the world have been challenged as never before in a century. We recognize that what started off as global health in the last part of the 20th century, from a sense of shared vulnerability from the threat of pandemics like SARS-1 and the threat of global bioterrorism, now must move to a new chapter in global health, where the momentum is created by a sense of shared values, not merely shared vulnerability. And those shared values must reflect global solidarity, universal health coverage, and sustainable development. Indeed, we recognize as we move along that there are many elements that connect health and nutrition to the environment, economic development, equity, social solidarity, gender justice, to name but a few, all of which feature in the Sustainable Development Goals agenda. And these are all interconnected issues. And that's why the agenda of the Global Youth Meet looks at all of them, not merely in isolation, but essentially as complementary areas of development. So indeed, the long lifeline of human health must extend from the pulse to the planet as we recognize and respect these connections. Never before in human history have we been so forewarned of the dire destiny that awaits us if we continue on the current path of distorted development in terms of climate change, non-communicable diseases emerging as huge epidemics, and conflict also threatening lives, young and old. But never before in human history have we been so forearmed with the knowledge, the skills, and the tools to alter the course of that destiny to build a better world. And that is why the Global Youth Meet on Health is very important, because this is not a future that must be just passed on as a passive heritage by the present generation. You, who are actually going to be the creators, as well as the people experiencing that future, must not be the passive recipients of a flawed future bequeathed to you by a generation that was preoccupied with the pursuit of profit and pleasure of the present, well-meaning or otherwise. It is for you to identify how the foundations of that future must be built. And that's why the Global Youth Meet on Health. I believe that the United Nations, as well as the World Health Organization, have given a call to build back better. In fact, we must build forward better, but not just better, but broader and fairer. A broader health system with greater emphasis on primary health care, universal health coverage, broader in terms of connecting with the social determinants of health, and fairer in terms of its emphasis on equity in all dimensions. And that is why the agenda of Jim addresses all of these issues and creates a charter for creating that future. As the Nobel laureate Toni Morrison said, if we do not create the future, the present extends itself. We cannot afford a passive response. We must actively assert collectively to create a healthier future for the world that you shall inherit, and therefore you must build it yourself right now on. And that's why we welcome you to the fourth Jim to hand over that responsibility to you, to lead us from this period of challenge to a period of much greater hope and accomplishment. Thank you very much.
Thank you, Dr. Reddy, for setting the pace of the inaugural ceremony as well as the Global Youth Meet and highlighting the important role that young people have to play in prevention and control of diseases and promotion of healthy behaviors. With this, may I now request our next speaker and youth voice, Ms. Bonita Sharma, co-founder and CEO of Social Change Makers and Innovators, SOCHAI, to deliver the keynote. Over to you, Bonita.
Thank you, Prachi. Hello and namaste, everyone. I'm Bonita from Nepal. Firstly, I'd like to thank WHSCRO and Viday for this opportunity. I know how important it is to have a voice at a platform like this, because while growing up, I used to observe that most of the time, whenever it came to the topic of youth, it would be the adults speaking on stage while the young people would be distributing badges. And as an adolescent, I used to think that without having adult abilities, I'm unable to make a change. And of course, since our childhood, we've been told that youth are the future, but no one really mentioned that we are also the present. So I went through the process of unlearning and relearning to be where I am today, from a self-doubting adolescent to a youth who started her own company, SOCHAI, and got listed by the BBC as 100 most influential women of the world for our work through SOCHAI and our low-tech innovations, such as the NutriBeats bracelet that I'm wearing in my hand right now. It was a challenging journey indeed, but I was privileged that I had the access to the network to break the systemic barriers for youth engagement. But I would also like to acknowledge the population of youth. That's 1.8 billion. That's 1.8 billion ideas and minds whose potential is not adequately tapped on, and they are not being engaged meaningfully in the global health agendas. But this big chunk of population, this number alone is not why we need meaningful engagement, because in reality, youth engagement is the only solution. It's the only way that we have if we are to fully achieve the universal health coverage and the sustainable development goals. And it's even more important to prioritize meaningful youth engagement and harness the power of youth, because we are dealing in this difficult situation, and it has affected everyone and everywhere, but it's evident that the impact has been disproportionate, because I see that in my own community where I work, the digital gap has limited access to information and knowledge and education for youth. There's increased vulnerability of violence and abuse. Youth unemployment has increased, and there are thousands of families of young migrants who have lost their source of income. Most of the time, it's also assumed that young people are the healthier population, and they can just deal with everything that's thrown in their way. But in reality, we are currently, like other population, dealing with NCDs, mental health, climate change, the problem of pollution, poor sexual and reproductive health, the triple burden of malnutrition, and obviously the COVID infection. The pandemic has definitely exposed the realities of our public health system. And youth, I think it's a big lesson that we've learned, that if us as young people, as adolescents, we are not too young to share this crisis, then we are never too young to share these solutions. And I say this in all of my talks, that whenever life gives you lemon, you make a lemonade out of it. But right now it's the situation where the young people are making jam, juice, pickle, and whatever it is possible out of that lemon, because during the COVID pandemic, me and my friends, as well as other youth organizations globally, were working as health workers, we're working as frontliners, as innovators, researchers. They were contributing for policy and program planning to tackle the COVID pandemic. And it's also another important lesson that investing in health for all is not an option. It's not optional choice, it's mandatory. And it's important that we have youth-led and youth-centered universal health coverage. Our challenges and needs are addressed, our contributions are recognized, and we are included in all level of decision-making. So my humble request to all the young people watching this right now is to push yourself, to learn new skills and knowledge, to do research, to be proactive and claim your space. And it's also our role to be watchdogs, to make sure the stakeholders are accountable. And whenever we work collectively, we have a strong voice, then we will definitely be heard. And my other humble request to all the stakeholders, policy planners, as well as dignitaries present here, I request you to trust on us and take chances on our ideas and support our ideas. Because whenever there's an enabling environment for us to be leaders and decision makers, we will thrive. Because we just don't want to be just another voice on the table. We don't want to be limited to an agenda on a document, but we want to contribute meaningfully. So please recognize the diversity that exists within us and inform us and engage us in policy making processes, universal health coverage dialogues, as well as intervention design. And lastly, I want to conclude by saying that, we talk about leaving no one behind. It's time to walk the talk and ensure that there's respectful partnership with young people and adults, so that we are not just the beneficiaries, not just a token, but an equal partner for development. Thank you once again for this opportunity. And I look forward to hearing and learning through this platform. Thank you so much.
Thank you, Bonita, for sharing the health needs priorities of young people. And we are sure the delegates will echo your thoughts completely. We are sure the young participants who are here with us at GYM 2021 will benefit from your advice as well as your guidance. Thank you, Bonita. It is my pleasure to now invite our next speaker, Dr. Prem Namgyal, Director Program Management, WHO Regional Office for Southeast Asia, for the inaugural address. Dr. Namgyal, over to you.
Thank you. A very warm greeting from WHO Regional Office here in Delhi. Your Excellencies, distinguished delegates, ladies and gentlemen. Our Regional Director, Dr. Poonam Khetarpal Singh, would have very much liked to attend this important meeting. However, she is unable to do so due to a prior commitment. It is therefore my pleasure to deliver this message on her behalf. I quote, "The emergence and spread of COVID-19 has exposed health system gaps and underscored the critical importance of health to all aspects of sustainable development, making the attainment of our goals over the course of this meeting all the more urgent. The pandemic has highlighted the complicated and often interlinked public health challenges we face, and which will define population health in the years and decades to come, from communicable and non-communicable diseases to environmental health, mental health, and sexual and reproductive health. As young people, you have critical insights that can help improve the quality and reach of the health services that youth can access, particularly for adolescent sexual and reproductive health, and also mental health. But as the leaders of tomorrow, you must apply your ideas and insights to the full range of health challenges we face, and to the region's overall quest to achieve universal health coverage, the flagship priority and the SDG targets that underpins all others. I urge you to make most of this action-driven forum and to focus your attention on several key themes. First, decoding the linkages between existing and emerging health issues and identifying ways to drive cross-sectoral actions. For example, tobacco use is a major concern of non-communicable diseases, and evidence shows that it is more prevalent among youth and those often with mental health issues. Policymakers can therefore strengthen tobacco control and enhance the quality and reach of mental health services to reduce tobacco use and promote better NCD and mental health outcomes. Second, understanding and overcoming the many social and economic determinants of health. In countries at all levels of income and development, health and illnesses follow a social gradient. The lower the socioeconomic position, the worse the health and poorer the access to health services of quality. To create a fairer and healthier world, young people must play an active role in addressing the social determinants of health while also tackling its commercial determinants. Third, identifying long-term strategies to promote youth engagement towards achieving UHC and SDG. Initiatives that involve youth in policy development should be considered a best practice across a range of policy areas, from promoting healthy eating and physical activity to improving road safety and reducing road traffic injuries and deaths, the topmost cause of death among adolescent boys and youth. I am certain that the bright young delegates gathered here will deliver on each of their objectives and much more. I wish you all the very best. Stay healthy, stay safe. Unquote. I echo that sentiment and I wish this meeting all success and I look forward to the coming proceedings. Thank you.
Dr. Namgyal, thank you very much for highlighting opportunities for youth leadership and guidance and support. WHO Regional Office for Southeast Asia has been extending towards meaningful youth engagement. I now invite Dr. Svetlana Axelrod, Director of the Global NCD Platform, World Health Organization, for gracing the participants with her special address. Aarti, can you please share your screen and have Dr. Axelrod's presentation on screen?
Thank you very much. Can you hear me? Yeah.
Yes, we can.
Great. So let me go to my slide. So, dear excellencies and distinguished guests and colleagues from the WHO, it's really a great privilege for me to be today with you on this fantastic event. And greetings from Geneva. My name is Dr. Svetlana Axelrod, and I am Director of the Global Non-Communicable Diseases Platform in headquarters in World Health Organization. And as I said, it's a great privilege for me to join you today to commemorate and highlight the vital role of young people in shaping our world, particularly in the context of the global health and health policy. And today I'm happy to discuss with you how it is important to work with young leaders to address non-communicable diseases and mental health from the perspective of the World Health Organization and from the perspective of the department that I am leading, Global NCD Platform. Can we go to the next slide, please? So, as you know, non-communicable diseases are now the dominant cause of the death and disability across the world. And NCDs kill 41 million people each year, which is equivalent to more than 70% of all deaths globally. And 85% of NCD-related deaths between the age of 30 and 70 years happen in the low and middle-income countries. The risk of COVID-19 is higher with people who have NCDs. And an estimated that 1.7 billion people, and it is about 22% of global population, have at least one underlying condition putting them at the high risk of severe disease should they become infected. And also NCDs are threaten national economies. And it is also very important that it is a part of the discussion of the 2030 Agenda of Sustainable Development. Can we go to the next slide, please? So the third UN General Assembly high-level meeting on NCDs, which was in 2018, expanded the NCD agenda from 4x4. We are saying about 4 major NCD diseases and about the 4 major risk factors, such as tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diets, to, as we call it now, 5x5 agenda and approach. And now it is also includes mental health, and also one of the risk factors, it is environment. So you can see in this slide the 5x5 framework, which we're focusing on now. The next slide. Why it is so important to engage young people, youth, in the health matters. And that is what I want to show in the next slide, please. And also to pay your attention, because we are working very closely with the young people. And what it is very important, that the youth are affected too. And I would like once again to say that some of the diseases on NCDs can start when you're very young. And it is important to know and to keep it in mind that NCDs and their risk factors need to be dealt with the thoughts, the life course, and also youth have an important life experience. So young people can do something about it. Of course, they could be an advocate, they could be a good communicators, they are young health professionals, and they are also researchers and leaders. So young people are very well connected. And we know that we have both global and local networks where the young people could communicate. They have organization, campaigns, social media, knowledge sharing, and other networks. And all these networks could be effectively used to raise awareness and generate movements through their activism. And of course, youth are the agent of change. Next slide. I would like now to tell you a little bit more about the Global NCD platform. This is the department that we have in the headquarters and how we engage with young people. Next slide. So the Global NCD platform, you can see the functions of this department on this slide. What we are consisting is, it is a new department which appeared after the transformation that we had in the headquarters. And we are guided by the Deputy Director General, Dr. Susanne Jakob, and we are located in her office. So the Global NCD platform, and as we call it GNP, consisting of 2 big entities. One is the Global Coordination Mechanism, and we say it GCM, and also UN Interagency Task Force on Prevention and Control of NCDs. And currently the GCM convenes around 450 participants, including member states, UN agencies, private sector, academia, as we call it, non-state actors. And UN Interagency Task Force includes more than 40 UN agencies, plus World Bank, and also regional development banks. In addition, Global NCD platform also oversees several multilateral high-profile projects and initiatives to help WHO member states to scale up their actions to reduce premature NCD death and also to achieve the universal health coverage. And we work closely with all 3 levels of our organization: headquarters, regional, and also country level. And we also have the network working collectively with the technical departments in the headquarters. And what is important, we involve young people in all our activities and in global meetings, in seminars, webinars, and also we are working very closely on the now it is important on the COVID and NCD agenda. So the next slide, I would like to give you a couple of examples how our activities and what kind of collaborations do we have in the past with young people. Next slide. So this was a very interesting meeting. It happened in Denmark. It was the Global Dialogue on the Partnership for Sustainable Financing on NCDs Prevention and Control. And it was organized by the WHO and also, as I said, the government of the Denmark. And during this meeting, we had the Youth Innovation Labs. It was a project in collaboration with the World Diabetes Foundation. And it was a creative process where about 20 selected young professionals worked together during 4 days of this conference on innovative ideas and solutions, how to help close the existing funding gap on NCDs. And the Innovation Lab aligned with the global dialogue and engaged talents as active contributions to the shared agenda. So the most innovative talent, the next slide, please. And the most innovative talent teams presented their solutions to the high-level experts and decision makers from the global dialogue, and eventually progressed to the Innovation Lab in Singapore to further explore their ideas and solutions. The next slide. That was also a very big meeting, and it was a very successful meeting which we had in 2019. It was in Oman, and we also engaged the young people here. So it was the WHO global meeting to accelerate progress on SDG 3.4 on NCDs and mental health, and it was also organized by the WHO, and it was hosted by the government of Oman. The next slide. During this meeting, we had received more than 500 submissions from all around the world. And 19 success candidates were invited from 18 countries to attend this meeting. So it was, we had several selection criteria, how they could be selected, and they were with us during these 3 days. And as a part of this program, our young delegates were offered roles as the speakers and also as the reporters. And beyond their participation in the program, they also had an opportunity to meet with the Dr. Al-Mandari, the regional director of the WHO in Eastern Mediterranean office, and also with the high-level speakers. I see today a lot of familiar faces who are attending this meeting, and they were also with us at this conference in 2019. The next slide. During this Oman meeting, we also have a physical activity event, which also provided a great opportunity for children to participate. And I want to highlight, as I'm a pediatrician by my background, it is the engaging children is particularly important because children are our future, and their healthy habits needs to be formed in the very early stage of their life. So next slide. In September 2020, WHO organized a side event. It was a virtual side event during the UN General Assembly, and the name of this event was Youth and Health, Challenge Makers in the Changing World. And Director General Dr. Tedros was participating, and he said his words of welcome to the young people. And the UN Youth Envoy was also during this event, and he took part in this interactive discussion. More recently, in January this year, we held the WHO Global Seminar when we launched the global report of the Oman, and we also made attention for the participation of young people for their role as the speakers, and it was also attended by the Director General, regional directors, and ministers from all over the world. Next slide. On this slide, I would like and I want to show you how we are engaging young people. What kind of activities do I have? So we have NCD Lab on next generation on NCDs, and WHO informal consultations with people living with NCDs, including people living with diabetes, which was recently also produced. Nothing for us, nothing without us. It was a report that we launched a couple of days ago. Next slide. The other activities that we engage young people is the NCD Voices in the Decade of Actions, Community of Practice on NCDs and the Next Generation, and also we have WHO Civil Society Working Group webinars. The next slide. So to conclude, I would like to say that working with young leaders and youth organization is priority for us, since by providing this important engagement platform with WHO, and we are harness fresh ideas, encouraging innovative research, and ensuring a whole of society approach to address NCDs and their risk factors and mental health conditions. So finally, my next slide. So it's really a great pleasure, and I am very glad to be part of this meeting with some of many inspiriting young leaders and change makers. And I, of course, want to wish you all productive and fruitful discussion during this meeting and these days. Thank you for your attention.
Thank you very much, Dr. Axelrod, for the inspiring address and for sharing youth engagement opportunities that are accessible under WHO's guidance. And we are sure that the participants here will definitely benefit from your address. I now request our esteemed Global Youth Meet 2021 patron, Her Royal Highness Princess Dina Mired of Jordan, immediate past president, Union for International Cancer Control, and special envoy for non-communicable diseases, vital strategies to address the participants. Over to you, Princess Dina.
Thank you very much. Dear Excellencies, colleagues, and friends, and most importantly, all the young health leaders today from across the globe, this meeting is dedicated to you. I'm delighted to be amongst all of you today for the 4th Global Youth Meet on Health. It is very heartening to note that in spite of the challenges that we are all facing in our respective countries and communities due to the devastating COVID-19 pandemic, you, our youth champions, have stepped up and found opportunities to be meaningfully engaged for matters that are critical for global health and development. Youth engagement in universal health coverage and sustainable development goals is the theme of this conference. The world has increasingly realized that we cannot meet the challenges of today nor of tomorrow's without meaningful engagement of you, our youth. This has been made timelier given the fact that the global youth population, currently at 1.2 billion, is projected to reach its peak to 1.4 billion by 2050. Can you imagine a world where such a sizable segment of the population is not only ignored, but also not utilized and not engaged? Can you imagine the opportunity loss of not equipping this segment of society with the necessary tools for positive engagement? Incredulously, until recently, a couple of years back, this was unfortunately the case. You, our youth, were ignored as a target group and certainly not included in decision or policy making. Tokenism was the order of the day, unfortunately, despite the fact that you are the very ones who will carry the burden of such long-term consequences and the ones who will pay the price of today's decisions. And despite the fact that we have witnessed you, our youth, leading in many other sectors, such as in IT and business sectors, offering amazing innovations and solutions to many of today's problems. Having said this, if we are to brainstorm strategies of how to include you in meaningful engagement, ironically look no further than the tobacco, food, and alcohol industries. In fact, those industries have long known the power of engaging you, the youth. They are the ones that have tapped on your influence and, in fact, geared their whole strategies on you. They listened and understood you even better than you know yourselves. They understood that when you put at the table in early childhood, for example, what you put on the table when you're children forms the very basis of a long life habit of healthy or unhealthy eating. Therefore, these industries bombarded you through sneaky and evil advertising to make sure that you go for junk and processed foods instead of healthy options, for example, and the same with alcohol and tobacco industry. They understood your vulnerable periods and made sure to be around you, constantly present in your environment, whether passively or actively, through irresponsible advertising so that you pick your first cigarette or your first bottle of alcohol, and ingeniously making you feel that you actually made that choice. Unbelievable. They understood the fact that whatever you learn or see when young is the route to making you their lifelong client, so that you continue to fill the industry's coffers at the expense of your health. And that is why we are now grappling with alcohol, drugs, nutrition and micronutrient deficiency, undernutrition and obesity, lack of physical activity, tobacco use, and other issues. It is primarily you, our youth, that will be affected by inequality, increased disease burden, poverty, injustice, lack of education, and various other prevalent social concerns. That is why, if we are to succeed in fighting NCDs or to achieve universal health coverage or the 2030 Sustainable Development Goals, we have to accelerate the engagement of you all, our youth, in all of today's challenges that we are facing, because that is the smart thing to do. That is why I upload this Global Youth Meet, because it is listening and giving you all the chance to be heard and to be active members of society, influencing, hopefully, future policy decisions. We need you to be aware of the commercial determinants of health and the NCD risk factors. We need your narrative to guide us on how to face off with the industry with these challenges. And we desperately need your engagement so you can be powerful agents of positive change that you are meant to be. I strongly believe that we cannot imagine healthier populations without this effort being powered by you, the young people of this world. Yes, the public health challenges that we are facing as a global community are complicated. However, I know that the solutions are within you, and many of their mitigation strategies are embedded in local action, something which each one of you can lead. As youth leaders of today and tomorrow, I hope that you will ensure also that no one is left behind. Even amongst you, make sure that you represent a collective and an inclusive voice. Voices of people living with comorbidities, including non-communicable diseases, disability, those from various sociocultural and economic strata. You must represent them all. If your actions and ambitions for a healthy planet are well organized and inclusive, we as a global population will be the better for it and will be much prepared to handle current and future challenges. We count on you to lead us to build back better. I congratulate you all, and I congratulate Friday and WHO for convening this meet, and I wish you all the success in your deliberations. Thank you very much.
Thank you, Princess Dina, for highlighting the benefits and strengths of meaningfully engaging youth in discussions and deliberations that concern their health. Your address highlights the importance of informed decision-making by young people to protect themselves from exposure to unhealthy commodities. And we all, as young people, will imbibe your energy and draw strength from your address and take this fight against unhealthy commodities forward. Thank you very much.
Thank you.
I would now like to invite our guest of honor, Her Excellency Mrs. Patricia Minnis, Honorable Chair of the Spouses of the CARICOM Leaders Action Network, to address the delegates gathered here today.
Good morning, and thank you, Madam Chair, Your Excellencies, youth advocates and leaders, distinguished guests, ladies and gentlemen. I am honored to be an esteemed guest for this auspicious event. The theme, Meaningful Youth Engagement for Leading Action on Universal Health Coverage and Sustainable Development Goals, is a timely one. As global leaders, we must continue to take a keen interest in the welfare of our children and our youth, while developing programs and supporting initiatives geared towards their well-being. My office, together with the Spouses of CARICOM Leaders Action Network, SCLAN, advocates for the education, health, and well-being of children and adolescents in fulfilling the objection of the United Nations 2030 Sustainable Goals. Most notably, the work of SCLAN is also centered on the objectives of CARIWAC. That's Every Caribbean Woman, Every Caribbean Child initiative. The initiative is the Caribbean's response to the UN's 2030 SDGs. To date, much of our work has been based on our 4 major pillars, which include promoting healthy lifestyles and reducing the incidence of sexually transmitted infections, particularly syphilis, in the region. More recently, effort has also been geared towards raising awareness for the mental health issues in the light of COVID-19 pandemic. According to the World Health Organization data for the 2016 indicated that greater than 340 million children and adolescents aged 5 to 19 were diagnosed as overweight or obese. Later in 2019, WHO reported that an estimated 38 million children under the age of 5 years have been diagnosed either overweight or obese. Today, the numbers continue to rise, and it is imperative that parents and legal guardians make a conscientious effort to combat this issue. Research has shown that a well-balanced diet together with healthy lifestyle changes are the key factors to combat this issue and subsequently reduce the incidence of childhood and adolescent obesity, thereby reversing the global obesity problem. Reducing childhood and adolescent obesity will ultimately lower the risk of non-communicable diseases, the NCDs, among our youth. Locally here in the Bahamas, we have a very high incidence of NCDs within the adult population, and therefore work is being done to reduce this by starting with our youth and primary kids. The data for several recent publications shows that there is an apparent striking increase in child and adolescent obesity since the onset of the pandemic. And this is especially seen in populations that regularly consume energy-dense meals coupled with sedentary lifestyles. Despite the challenges that exist, we must remain vigilant in our effort to mitigate the prevalence of poor diet and unhealthy lifestyle among our youth. Since my tenure in office, much work has been done towards the education of our children and youth with respect to healthy eating and lifestyle changes. In 2018, my office commenced a school garden project in collaboration with the local primary school. The goal of the program is to educate children on the benefits of healthy lifestyle and the preparation of healthy meals while promoting backyard farming as a means of assessing nutritious, organically grown produce. To date, students have reaped several crops of various garden vegetables, which parents have prepared healthy meals at home. Work continues in this regard, and it is our overall goal to eventually introduce this program in all of our schools and around the region. In addition to the physical well-being of our youth, maintaining the mental health of this group is of equal importance. The COVID-19 pandemic has presented with many challenges, and the negative impact on the mental health of our youth has been realized. In the past year, the global population was forced to adjust to a new normal, which resulted in reduced physical and social interaction with families and peers. This rapid transition has not been easy, and coping with the new normal has proven intolerable for a number of persons, especially our youth. There has been increasing reports of mental health issues among the youth, including depression, anxiety, and suicide. To this end, we must continue to put mechanisms in place that are geared towards preserving the mental health of children and youth. Hence, the need to engage our youth in this process. It is imperative that new programs be developed and existing programs be revised to ensure that the diverse needs of individuals are fully addressed during these challenging times. Our young people must be assured that there are avenues which they can take when confronted with difficult or personal circumstances. And we must be mindful that they still first face diverse life issues despite the pandemic. My office, together with SCLAN, continues to promote the awareness of preventing sexually transmitted infections, safe sex, and abstinence among the youth. The WHO reports that each year, an estimated 333 million new cases of curable sexually transmitted infection occur worldwide, with the highest rates among 20 to 24-year-olds, followed by the 15 to 19-year-olds. The WHO also states that 1 in 20 young people is believed to contract STI each year, and only a minority of adolescents have access to any accessible and affordable services. To this end, our youth must be educated on prevention of STIs, be encouraged to practice safe sex, or choose to abstain from all forms of sexual activity to prevent infection. In closing, I commend the organization and all others for hosting this 4th Global Youth Meet on Health. This event is truly another step in the right direction towards preventing and reversing the diverse health-related issues that our youth face. Adopting an integrated public health perspective that places emphasis on the multi-pronged health challenges can only prove beneficial to our youth. Likewise, advocacy to strengthen existing adolescents' health program must continue in our quest to ultimately accomplish the Sustainable Development Goals. To all our youth participating in this event, I encourage you to use this opportunity to share your views on the various issues that will be discussed during the course of this year's meeting. Use the information provided to assist you in making well-informed decisions with respect to your overall health. It is intended that you be provided with information that enhances your knowledge for issues that you face and relevant services be made available to address your needs. Preserving your health and well-being is paramount as you grow to become tomorrow's leaders. Thank you.
Thank you very much, Her Excellency Mrs. Patricia Minnis, for the encouraging address to galvanize youth-led action for good health and well-being. And thank you for highlighting the importance of positive mental health promotion, as well as issues around obesity, very relevant in the COVID-19 context across the world. It was our pleasure hearing from you today. With immense gratitude, I now invite our guest of honor, Honorable Minister, Mr. Dwight Sutherland, Honorable Barbadian Minister of Youth, Sports and Community Empowerment, to please address the delegates.
Pleasant good morning to you, Madam Chair, Your Excellencies, Minister of Health and Family Welfare of the Republic of India, the Honorable Dr. Harsh Vardhan, President and representatives of the Global Youth Meet on Health 2021, Ms. Bonita Sharma, Youth Health Ambassador, other distinguished speakers, distinguished participants, good evening. At the outset, I wish to express my gratitude for the invitation extended to me to be guest of honor at this evening event. Please allow me to congratulate the health-related information dissemination among youth and the World Health Organization for their leadership in organizing this fourth opening ceremony of the Global Youth Meet on Health. A discussion on youth and health today is timely, and certainly the issues which you're seeking to address, namely non-communicable diseases, communicable diseases, environmental health, mental health, and adolescent sexual and reproductive health, are important ones and very relevant to Barbados. In fact, the fight against NCDs is very high on the policy agenda in Barbados because of our high rate of NCDs, which has resulted in the allocation of 12% of our country's annual budget on treatments for and prevention of NCDs. Our view is that these are issues which are not only critical for us in Barbados, but are issues which deserve international discourse. As a minister in Barbados, I play an important role in shaping the policy landscape of my country. As a minister with responsibility for youth, however, I'm acutely aware of the need to listen to our young people, to engage our young people, and to ensure their active participation in policy formulation. All young people, regardless of their backgrounds or challenges, must be included and given platforms to ensure their full participation in initiatives such as this. It must be recognized that young people possess diverse needs, while at the same time possessing knowledge which can be brought to bear in developing policies to meet those needs. We must remember that first and foremost, young people are citizens, and through their own experiences and challenges, have gained insights on how best to navigate some of the most challenging situations. Indeed, of the 1.3 million young people in the world, between 180 and 220 million of them are amongst those living with disabilities. Young people represent persons living in remote and low-income parts of the world who encounter poor or lack of access to critical health services. Young people have also been significantly impacted by the COVID-19 pandemic, with the youth unemployment rate increasing by over 20% in many countries, especially those in the Caribbean. Concomitantly, the rate of unemployment among young people is generally higher than that associated with total unemployment. And in the International Labour Organization's recent report on global employment trends for youth 2020, over 20% of the world's youth is engaged in employment, educating, or training. Sorry, over 20% of the world's youth is not engaged in employment, education, or training. These are just a few of the challenges experienced by our world's youth and which can impact their physical and mental health. In fact, today's youth are ready to address the challenges which affect them, and they eagerly accept opportunities to participate in international discussions such as the recently convened United Nations Intersessional Seminar on Youth and Human Rights, in which they address issues which traditionally have not been considered glamorous, such as public health and sexual and reproductive health. Barbados recognizes that young people need to be acknowledged and be involved in safe, effective, and meaningful activities. This will allow them to realize their full potential, including building better health and well-being. The results will enable young people to thrive and be able to boost the economic and social benefits of their countries. The health and well-being of our young represents the sustainability of our nation. It is in this regard that Barbados has developed an adolescent health strategy to foster the provision of a safe and supportive environment that offers protection and opportunities for healthy development, the provision of much needed health information and skills, enabling adolescents to better understand and interact with society. This entails making good quality, accessible services to meet the needs of adolescents, regardless of age, ethnicity, gender identity, disability, or social economic status. The implementation of this strategy will require collaboration between a number of sectors and agencies, and accordingly, health and wellness among the youth must be viewed as a cross-cutting area which is supported by national policy coherence. Your Excellencies, ladies and gentlemen, failure to focus on adolescents' health will translate into a failure to address many of the NCD risk factors which are being reported. The prevalence of obesity among our youth is on the rise, and harmful alcohol consumption has increased in some regions of the world. Despite our best efforts, adolescents account for approximately 10% of new HIV infections and the leading cause of death among girls between the age 15 and 19 years is attributed to complications arising from pregnancy and childbirth. There's therefore much more to be done to reduce these numbers and address adolescents' health. In order to effectively sustain the progress in ensuring longer lives and healthier young people, timely and effective health policies and interventions are needed, and more investment is needed in health education. This global forum will, I'm sure, identify those specific interventions and introduce meaningful strategies which will redound to the health of our youth. I wish to end with the words of a poet by the name of Indigo Williams. She says, and I quote, "I was given a life to live it, so let me live it. Let me discover, breathe, and be it. I'm not the stereotypical cliche of whatever you imagine me to be." End of quote. This is the cry of the world's young people. So I encourage you, go ahead, do great things, and let us address the world's most pressing issues. I thank you from Barbados. God bless each and every one of you on behalf of the Prime Minister of this wonderful small island we call our home, Barbados. Thank you.
Thank you, Honorable Minister Mr. Dwight Sutherland, for your inspiring address. The delegates of CHIM 2021 will definitely draw a lot of strength, a lot of guidance from your words. Thank you for highlighting the role of young people in reaching out to the communities and the need to adopt an intersectoral approach for adolescent health and well-being. Thank you very much. We feel motivated that Honorable Vice President of India, Shri M. Venkaiah Naidu, has graced the youth health leaders of CHIM 2021 with a message. The third Global Youth Meet on Health in 2015 was inaugurated by Shri Naidu as an Honorable Minister in Government of India. We are very grateful for his guidance and message that will be read by Dr. M. Bhaskar Rao, President Hriday and President Visakha Hriday Shan, and Secretary CHIM 2021. Dr. Rao, over to you. Aarti, can we please have the screen? Thank you.
Your Excellencies, Honorable Health Minister of India, Dr. Harshvardhan, other ministers across the globe, experts from across the globe in the field of health, and my dear young ambassadors of health promotion. Namaste and a very warm welcome to the first virtual global meet, fourth in all. Let me first congratulate Hriday and WHO for conducting this meeting in the very testing times of COVID-19 pandemic. My best wishes for a very successful outing and a positive outcome. Now I'm very happy to inform you that our Honorable Vice President of India, Shri M. Venkaiah Naidu, has gracefully sent his message to the delegates of present GYM, which I am privileged to read out before you all. The text of the message is as follows. Dear global youth leaders, I am delighted to know that you all have gathered virtually from across the globe for the fourth Global Youth Meet on Health to discuss key issues related to health and development. All of us have been impacted by the dangerous COVID-19 pandemic. This global crisis has strongly highlighted the need for global solidarity to combat a common threat. It has also underscored the critical interconnectedness of good health and economic growth. I congratulate Hriday, the World Health Organization, and all other partners for organizing this global meet. I applaud the young participants of this meet for having come together at this important juncture to plan for a healthy future. I hope that the deliberations that you will have here will inspire and motivate all of you to work with vision and vigor to address current and future public health challenges. I hope your actions will lead us to a healthier and more equitable world. I wish you all the very best for your current and future endeavors. M. Venkaiah Naidu.
We are thankful to the Honorable Vice President for this message, and also thank you, Dr. Rao, for conveying it to us. Thank you very much. With this, we would like to invite the last speaker of the inaugural ceremony, Dr. Monica Arora, Executive Director, Hriday, and Co-Chair GYM 2021, to provide an overview of Global Youth Meet 2021 and extend a vote of thanks.
Thank you very much, Prachi. Excellencies, experts, and all the participants of the 4th Global Youth Meet on Health. While our government recently announced shutdown of gyms, spas, and many other public gathering places to break the chain of COVID infection transmission, it is heartening to see that at least one GYM, the Global Youth Meet 2021, is operational in India and globally. I feel privileged and honored to share this unique platform with such high-level speakers, experts, and vibrant youth from around the world. I wanted to take this opportunity to briefly explain why we call this a unique platform. This is a place where many health issues are integrated. We look at convergence, NCDs, sexual and reproductive health, environment, mental health, and development. All of these impact adolescents and youth action will change how we want to have our future policies. Just to briefly provide a history of Global Youth Meets and an overview of what these 2 days would entail, here is a very brief presentation, and I will just share glimpses. We had the first Global Youth Meet in 2006, and the endeavor has been to convert all the youth leaders, ambassadors, into health champions. You will be hearing from many of the alumni of Global Youth Meet who will share their experiences with you and how these trainings, these interactions have actually become a career opportunities for many of the young who were involved when they were in schools. The second Global Youth Meet on Health in 2009 actually led to a global movement, No More Tobacco in the 21st Century, which was endorsed by HRH, Princess Dina Mirid, and she became ambassador for having a tobacco-free future generation. Third Global Youth Meet in 2015 was on Sustainable Development Goals, and the current Global Youth Meet over the next 2 days would focus on how we can meaningfully engage youth. We have been doing various pre-gym activities which started in December 2020, and we had leadership as well as communication workshops. We had several youth who participated from around the globe in these activities to prepare themselves for participating in the Global Youth Meet. We have 26 partners. We have 3 plenaries that you will see over the next 2 days. You will get to participate and hear from experts in these plenaries. We have 16 skill building workshops and thematic workshops, which will provide you with information and bring you up to speed with where the science is on various issues that we are talking about, and will also provide you with leadership, communication, and other skills which will help you lead these as you go back from here to work in your individual regions, countries, at the national and international level. We will also have action plan workshops, which will again be beneficial to have a post-gym agenda. So we do not say goodbye after we finish the Global Youth Meet proceedings tomorrow, but we continue to work together, and we will ensure that the action plans that are developed here, the gym declaration that we will adopt tomorrow, is actually our guiding force for going forward and implementing these activities together. Here is a glimpse of what youth have been doing around the world as pre-gym activities. And the place where you can connect is the Y4H network, which is the Youth for Health network that you see below is a logo. And all of you will be provided links to participate on this network. We would encourage you that you join this network so that you can leverage this resource to strengthen your movements, your campaigns in your countries, in your regions, locally, and get international support as well. Here is a list of our excellent partners who have been supporting us throughout. And I do not have enough time to read all the names, but this is for you will be seeing these logos very often. And when you do workshops, you will interact with many of experts from these various partner organizations who are our technical partners. So in order to bring you up to speed with what the 2 days will be, you will have plenaries, skill building workshops, action planning workshops, and within your regions, your WHO regions, you will get to work with like-minded youth from your region so that you can prioritize what your important regional priorities are and plan activities to work together through the youth who have come together for the Global Youth Meet. With this, I would like to highlight that the gym family has continued to grow since the first gym in 2006. And today in this Global Youth Meet, we are 600 plus participants from 35 countries who are working together to ensure the gym becomes a success. Also, to be able to just bring this excellent inaugural to a close, I would like to extend a formal vote of thanks on behalf of the entire Hriday team. First and foremost, I would like to thank India's Honorable Vice President of India, Shri M. Venkaiah Naidu, for finding time to send this motivating message for all the gym participants. I would also like to express our gratitude to Mr. Dwight Sutherland for sharing his insights on adolescent health and emphasizing on greater investments that will surely be a boost that adolescents and youth are seen to be part of solutions by various governments and agencies as they develop resilient health systems. We will surely share the outcomes of the Global Youth Meet with you, sir, so that we are able to get your continued support as we move forward. We are fortunate to have participation and support of Her Excellency Mrs. Patricia Muniz. Uh, Commitments from such high-level offices gives us the confidence that the outcomes of Global Youth Meet will have very positive outcomes when we move towards building back better with empowered youth who will be engaged in these activities. We are also very, very grateful to our patron of the Global Youth Meet, Her Royal Highness, Princess Dina Mirit of Jordan, who has always endorsed GYM campaigns and has been a strong supporter of youth engagement efforts. We are very thankful to Dr. Svetlana Axelrod at WHO for addressing this August gathering and underscoring WHO's support for meaningfully engaging youth in various WHO efforts. Thank you, ma'am. This gives us a confidence that all the participants here today will get to work with WHO in a more meaningful way in future. I'm especially grateful to our joint co-organizer, WHO Southeast Asia Regional Office. They have been a strong supporter of Global Youth Meet earlier, but the fourth Global Youth Meet, they have been intrinsically involved. So we are very grateful to Dr. Poonam Khetrapal Singh, Regional Director, WHO CRO. Thank you, Dr. Prem Namgyal, for joining us today and delivering the inaugural address. Dr. Neena Rana, Dr. Rajesh Mehta, they have been guiding us actively on all aspects of GYM planning, program, as well as we hope to continue to work with them on implementing the post-GYM activities. Presence of Bonita and our Master of Ceremonies, Prachi, is an example of meaningful engagement of youth voices. Thank you, Bonita. Youth thoughts and enthusiastic participation is the basis that motivates us at Hriday to continue organizing such conclaves in the future. And we would want that youth take the leadership here on, and maybe the next Global Youth Meet can be in Nepal or any other country who may want to have the leadership taken forward. We'll be happy to pass the baton. It is my pleasure to thank President of Hriday, Dr. Bhaskar Rao, who's very passionate about working with adolescents and youth and had hosted the Global Youth Meet 2015 in Vizag. Thank you, sir, for always motivating and encouraging us. I would also like to thank Dr. K. Srinath Reddy, President of the Global Youth Meet 2021 and President of the Public Health Foundation of India, who conceived the idea of the first Global Youth Meet in 2006 in India, and since then has continued to inspire thousands of adolescents and youth throughout the world through this conclave. He is not only a global and national public health leader and expert, but is an inspiration for many of us who have been fortunate to work with him. Last but not the least, we at Hriday would like to thank all our partners, speakers, delegates, and participants for joining us today and making GYM inaugural a huge success. We look forward to continuing all of these collaborations in the future. Thank you.
With this, we come to the end of the inaugural ceremony. We have one small request. If we can request all esteemed speakers to please allow us to take a photograph. And if all of us can turn our camera, then Aarti will help us click this photograph. Aarti, let us know when you are ready to take
Yes, yes, I'm doing that. I'm taking the picture.
Okay.
We have a few cameras that are off.
Daria, Radhika, Tia.
It's done. Thank you. Thank you, everyone.
Thank you, Aarti. Thank you so much. Thank you everyone. We are just making one announcement to connect the participants to the next session. So we request that the participants come back after exactly 10 minutes. It is 7:20 p.m. IST right now, and we will reconnect at 7:30 p.m. IST for the second plenary of the day, which is titled Meaningful Youth Engagement for Leading Action on Universal Health Coverage and Sustainable Development Goals, Priorities and Strategies. So please be back here after 10 minutes. And during the break, we motivate you to meet and greet the delegates, set up networking meetings as feasible, and also don't forget to post your experience and your feelings on the events tab so that we can get connected with you. Thank you very much. We'll see you again in 10 minutes.
Thank you very much.
Thank you.
Thank you.
Meaningful youth engagement for leading action on universal health coverage and sustainable development goals, priorities, and strategies. So my name is Danielle Walwyn, and I am co-chairing with Ms. Katie on universal health coverage and sustainable development goals, priorities, and strategies. So Walwyn, with Ms. Katie.
Ma'am, I think you have opened the portal also in one of the tabs. So if you can just close the conference portal.
I've done it.
Okay, excellent. Sorry about that, everyone. So my name is Danielle Walwyn, and I'm co-chairing, so honored and pleased to be co-chairing with Ms. Katie Dean from the NCD Alliance, and I am the Advocacy Officer at the Healthy Caribbean Coalition. So the Healthy Caribbean Coalition, or the HCC, is an alliance of civil society organizations from across the Caribbean region focused on the prevention and control of NCDs, with an emphasis on childhood obesity prevention. And that's one of the projects that I've been very grateful to work on. And so the HCC has a youth arm, Healthy Caribbean Youth, and it's a network of young professionals from across the region with various backgrounds, again, advocating for NCD prevention and control and a focus on childhood obesity. And so I've been so grateful to be able to network and advocate with these young people. And so us being here resonates so much with us as HCC and as young people from the Caribbean. And I'm very, very excited for our upcoming plenary. And so when we think about why we're here, and I know we've heard it a million times today, but just to reiterate, so we know that young people make up 16% of the world's population. And so when we're talking about sustainable development goals and universal health coverage, youth engagement and prioritizations of issues that affect youth are absolutely critical. It is important for us to all work together to prioritize and strategize effectively to ensure that we are achieving the future that we want and to ensure that no one is left behind. And so our panelists today are going to provide some ways in which us as young people can work together to achieve the SDGs and universal health coverage. I am very, very excited for our panelists. And at this point, I'm going to turn it over to Ms. Katie Dean.
Thanks, Danielle, and great to be with you all today. And my name is Katie Dane. I'm the CEO of the NCD Alliance. It's a real pleasure to be co-chairing this plenary and to be involved with the Global Youth Meet. And really looking forward to this session. Just to kind of add and complement to what Danielle has already said about what we're going to be covering today. I think just in terms of rewinding back to 2015, when the Sustainable Development Goals were being developed, were being adopted, it was very, very clear that young people were really one of the architects in the development of those goals. An ambitious agenda of 17 goals, 169 targets, and health was one of those goals, with universal health coverage, center stage in terms of priority. World leaders back then committed to, ensuring that all individuals and communities have access to quality health services, where and when they need them without suffering financial hardship. And this commitment was obviously reinforced more recently in the 2019 UN high-level meeting on universal health coverage. But 6 years into the Sustainable Development Goals and 9 years left, I think it's very clear that political rhetoric is still to really translate into sustained action at national and regional levels on UHC. We know that half the world's population is still unable to access health services, and 100 million people are pushed into extreme poverty every year because of unmanageable costs of healthcare. And when you look at NCDs, which is the issue that my organisation focuses on, less than half of all countries are on track to achieve the 2030 NCD mortality target. So we've still got a long way to go and not very long to actually achieve it. And as Danielle said, whilst achievement of universal health coverage looks very different in different countries, depending on the health services in terms of the demographics of your population, what is key in all situations is that young people are at the centre of these conversations and a part of decision-making processes. And I think what we've seen over the last 6 years of the SDGs is that the role of young people in the SDGs, as well as universal health coverage, are multiple. Young people are demand creators. They're powerful mobilizers and campaigners that can speak to truth to power. They're innovators and experts, agents of change, implementers, as well as watchdogs, holding governments and industry alike to the commitments that they've made. So what we're trying to do through this plenary is to really kind of tease out some of the strategies, some of the priorities that organizations have in terms of ensuring meaningful involvement of youth for leading action on universal health coverage and sustainable development, and really looking forward to the presentations that we'll hear from our panelists. As Danielle said, we're going to basically have the presentations at the beginning from our 4 panelists, and then at the end we'll go into a Q&A with the audience, and really looking forward to your questions. There's a chat box on the Zoom platform. Everyone will be very familiar with that, having lived on Zoom over the last year particularly. So please do post your questions there, and we'll take them at the end after we've heard of all the presentations. Let me hand back to Danielle, who will be introducing our first 2 speakers.
Awesome. Thank you, Katie. And just to start us off, we have Mr. Brighton Koma. He is the Director of Sustainable Development Solutions Network Youth, Global Cooperation for Youth-Led Action on NCDs. We are so excited to have you. Over to you, Brighton. Alrighty, as Brighton's getting ready to present, we're actually going to head over to Dr. Justin Kunin. So he is the co-chair of the Steering Committee on Universal Health Coverage 2030 Youth, and he'll be presenting on youth as key stakeholders for comprehensive universal health coverage, priorities, and strategies. Off to you, Dr. Kunin.
Hello, can you hear me?
I can hear you well.
And can you see my presentation?
Yes, we can. We'll just need to see it in presentation mode.
Great. Let's just see if we can get this working. That's our first step. Well, let me introduce myself as we do that. As Danielle has kindly said, Justin Kunin, and I'm joining you from Sydney, Australia, where the time has just ticked midnight. So I hope to stay wide alert for you all. But it's really a pleasure to join you. So here locally in Australia, I'm the president of an organisation called ACON, which is the AIDS Council of New South Wales. And it was set up at the height of the AIDS epidemic in the 1980s to tackle that epidemic, and has since evolved to not only work on issues around HIV, but more broadly, the health agenda of the most affected communities. And mostly in my country, that's sexuality and gender diverse people, or LGBTQ people. And so that's what we do. And then, as Danielle has said, I'm also co-chair of the UHC 2030 Steering Committee. Some of you may have heard of UHC 2030, but if not, it's a partnership co-hosted by the World Health Organization, the World Bank, and actually soon the OECD as well. And its role really is to coordinate, I would say, is to coordinate globally the movement for universal health coverage. We have a steering committee And on that steering committee are member states, representatives of civil society. I was one in a previous life. Multilaterals like Gavi and UNAIDS, for example, and also philanthropic foundations. And then around the steering committee, there's a broader community. Our civil society engagement mechanism has about 1,000 members in probably 100 countries now. We have a private sector constituency. And so it's really a multi-stakeholder network to coordinate the UHC movement. In particular, we were involved in preparation for, as Katie has said, the UN high-level meeting on UHC, which took place in 2019, and likely we'll be doing the same again in 2023. So my presentation really has, I would say, two parts. I'm going to give a bit of formal background in terms of UHC because everyone comes from a different background, and Katie, you've already done some of that, so thank you. And then really what I want to do is give a little bit more of a personal reflection of my journey into advocacy and what I wish I'd known when I was starting. So you'll see that what I say sort of falls into those two parts, hopefully relatively naturally. So let's start with the basics, and apologies if I'm repeating things you know, but I've learned over many years that repeating the basics often doesn't go astray. So when we're talking about universal health coverage or UHC, we mean that all people have access to health services where and when they need them, and that it happens without financial hardship. So two key parts is the access to services, but then also the fact that people shouldn't be pushed into poverty to access them. And importantly, we're talking about the full range of essential health services: health promotion, prevention, treatment, rehabilitation, and palliative care. And that's quite important because I think historically UHC has tended to be seen as coincident or equaling treatment, leaving out issues around health promotion, around health prevention. For example, we would say that pandemic preparedness falls squarely into UHC agenda. In fact, maybe it's stage 0 of the UHC agenda, and we need to take a broad view of what UHC look like and not just narrowly refer to what happens within health services. So the diagram that you can see is something that's bandied around quite a lot, and it's what we call the UHC cube, the 3 dimensions. And if you look along sort of the horizontal, the x-axis, we're talking about who gets covered, in other words, extending care to as many people as possible. If you look at the y-axis sort of going into the page, there's a question about what gets covered, and obviously no country can provide every single service under universal health coverage package. And then if you look up vertically, there's a question is, how does it get paid for? Who pays for it? So who gets covered, what gets covered, and how does it get paid for are really the 3 dimensions that we talk about. And to repeat once more the statistics that Katie mentioned, there are 800, well, so half of the world's population don't have access to health services that they need. 800 million people spend at least 10% of their household income on healthcare, and 100 million people are pushed into poverty each year by healthcare expenses. And all of that was pre-COVID. Obviously, things are significantly worse in the wake of the epidemic, or the pandemic as it is now. And even pre-COVID, a full third of the world's population would not be served adequately by health services by 2030, according to current progress. And so we're massively behind, and we'll need to significantly accelerate if we're to achieve the 2030 Sustainable Development Goals. And you can see I've put the key goal around SDG 3.8, which is universal health coverage there for you. SDG 3.8 is about achieving universal health coverage. And as I mentioned, the 2 key aspects are quality health services and then financial risk protection. So not pushing people into catastrophic spending to achieve it. You all know far better than me how the pandemic has impacted young people. And even though that young people are at a lower risk from the virus itself, the pandemic's created other barriers. For example, by limiting access to other health services, including sexual and reproductive health and rights, by increasing unemployment, leading to higher out-of-pocket expenses, by factoring into account, for example, an increase of violence in the home, and many other reasons. So it's clear that young people have been affected, probably disproportionately, as with most marginalized groups. So what do we need to do to achieve UHC? Well, it's what we needed to achieve before the pandemic, and it's what we need to achieve after it. And this is a complicated slide, and I don't want you to worry too much about all of the details, not least because it's a brief presentation, but also we'll be providing the presentations to you, so don't need to take many notes. What I want you to focus on is in the lead up to the high-level meeting in 2019, the UHC movement led by UHC 2030 came together with a series of 6 key asks, and you can see them in blue for the high-level meeting, but really for what the world and our leaders need to do to achieve universal health coverage. And you can see what they are. They are ensuring political leadership. So really, as much as a technical issue, this is an issue of political will. There's the issue of leaving no one behind, which is really the rallying cry of the Sustainable Development Goals as a whole, making sure that we reach the most marginalized people first. There's an issue of regulation and legislation, so a legal issue. There's an issue of quality of care, so ensure that we build not just any care, but quality care, because if care is not of sufficient quality, it's not sufficient. There's a financing imperative around public financing. And there's an issue around, so we call it moving together or collaboration, multi-stakeholder and multi-sectoral partnership. All of this is supplemented by an overarching desire for, well, equality in many dimensions, but particularly gender equality. And then, of course, as we've seen more recently, but it was there in 2019 as well, around emergency and pandemic preparedness. The reason that this slide is a bit complicated is because we've linked quite closely the specific paragraphs in the UN political declaration to each of these key asks. Later I'll provide some information about the political declaration, and you can go back and have a look at it if you like. So that's the 60-second, what do we need to do to achieve UHC? And of course, that's great, but the question is really, I mean, how do we translate sort of these asks into concrete action on the ground? Because I only have 8 minutes and now less than 8 minutes, I'm going to focus on one of these key asks, which I think is particularly relevant to civil society, to communities, and to young people. Not that they're all not important, they're very important, but I'm going to focus particularly on what I think we've seen as the rallying cry for civil society, and that is leaving no one behind. Because often UHC just gets talked about as an issue of financing, you know, it gets conflated with, excuse me, so how do we create national insurance schemes? How do we pool the funds? Who's going to be paying it? All of those are important questions, very important questions. But what they don't do, well, they tackle one of those 3 dimensions of UHC that I mentioned in the cube. But what they don't do is tackle the real issues of equity and discrimination, which are preventing all people around the world from accessing care. The reality is, I hope I don't get in trouble for saying this, but I've said it before, that sometimes governments don't provide adequate services to marginalized populations, not because they can't or because they don't know how to, but because they don't want to, because the issues are too politically sensitive. Even in the lead up to the high-level meeting in 2019, we saw, for example, a huge amount of heated debate around sexual and reproductive health and rights, and around issues on providing health services to migrants. And so that's why equity is really an issue. So we need to include the most marginalized people. And even more than that, if you want to design interventions which meet the most marginalized people, you actually need to include them at every step in the decision-making process and not just make decisions about them. And hopefully this is obvious to all of you as youth advocates. And again, we know what the barriers are for young people around fear of stigma and discrimination, around perceived or real lack of privacy and confidentiality, and especially around sensitive issues like sexual and reproductive health and rights, and like sexuality. So all of this to say is that youth involvement in the UHC movement is critical now. Often we hear people say that youth are the future. And well, yes, it's true that young people are the future, but actually they're the present. A quarter of the world's population between 10 and 24. And if we don't design UHC policies that meet the needs of the young people, we're missing out on a quarter of the world's population, not in 2030, not in the future, but actually now. Now, I wish I could make this as a sort of a more technical session in advocacy and how to do that. Obviously, there's no time to do that in this session, but I know that there've been some terrific other workshops, and you'll have other sessions today. So I want to sort of move towards an end of what I'm saying, just with a bit more of, as I said, of a personal reflection on what I wish I'd known when I was starting my advocacy work, which, okay, I'm not a young person now, but I'm not that far off being a young person. So hopefully I remember still what it was like. And the first lesson for me is that local is important. And often we hear that people think, you know, all of this high-level meeting stuff that's happening in the UN, in New York and Geneva, it must be important. And by implication, what I'm doing in my local community is somehow less important. But I actually think that's the wrong way around. In one view of the world, and it's a view that I like, the whole reason that these national, regional, global superstructures exist is to support what's happening in local communities and to remove the structural barriers to equity and to access which exist. And if what's discussed in New York and Geneva doesn't translate into meaningful change in Kolkata, in Sao Paulo, and Soweto, then what's the point? And so solutions must be local. And you can look at a political declaration at UN and say, well, that's good, but how am I supposed to make this work in my community? Who are the key decision makers in my community, and how can I influence those decisions? And that's the work of thousands, maybe hundreds of thousands of advocates around the world. And that's the work for you for all of you to be doing. I'm being told that I need to wrap up very soon, so let me do that very quickly. Number two, really know what role you're playing as an advocate. Sometimes we're working within the system to create change, working with multi-stakeholder groups, the government, private sector, multilaterals. That's really what we do at UHC 2030 as a multi-stakeholder partnership. But sometimes we need to play a critical voice from the outside. And really, please think about the role that you are playing, because both of those are useful, but know what you're doing when. And finally, let me conclude by saying, start your work now. Don't wait. We don't have the luxury to be better prepared for someone more experienced to come along and do the work. When I started, I wasn't experienced, but I said, if I'm not going to do it, who's going to do it? If I don't do it now, when am I going to do it? So my encouragement to you as I end is, please just start. Take one step and the next step and the next step. And together we'll get there. I've got lots of resources for you on the next page, and we'll share those with you later. Thank you so much.
Thank you so much, Justin. So again, we're talking priorities, we're talking strategies, and you have left us with lots to think about, leaving no one behind, really considering the fact that all of us are coming from such unique contexts, and we need to think local. We need to think what's relevant for our society. And I think the most prominent one, start your work now. We don't have anything to wait on. So thank you so much for that. And just a recall to everyone that we will be answering questions at the very end. All right, it is my absolute pleasure to introduce our second speaker, Mr. Brighton Kauma, Director of Sustainable Development Solutions Network Youth. And I know he wears very many hats, so we're happy to have him talking about the SDGs, Global Cooperation for Youth-Led Action on SDGs. Brighton, the floor is yours.
Thanks so much, Daniela. Are you able to hear me clearly?
I can hear you well.
Thank you so much. I'm very pleased and excited to be invited to speak today. And also thanks to Justin for providing that very thorough and in-depth background to some of the challenges and opportunities that young people are facing globally with respect to universal health coverage. Just a little bit of a background. I just took up my current position as the Global Director for the United Nations Sustainable Development Solutions Network, something that I'll speak about briefly. Prior to joining the UNSDSN, I started my advocacy work in Zambia, which is about 7,000 miles from New York City, where I'm currently seated. And my intention really was because of some of the things that I was seeing in the community. And this is something that I equally want to emphasize as I share my thoughts, experiences, and ideas. I understand that, and this is to many young people that are joining us, the world is like a classroom. and all of us have an opportunity to learn and solve problems. And every individual, society, or community has got its own set of challenges and opportunities that exist, especially with respect to universal health coverage. And I'm going to share specific anecdotes from my own experience and the experience of many young people that I've either met or read about or experienced in my work. So there's something that I experienced when I was growing up. So I was born in this very small community, and I want all of you to imagine a small community, no tarred roads, no piped water. There were moments where I would be walking to school and the bridge that connected my school and my house was washed away by floods. And there were also times where, during times of droughts, young people like myself and others were forced to walk an extra mile to draw water in times of challenges. But one thing that really struck me the most was the fact that each time I went to the nearby clinic, I saw endless queues of mothers with their babies on their backs, young people, all queuing to access services. But I was bothered to understand what was really leading to all those increase in specific health conditions. And I realized that there was a relationship that existed between access to clean water, access to better health services, access to clean air to breathe, and also the relationship with health service provision in the community. So most of the people that were accessing these services in my community were people that had either experienced respiratory conditions because the community was sitting right next to a huge mining company that was extracting gold, diamond, and many other minerals. So there were a lot of negative environmental externalities that were affecting the nearby communities. People were being choked by carbon monoxide fumes. Young people were drinking water that was contaminated with sulfuric acid and other minerals that pollute the water. And they were accessing these services and increasing the demand for most of the services. But these services that existed, specifically health services, were already overwhelmed with demand by so many people. So I realized that why don't we start thinking about preventing young people from accessing these services by addressing the root causes? And at the age of 14, I started running a radio program that was speaking about the relationship that existed between healthcare services in the community and environmental challenges, and ways through which municipalities, local authorities, and people themselves can work together to solve those issues. So it became a nationwide radio talk show that was addressing these issues, and eventually became a national program that was front-loading some of the challenges that young people were faced with. But again, in this experience, I realized that so many young people wanted to speak about environmental challenges, but at the same time, they were like, well, we are facing issues of limited access to sexual reproductive health services. If I go to access health services in my community on sexual reproductive health, I'm going to be judged. How can we create more conducive services where we are going to break down all the barriers to judgment when young people access these services? So we said, since we've got this model, why don't we begin to allow you to use the most accessible, inexpensive medium of communication in that community, which was radio? And young people came up with their ideas to create pop-up radio booths in their communities, and they would raise awareness about sexual reproductive health, would fundraise, and the stories and the ideas and the strategies were rooted in the community, something that Justin spoke about. How do we make sure that from that global perspective, all our work is rooted into ensuring that we support ideas and strategies in the local communities that provide opportunities for scale? And how can we ensure that all we do is ensuring that we support local solutions to address local challenges that feed into broader national and global strategies? As I speak, with my support and the support of other young people, and another organization that I wanted to cite called the Children's Radio Foundation is working across Southern Africa, providing information and referrals to places where young people can access health services without them being pushed into the brink of poverty. So that's pretty critical to understand, because all the work that national governments are doing, and for us to be able to achieve the Sustainable Development Goals, we need to ensure that we support community-rooted strategies and solutions that most young people are leading. With respect to the United Nations Sustainable Development Solutions Network youth programs that I currently lead, we have young people in universities from around the world that are implementing solutions to the local health challenges that they are faced with, and are partnering with their local governments and local municipalities to ensure that universal health coverage is achieved as provided for in the Sustainable Development Goals, and ensuring that we galvanize the different expertise and solutions that are critical to ensuring that young people feel supported. When we look at these big supranational institutions, one thing that I have been advocating for, and which is something critical, is eliminating tokenism, where we see young people being seen as placeholders and not as critical stakeholders that can provide well thought out solutions to some of the leading health challenges that we are faced with. So number one is ensuring that young people are engaged in these universal health coverage discourse from a point of authenticity. And that means ensuring that whatever ideas and solutions they have in their local communities are supported and linked to any other existing government and municipal-based interventions and programs. I also want to emphasize the fact that there are so many solutions that young people have, and irrespective of where you are, as I indicated in my preamble, there are problems with respect to universal health coverage that you should begin thinking about. There might be challenges with young people who are in specific key populations to accessing health coverage that you can begin speaking about, that you can begin advocating for. How can you work with local governments where you are? How can you work with the national government where you are? How can you partner with other existing national and local organizations to ensure that you supplement and offer your expertise? But lastly, I would want to speak about, I think, the three core faculties to what I see as effective advocacy, especially among young people for universal health coverage. I think number one is ensuring that we promote co-creation of solutions to our shared health challenges where we are. Number two is collaboration across organizations, collaboration across institutions, collaboration across municipalities and governments, and not restricting ourselves to our own individual communities, but looking at how we can cross-pollinate our solutions with other people in different countries. And the other thing is cooperation. So in summarizing, I would speak about cooperation, program cooperation, financing cooperation, and ensuring that institutions and local governments create a conducive budget allocation to ensuring that there's universal health coverage that is also targeting and supporting young people.
Awesome. Thank you so much, Brian, again, giving us tools to keep in our toolbox. You first started off with, reminding us that we need to address the root causes of a lot of these issues, and we need to create spaces so that we can have youth-focused, community-grown strategies to tackle some of these major issues. And then you left us with the 3 C's: co-creation, collaboration, cooperation. Thank you so much for that, Brighton. And again, just reminding all that we have an opportunity to ask questions. We're just leaving that to the very end. And our third presentation, I'm going to introduce Dr. Leanne Kamui. She's the Executive Director of International Union for Health Promotion and Education. And she will be presenting on No Global Health Without the Health of Our Globe. And she has her colleague with her, Dr. Claudia Magistretti, Professor, Doctor of Lutheran University of Applied Sciences and Arts, Vice President for the Global Partnership, International Union for Health Promotion and Education. Thank you both. The floor is yours.
Thank you. I'm just getting my screen set up. Great. Okay, I think everyone sees the presentation now, correct?
Fine. Yes.
Okay, good. Well, thank you for having us. So I'm going to introduce our organization first, because I think some of you might not be familiar with who we are. But IUHPE, or International Union for Health Promotion and Education, is an organization that promotes global health and well-being and aims to contribute to the achievement of equity in health, you know, across the world, within countries too. I mean, wherever there is inequity, we want to be able to address that. And we are an independent organization, and that's important because it gives us a lot of freedom to focus on the things that we want to focus on. We are member-based, which means that we also follow our members' leads to some extent, and their interests. And their, you know, and we take advantage from their expertise, their networks, and so on. So it's very much a collective effort, a global effort, and also a professional network. But there is room here for everyone, youth included, and we will talk about one initiative in particular that really calls out to youth participation. And the institution, well, our organization this year is celebrating its 70th anniversary. So, you know, promoting global health and equity isn't something that you do within a couple of years. And so after 70 years, we are still at this, and the challenges are new. The methods remain the methods and the approaches remain fundamentally the same, but there are advances and there are new challenges to meet. And so we do need some fresh minds and some fresh ideas all the time to keep this going and to continue to advance health promotion. So putting all of that in the context of the SDGs, I think it's really, for me, the most compelling part of the SDGs is the fact that they really highlight the interconnection of all of these goals. And you know, for health promotion, it's always a reflex to look at things holistically, and how different sectors and different areas and different fields support each other and interact with each other, and how all of that influences health. And you know, I think possibly the biggest determinant of health of all is the state of our natural environment. And when you look at the SDGs, you can see that, you know, all of the actions that are favorable to health, they also support progress towards the other SDGs. And when you look at the progress towards the other SDGs, you see that they very, you know, explicitly sometimes address the different determinants of health and well-being. So I think that gives a certain lens from which to look at the SDGs. And I think if you apply this lens and you act purposefully, thinking about these interconnections, and set your objectives accordingly, you know, I think action on these can have very broad impacts on society generally and on people's lives. So, you know, for example, when you look at no poverty, well, we know that, you know, economic welfare is really an important determinant of health. You know, income is related to health, and lower incomes is often associated with more health issues among populations. So these are just a few examples, but you can see how, when you look at all of this together, progress on all of these simultaneously can have a huge impact on health, and progress on each of them individually is also good for health, even though that's not necessarily the stated intent. So I'm going to talk about, and well, along with my colleague Claudia, 4 ways that you can engage with us in health promotion and to achieve the social development goals. So first of all, every 3 years, IUHPE holds international world conferences on health promotion. I wanted to mention the previous one. So this is a past event, but it's important in this context. But in 2019, our world conference took place in New Zealand, and the theme was to promote planetary health and sustainable development for all. The context in which this conference was carried out is also important here. There was a big emphasis on indigenous perspectives towards planetary health and what that means and what the different conceptions are of sustainable development, or whether a sustainable development per se is possible. So it was very, there were very good conversations there, and we wanted to continue them, but we do change themes at every conference. But I think that this push that we provided during that conference needs to be sustained over time. So the next conference is taking place in 2022 here in Montreal, Canada, where our international secretariat is based. The focus is on policy, but I think you can definitely find a place within that to continue talking about planetary health, about SDGs, about equity, about the importance of universal health coverage to ensure equity in health for everyone. And so the submissions for this event are open, and also it's a hybrid event. So it means that even if you are in situations where it's difficult to travel, you can still participate. There are various formats of presentation, and we do value very much originality, and there are we welcome artistic contributions, scientific contributions. We also have a format for having lunch with authors. So it's really quite broad in terms of the kind of engagement that you can have, and we will also be putting out information on bursaries for young professionals from lower income nations. So it's an invitation to join us to continue talking about this at our next conference. I'll hand it over to my colleague Claudia now, because she is the chair of this global working group, and she will also talk about another initiative that she has initiated. Claudia?
Yes. Thank you, Liane, and hello to everybody. For your conference, for this conference, that it might be as inspiring and as change producing as much as the Rotorua conference has been. You will now hear about 2 initiatives, as Liane said, that are really rooted and created out of personal encounters at this Rotorua conference. And you will see those initiatives might be promising for you as well. First one is the Global Working Group on Planetary Health. And this Global Working Group is one of several in the United Union of Health Promotion and Education. We have members from all continents of the world, and it is led, I'm co-leader, it is led by a New Zealandish professor who comes from the Maori community. This is not by chance, because the aim of this new formed working group is to enhance planetary consciousness in health promotion, especially also using and adopting the knowledge of indigenous people and indigenous communities. What we mean by this is that Rotorua showed us that we cannot just go on doing health promotion as we always did. We need new ways of thinking and of acting, more related to relationships, to resonance and creating coherence than on the traditional ways of managing and acting upon our planet or our population or our target groups, whatever. So this new thinking we want to promote, and we talk about an eco-social understanding that is rooted in many theories that are upcoming, like the new materialism, or in new methods of research, like rhizomatic research, and many other things. But these new approaches are also rooted in the indigenous knowledge, which means spirituality is important, and the relation and the cooperation in between generations. And I think this conference is, of course, and mainly a youth conference, but in respect with interrelations of other generations as well. Of course, we want to cooperate with other global working groups, as the Global Working Group of Saludogenesis, we will talk soon about. And we contribute to research and teaching by new projects and by a platform we want to create to provide teaching material for trainers in health promotion next year. We also, and this is the next project, aim at contributing to the translation of planetary health to practical applications, and this at all levels, not only on a global theoretical levels, but very much on a local level. This is where our project, People Planet Health project, starts, and where it is a cooperation of Luzern University of Applied Sciences and Nottingham University. This is where we met in Rotorua, the two initiators, but we enlarged the group, and fortunately IUHPE is prominently in it, and the University of Galway. We have a sounding board and an expert committee of many more people from many more continents. And what we do is we want to make visible, as previously was said, the cooperation, the co-creation, and the collaboration that already takes place among young activists and young groups in the realm of planetary health. There is a discussion about how planetary health influences human health and the other way around. And this discussion is not actually needed to be led, because when we see what these people do who locally engage for a healthy planet, they do three things. They create comprehensibility, in the sense that they make an overwhelming, threatening, enormous problem like climate change or like the extinction of resources. They make it locally understandable, and they empower local people to take action and to solve these challenges. And even more, they give the challenges that are so seemingly overwhelming a meaning and a significance, and motivate people to engage and to create community. So this coherence has been proved as a sense of coherence, and is one of the strongest predictors, indicators, moderators for health. So we can surely say, whenever communities engage in whatever way for planetary health, they promote health in their environment, but also for themselves and for the group. And this is what we do now. We have opened a platform to show that the widespread call for action in planetary health, this change is already taking part, because we have all over the world enormous numbers of local groups who already do what governments fail to realize. They already do actions combining planetary and human health. And we want to make these actions visible, connected among each other. And we want to also connect the local grassroots groups to the WHO policy. Let me say 2 sentences about what kind of projects are already here in our group. For example, projects that link sexual and gender health to planetary health, or other projects that try to improve universal health coverage by providing hospitals with good food in disadvantaged areas. All these very small actions altogether give a puzzle and give a picture of a change that already takes place. This website is available in many languages, 9, we are planning the 10th now. And all what people or initiatives have to do is to answer 3 questions. What are you doing? What do you want to achieve? And what is the vision for your future, for a healthy future? And this 3rd question is the basis for what comes next. We want to start in June this year. We want to co-create and co-write a position paper from young activists for the new WHO strategy for health promotion. This is what I wanted to talk to you about. I give back to Liane now.
Thank you, Claudia. And well, the website is right there in the title of the slide, peopleplannethealth.com. So it's quite easy to find it. And once you're there, you can look at all of these examples and read them. So there's a snapshot of what the platform looks like, but you can actually click through all of these and read the other stories that have been submitted. So for the people who are asking for concrete examples of how they can engage, I think this is a nice place to start reading. And, it allows for a very wide range of projects. So if you feel inspired to do some similar work, or if you feel that you have some things to share, please do. I think we would really like to hear from you. Another way that youth and young professionals and students can engage with us is through our student and early career network. So again, IUHP is very much a kind of network of networks. We have a lot of members, we have a working board, we have global working groups, and those all sort of interconnect. But we also have a specific network for the students and people who are early in their career. And early can mean very early. I think there are some of the audience here is quite young. But I think, as Justin Kunin was saying in the opening presentation, youth are very impacted by the climate changes we are seeing today. And they look for ways to engage and for ways to act. And so there are opportunities out there, and there are some welcoming organizations and groups that can support these movements that are being put in place.
So sorry to we are a bit tight on time. So please, if you can, feel free to share, because they're excellent initiatives. Feel free to share them perhaps in the chat, and then we can communicate them to the attendees.
Yes, I'm happy to do that. And that is my last slide in any case, so I'm finished. But thank you all for your attention, and I'll share the links to the initiatives in the chat. Thank you.
Thank you both so much. Again, I think one consistent theme that we're hearing is collaboration. And I think, and was mentioned by one of our attendees, this idea of not working on an issue in silos and recognizing the multiple benefits of looking kind of beyond that one issue and how we can address many. And so last but not least, I'd like to introduce our final speaker, Ms. Poonam Matrejia, Executive Director of Population Foundation of India. And she will be presenting on prioritizing the adolescent and youth health agenda in COVID times. What and how? The floor is yours.
Thank you, Danielle. I'm very excited to be on this panel. I've heard a wide range of approaches, perspectives, and it's really, even this panel gives us lots of opportunity to collaborate across different issues. So thank you for having me. Today, my topic is to focus on global adolescence and youth health agenda during COVID-19 times. I have worked on youth issues for quite some time, but mainly I've been learning, both for our organization and earlier organizations that I've worked, whether it's research or it's creating funding opportunities. So I've always believed that if you invest in young people, you will see a much bigger change in 10 years than anything else we may do. And one of the areas we do at PFI, we are focusing on is pilots, where we are involving youth both in universal healthcare, but also in accountability of the government, especially the public health systems. And we do a lot of behavior change communication, and in fact, for young people, clearly information using digital media and non-digital media. But we also are using artificial intelligence for communicating with young people and responding to their questions. We have a Facebook page called AI Sneha, and I would invite you, I'm not going to talk about it absolutely because there are other things to talk about, and that's not my agenda this evening. So I will invite you to come to our website at the Population Foundation of India and see what we're doing, and we look forward for opportunities to respond, learn, educate, and collaborate. So if you're talking about the impact and challenges faced by young people during COVID, there is no denying the fact that the effects of the pandemic are taking devastating tolls on millions of people. But adolescents and youth are especially vulnerable to the greater societal shifts that we are witnessing today as a result of the virus. PFI has done some studies, but we also are collaborating, looking at all the literature, researched, small and large studies across India and globally. And of course, the recent Lancet articles we have learned much from. So I'm going to bring in the knowledge of others and the data UNESCO, UNICEF have been sharing with us all. So the greatest impact felt by young people actually stems from school closures and disruption in their social networks. So according to UNESCO, for instance, the pandemic has led to impacted 1.8 million students, 320 of which live in India. So from the Indian point of view, we know that there were huge issues around young people, leave alone the big agenda to include young people in universal health coverage for both coverage and accountability that we had. But at this point of time, many of these adolescents may never go back to school. The resulting impact will be significant, and even there are studies across the world. US recent study shows that it will take us a decade to deal with some of the mental health issues and the anxiety issues that COVID has created for young people who already had circumstances that created huge amount of anxiety. We know that suicide rates are very high globally for young people. Highest it is for young people, and India, of course, leads the highest number in that. So with students globally being forced to learn remotely through digital tools, access to education is becoming challenging. So you have 830 million children who don't have access to a computer at home, and girls are at a greater disadvantage. That's no brainer. We all know that. The digital divide is not just amongst the rich youth and poor young people, but it is also boys and girls. And barriers to girls' education existed even before COVID-19, but with classrooms moving online and there being limited, especially if we talk agency and access to technology, has exacerbated the disadvantage that the poor and the girls already had. with one mobile device in the home, it is no brainer that will go to the boy in most circumstances. And that is truly happening. Girls especially are also at higher risk of school dropouts. We are hearing about, this is not the first pandemic, any disaster or pandemic, including Ebola, has led to a large number of school dropouts for girls, much higher than boys, as well as early forced marriages. Now, early forced marriages is an issue that globally we have been tackling, and especially in Asia. And early forced marriages and unmet need for reproductive sexual health and menstrual hygiene products, which Justin and others have referred to, has greatly increased the lack of access. And according to global estimates by UNFPA, the COVID-19 pandemic may end up in 13 million extra child marriages in the years immediately following the crisis. And we don't even know how long this crisis is going to continue, with at least 4 million girls married in the next 2 years, if not more, as family livelihoods evaporate, economic crisis ensue, pushing families into identifying other forms of incomes that are actually harmful for children, including child slavery, etc. And this is one area we have grappled with already, because we see child marriage as a problem, while the community sees it as a solution, and more so at COVID time. And while some adolescents may be feeling safe at home, in their environments, being confined to homes puts an increased risk of domestic violence. We have a huge increase in domestic violence just in India of young people and across the world, especially girls, and all forms of abuse, including online bullying, has increased dramatically in the last 1 year. Up to 85 million girls and boys worldwide may be exposed to physical, sexual, emotional violence over 3 months. They experienced over 3 months, especially during the lockdown in India. And young people also face restrictions of mobility and uncertainties about their future. Their mental health and well-being is increasingly getting impacted. Vulnerable and marginalized youth are at particular risk of COVID-19 and its impact. Young migrants, refugees, young people living in rural areas, minority youth, young persons with disabilities, young people living with HIV. It goes on and on. Every disadvantaged group I could list, and I'm not going to do that. And the experience challenges in accessing healthcare services and social protection was there before, but it's got exacerbated post-COVID. So let me share a few recommendations at this point of time. And I'm going to begin with a recommendation which actually I had in my, in the COVID context, in my presentation, which is we should offer vaccination to young people for a range of reasons. And I am so happy that the government of India announced yesterday that 18 and above in India are going to get vaccinated starting 1st of May. And I also hear that in the US, they made the age 16. So this is actually very important because young people have been anxious, as I said earlier, about their future, both education and employment prospects have been hit. So vaccinations are an important step towards addressing this situation. And I hope more countries in the world will reduce the age at vaccination, especially when we know there is wastage, there's a whole lot of issues, and the world has to work together, absolutely work together on ensuring that there is a even distribution of vaccines across the world. But another, I just want to capture, apart from the studies that PFI has done with youth, which actually I'm going to use for making recommendations and other data we've studied, I want to specifically mention a study that was released just a week ago by a global NGO called the EMPOWER, E-M-Power, the Emerging Markets Foundation. It's a young foundation, but I'm very impressed with the work they're doing. And I was on a webinar last week where it is 18-year-old adolescents, average, who have done this research, who've done the analysis with technical support from EMPOWER. And the 3 points I want to highlight first, theirs is mental health of girls during pandemic. These are the issues in the words of girls that I am, these young adolescent girls. Mental health of girls during the pandemic is a key issue for us to focus on. The need to create collaborations for internships between skilling organizations and corporates. And I was very happy to hear from Claudia that they have an internship program and programs for young girls. The creation of safe spaces for girls within the community. There were other points, but which I've integrated in our recommendations, but a multi-sectoral approach, cooperation, everybody referred to, Brighton, as well as Justin, as well as Claudia and Liani, a sectoral approach, a multifaceted, because young people's issues are multifaceted. Leave no one behind is the is at the heart of the universal health coverage and SDGs. So it is imperative, including ensuring health systems meet the needs of young people, consulting youth in development of health, economic, social interventions, not just as a formality, but truly engaging them. We don't know. I'm not close to Justin's age, which is closer to young people, but we really need to still understand young people. I don't believe that our generation and the globe is, globally, we have an understanding of young people's realities. So we absolutely need to bring them in. It is imperative to build capacities of public schools, government schools to use technology and digital tools, because it's not going away. COVID is not going away anytime soon. Championing comprehensive sexuality education, not just for in school, but out of school too, and transforming and caregivers must also be aware. It's not enough to only have sex ed for young people, but also caregivers must be educated on reproductive and sexual health and well-being, mental health being of young people, delivery of mental health services in the post-COVID arena. We don't have a choice if we don't want a messed up world. Economic and social empowerment of girls, investing in capacity and skill building. And finally, I'd like to really make a big plea for not just universal health coverage, but leaving no one behind. We need to build capacities of frontline health workers and strengthen their outreach services to improve access to reach correct information and services to young people. And finally, my final point, which even Justin brought up about funding. We cannot use COVID as an excuse to not invest in young people. And I'm going to end with that. Sorry, Katie, if I've taken a few more minutes than I should have.
Thank you, Poonam. That was fantastic. And thank you for obviously sharing the huge and manifold impact of COVID on youth and adolescents around the world, and the implications going forward in order to ensure that, governments, the international community, truly build back fairer and better from this pandemic going forward. So thank you all for those fantastic presentations. I think this plenary could go on until midnight. We're all so passionate about this subject, but we're going to move on to the Q&A section. So thank you to those of you that have already sent in your questions. There's time to still plug them in if you have them right now. What I'm going to do is pose a couple of questions at a time to the panel and ask for some responses, and then we'll try and get a couple of rounds in. And I understand from the organisers that we're able to go a little bit over time in order to try and get through as many questions as possible. So I think this first question that we received from Natika in India is a really good one, and it touches upon something that Justin mentioned at the beginning. The question is, the idea of universal health coverage is straightforward, but as a youth advocate, I find it really difficult to apply it to my work. The idea just doesn't resonate with young people. It's more about health systems, whereas sometimes prevention and youth priorities don't really find a focus. So the question is, how can we decode universal health coverage? And how do we build capacity for UHC advocacy? And then a second question that I'll pose at the same time is from Astha in India. Are there any examples of youth-led initiatives to achieve universal health coverage at a local level? So if we could start with those two, I don't know who wants to go first. Poonam, yeah.
Happy to, since especially since.
Oh, we can't hear you, Poonam. Yeah.
Oh.
There you go. Yeah.
Yeah. So youth-led initiatives. There are a lot of youth-led initiatives in India, but are they focusing on universal health coverage? No. We, except the pilot that I did mention, where we are trying to mobilize young people around accountability and youth and UHC, but universal health coverage is something we have been advocating. A lot of NGOs, we're just about introducing it to young people. I think we're at a very early stage, but we need to do a lot more work because advocacy by young people today is being taken seriously by governments across. And I will definitely say that for India. For instance, we did a youth consultation across the country, asking them what the issues were, including trying to explain to them universal health coverage and asking them how they can participate and what they thought. And do you know that Government of India, which is sort of distancing itself by and large from NGOs, but we have a very good relationship with the Health Ministry, they asked us if they could sit into meetings across the country that we were having, regional meetings where young people were speaking, if we could invite their staff at the state level. And then at the central level, they collaborated on the meeting with us, and they had, I've never seen senior leadership within government sitting in on meetings which are literally led by youth. And by the way, we made a decision in PFI that old people like me will not even go to the meeting because it often hinders young people to express themselves. So we had the young people in our organization going. And, we were really surprised. I just want to end by saying that the health secretary invited health secretaries from all the states, the national government, for a meeting. And they asked PFI to come and present what young people had said. It was called Listening to Young People. Not only, this is our experience, young people that I speak to are feeling very encouraged. They don't feel there is just tokenism. We started with tokenism 2 decades ago. So my real response to the question is we need to engage deeply with young people on helping them understand the simplicity of universal health coverage and how, given their numbers, given their voice, given their energy, we really, I think, I don't know if Justin and others agree with me here, but to make universal health coverage a real advocacy issue, much stronger than we've been able to do in all the collective work many of us done, we have to engage youth, and youth have to be included in that. And as far as services, prevention and prioritization, absolutely. But once again, prevention is what young people need. Even, but I always say young people don't need family planning. My core area of work is family planning. I always say they need prevention from unwanted pregnancy. So they need access to contraception. They need access to reproductive health services, and prioritizing young people's health services. They're healthy people. We need to prevent not just sexual reproductive health, pregnancies and other, but we need to prioritize to ensure that we have healthy young people with so many, not just COVID, but with all the other NCDs that we have to invest in young people and their prevention. So whoever is asking the question, I am very happy to take a conversation further with you outside instead of taking more time.
Thanks, Poonam. And let me bring in Justin here. What about from a kind of UHC 2030 perspective in terms of how you go about building capacity for UHC advocacy? And a kind of second follow-up question for you that was specifically posed, how do you include people who are part of the decision-making process, but essentially excluded from services because of financial hardship or exclusion of certain services or treatments? You're on mute, Justin.
I think we'd learned to get off mute by now, but here we go. So first of all, I think those are both excellent questions. And to the first one, you know, there's this thing called UHC. It's about health systems. I can sort of see that it's important, but how does it relate to me and my work? That's an attitude held not just by young people, by the way, but by lots of communities around the world. And actually, that's our job to do. So let me let you into a secret. I come from the HIV movement. A lot of people in the HIV movement are absolutely petrified of this thing called universal health coverage, because what they've built over many years is particular ways of interacting and including key and marginalized populations. And they're really scared that when UHC gets rolled out, some sort of bland or anemic version of UHC, which only talks about sort of national health insurance programs and leaves aside the key equity and inclusion issues, including young people, gets called UHC and it's not actually UHC. So there are some real concerns about what UHC could look like. And then on the other side, it's a tremendous opportunity to bring together all of the issues that all of the people have been working on for so many decades, you know, infectious diseases, NCDs, disability, together into a single coalesced, unified movement for health for all. And so that's the challenge. And my answer is that UHC is a living beast and it becomes what we make it. And so part of my reason for getting involved was to help mold UHC into something that would be useful. So it's the UHC that we want, not the UHC that gets handed to us on a plate. And so if you're feeling that, well, I'm not really sure how that relates to me, we have some work to do to make it relate to you. One tool that might be very useful is the upcoming UHC 101 toolkit coming from the UHC 2030 Civil Society Engagement Mechanism. And if you do one thing as a result of what I've said today, I'd encourage you to join CSEM, the UHC 2030 Civil Society Engagement Mechanism, csemonline.net. I'll post the link in the chat. And that's where you'll hear about all of these advocacy and training and sort of the translation exercise. Why is UHC relevant to you? And it's also where you hear, I know there was another question about sort of some examples of youth action at the local level. So that's how to stay connected. I'll put as I said, the links in the chat. The second question was around how do you include people who are part of the decision-making process, but they're not actually receiving the services they need. And I think there was a particular comment around NCDs, and it was a comment from Nigeria that, you know, these NCDs are simply not included in the programs. There's low patronage, there's high out-of-pocket payments. What do we do in those situations? And I think when people are not included, you have to do a bit of a diagnostic exercise. Are they not included because there's not enough money? Are they not included because there's not enough technical know-how? People don't know how to provide the services and money is being used inefficiently, for example, or simply there's just not the knowledge. Or are they not being included because for political reasons? You know, many of the marginalized groups, the key populations that we talk about, are not included, not because there's not enough money. They're included because the governments don't want to talk about sensitive issues. So it's difficult to answer that question without doing some more diagnostic work. And I think that's important. In the case of Nigeria and NCDs, well, it's always a bit dangerous to start talking about a particular country, but all right, it's 1:30 in the morning, I'm going to be dangerous. NCDs are typically not as politically sensitive as some of the other issues. So I would have thought that, you know, it's probably not a political exercise in getting people involved necessarily, but I'm happy to be corrected. one of the things we talk about in the UHC movement is public financing and the need to generate sufficient domestic resources through progressive taxation, with a view we call for in those UHC key asks of countries spending at least 5% of their GDP on domestic health spending. There's a call in the high-level meeting political declaration for countries to spend at least 1% more of their GDP than they're currently spending. That's an absolute minimum and probably not enough. And I don't want to pick on particular countries, but I think that Nigeria is something like 1.2%. There's no way you can get to UHC if you're spending 1% of GDP. So I would say that in the case of Nigeria and NCDs, it's probably an issue of the government needs to raise more revenue through appropriate taxation and spend it wisely. But that question can have many answers, and I think I'll stop there.
Thanks, Justin. So I'll try and bring in two more questions that have come up, and Leanne and Claudia, if you want to jump in here. So there's a question around data, which is obviously so important for advocacy and for universal health coverage. And the question was, the first point of exclusion of youth is still lack of data. Many health systems don't even have specific indicators for young people, despite them being the majority of the population. And from an NCD perspective, I can definitely say that, because most of the indicators are actually focusing on between 30 to 70 years old, for example. So the question is, how can WHO or other stakeholders help countries to collect and use data for youth? And then we've also got another question, which actually links to something that Brighton said earlier. Brighton has to jump off, but I want to bring it up. He mentioned the importance of moving beyond tokenism to actually meaningful involvement, which is obviously the focus of this plenary. And the question was, for youth participation to be effective, we must have a twofold approach. While young people are encouraged to create solutions and advocate for favourable policies, it's also important that all leaders institutionalise meaningful youth participation, and it has to be a two-way street. So if any panellists could provide some concrete suggestions or examples of how to actually institutionalize meaningful participation of youth within national responses, that would be great. And then I think we're going to have to wrap up. Who
Okay,
wants to take
it short,
Yeah.
if I may. Well, in a way, our initiative of People Planet Health is an example, because we just give our rooms and connections and tools for young people in order that they contribute to the future strategy of WHO. We have similar things on the European level, where we start now to connect the first data about young adults, because it's true what you say, most young adults are healthy, but not all of them. And we have the big group of the so-called needs, the not in employment, education, or training young people who are in this condition because of health problems, and the condition that causes new health problems. So we have to make young adults and young people a topic. And I think this is a way we could start to prepare the ground for the knowledge that it's important to gather data. And the other thing is, we have a whole lot also in health participation. We have the LGBTQ movement, who now in Switzerland managed to have a program for suicide prevention in the coming out process that was established by them, programmed by them, and that is now financed by the government. It just needs, as Leanne said, 70 years almost, not to as long as IUHPE is, but I would like to give over to you, Leanne.
Yes, thanks for that. And I do think that, again, that initiative is a good example of how you can sort of show meaningful engagement in very concrete ways. So I think that's useful. The other bit around data, I would say that you know, maybe this is true. Maybe there's not always enough data on health outcomes specifically among youth everywhere. But I think we live in a world where there is a lot of data. And I think some data exists that can certainly inform action towards youth, and that points to inequities. So if you have data in your community on poverty levels or income in general, if you have data in your community about the kinds of services that people use, if you have data around availability of food for families, especially fruits and vegetables and things like that, I think you can triangulate a lot of data to tell stories about what your community needs and how, and you can extrapolate from that how youth are affected. So I think, you know, certainly we need more, you know, indicators and precise statistics on certain things. But again, from a health promotion point of view, I think what you want to look at is what is structurally there, what is your community providing, how can you advocate for some change that will help reach everyone, including youth. I think that might be one way to work around the problem without necessarily being in a waiting stance of not having the data. I think there's plenty of data to motivate action now.
Great, thanks, Leanne and Claudia. So I think we're going to have to wrap this session up because we're about 10 minutes over. But let me start by thanking all of our panelists for really great presentations, to Justin, to Brighton, to Poonam, to Leanne, and to Claudia for your excellent presentations. And just to really start off with a few kind of takeaways from my side, and then I'll pass over to Danielle to wrap it up. I think what we've heard very clearly is that, you know, universal health coverage needs to be unpacked. It needs to be decoded to ensure that we've got strong youth engagement and advocacy and activism around the world. Essentially, what we're talking about is health for all. It has 3 dimensions that Justin very clearly kind of presented in the cube. We need to focus on all of them, but let's make sure that we don't forget the leave no one behind equity angle to all of this, which often does get forgotten by governments, unfortunately. It's also well beyond just health. I think Leanne's presentation really nicely presented the connections between health and all of the other sustainable development goals. And that if we're actually going to make progress on universal health coverage, we need to think about the broader upstream determinants such as poverty, unemployment, conflict, all of these different issues that will impact upon how we actually achieve universal health coverage for everyone. I think a common thread across all of the presentations was think globally but act locally, and the importance of community-led solutions, which are so important. And just to kind of reiterate something that, you know, both Justin and I mentioned in our presentations, were the Universal Health Coverage high-level meeting in 2023. That's a perfect example of where you've got a big global multilateral process that might seem very distant from everyone, but actually it will take, you know, people around the world to really ensure that their governments are focusing on it, that they're ensuring that, you know, key priority issues are being taken up by their governments, and that we end up with a strong outcome in New York in 2023 for universal health coverage. And also I really liked the point around, you know, moving beyond tokenism to meaningful involvement. And in order to do that, I think Brighton said this, we need co-creation, collaboration and cooperation. Fantastic points. Let me hand over to Danielle for some closing remarks.
Katie, that was excellent. That literally covers everything that I was going to say. Fantastic closing remarks. Again, a big thank you from me to our panelists. Just a few things again to reiterate, because I'm just echoing kind of Katie's sentiments with leaving no one behind, really creating meaningful spaces for these youth-grown initiatives that need to be sustainable and need to be inclusive, and new ways of thinking. Claudia, I think this is in your presentation, you know, thinking, you know, I think now more than ever, especially in the current COVID context, we need to be innovative in how we're approaching our next steps. And thankfully, that is our specialty as youth. That's our specialty. So bring us on board, let us get those innovative strategies going. Just in kind of your point on, you know, universal health coverage, I think I'm just talking to my youth here again. If we want this universal health coverage, it's clear that we need that our input is so critical to get the universal health coverage that we want. So again, another space for us to really advocate. And Poonam, what you had said kind of resonated that, as a result of COVID, the vulnerable have become even more vulnerable, but COVID-19 is not an excuse to not invest and prioritize youth. So just want to leave on that. Thank you again so much, everyone, for joining, and wishing you all the best for the rest of the meet. There's so much more to go. We have another whole day ahead of inspiring remarks by young people and allies. And so we hope that you join. Thanks so much for joining us today. Wishing you all the best. Take care, stay safe.
Thank you all the panelists. One last thing, we need a photograph. So please don't go away, just give us a second. Please turn on your cameras if you haven't already. Aarti, are you ready?
Yes. Done. Thank you.
Great. So tomorrow at 3 p.m. Indian Standard Time, we start with the workshops. We have a youth-led plenary. It is all about young people, by young people, and of course, the closing ceremony where we release the GYM Declaration. Thank you so much, everyone. Take care, stay safe. Bye-bye.
Radhika, if I can just take one moment and mention it that all the participants will still have access for another 30 to 40 minutes to set up their meetings in the section lounge. So they can go to the section there and there will be virtual tables available, and you pick a seat for yourself and you will get to interact with other young people as well as other delegates who are on that table. So for another 30 to say until for the next 40 minutes, we will keep the platform live so that you can keep using this feature.
Thank you. Bye-bye.
Take care. Bye-bye.